All the way around here. Got a challenge.
Hey. Good to see you. What's going on, brother? Good to see you. How's that going? Good.
Mr. President, we don't want to lose you over that ladder.
Absolutely.
Mr. President, good to see you.
Yeah, they threw in the Illinois guy this time.
Hey, Mr. President.
With Jocelyn available,
You guys are doing fine.
Mr. President, Marcia White.
Morning. Good to see you again, Paul Ryan. Good. Good to see you.
Thank you.
That was nice of you to say so. Appreciate it. Your partner. We'll work on the DC.
Hey, Vice President Peter Ryan. Nice to see you.
Yeah.
Thank you.
Hi, I'm Marcia White. How are you? I'm well.
Hey, yeah, Paul Ryan, nice to see you. I'm doing great. Good to see you.
Morning, John Clyde.
Actually, you did.
Everybody, please have a seat. Come on, man. Good morning, everybody. Welcome. Thank you so much for participating today. I am very grateful to all of you because I know how busy you are. What I want to do is just make a few brief remarks on the front end, and then we're going to allow leadership from both the House and the Senate to make some opening remarks, and then we will dive in. Last year, obviously, was one of the toughest years we've had on record, and all of us, in one way or another, were devoted to focusing on breaking the back of the recession, restoring economic growth, putting people back to work. We've still got a long way to go, and so I know both the House and the Senate are interested in how do we propel economic growth forward, how do we create more jobs. I was very pleased to see a glimpse of bipartisanship in the Senate recently in passing a jobs bill, and I hope that continues, and I know there are going to be some additional pieces of legislation moving forward around, for example, making sure that small businesses can get financing. And those are the kinds of things that I think all parties and both chambers should be able to agree to. So I'm very much looking forward to working with you on all those issues. I have said repeatedly, I said at the State of the Union, I said last night when I was meeting with the Business Roundtable, that in addition to dealing with the immediate challenges we face in the recovery, it's absolutely critical that we also look at some fundamental structural problems in our economy that are hurting families, hurting businesses, and having an impact on the exploding deficits and debts that the federal government, but also state governments, are carrying. And it's for that reason that last year, around this time actually, I hosted in the White House a healthcare summit and indicated to Congress that it was absolutely critical for us to begin now moving on what is one of the biggest drags on our economy and represents one of the biggest hardships that families face. Some of you know that I get 10 letters out of the 40,000 that I receive every day for me to take upstairs to the residents and read every single night. And these are letters from all across the country, constituents from every walk of life. And I can tell you that at least 2, sometimes 5 of the 10 letters relates to the challenges that people are experiencing in healthcare every single day. I'll get letters from parents whose children have pre-existing conditions, and maybe those children were able to get health insurance when they were young, but now they're growing up, they're about to move out, and they can't get insurance no matter what job they find. I hear from small businesses who have just opened up their new rates from their insurance company, and it turns out that their rates have gone up 20, 30, in some cases 35%. I hear from families who have hit lifetime limits, and because somebody in their family is very ill, at a certain point they start having to dig out of pocket, and they are having to mortgage their house, and in some cases have gone bankrupt because of health care. So this is an issue that is affecting everybody. It's affecting not only those without insurance, but it's affecting those with insurance. And when you talk to every single expert, and you just talk to ordinary people, and you talk to businesses, everybody understands that the problem is not getting better, it's getting worse. Right now, it's projected that premiums for families with health insurance, not people without health insurance, but with health insurance, will almost certainly double over the next decade, just as they doubled over the past decade. In the individual markets, it's even worse. Businesses are having to make decisions about just dropping coverage altogether for their employees. If they're not doing that, then the money that they are spending on health care is money that otherwise could have gone to job creation. And I don't need to tell people here about the effects on the federal budget. We've got some people who've been working a very long time on figuring out how can we control the huge expansion of entitlements. Almost all of the long-term deficit and debt that we face relates to the exploding costs of Medicare and Medicaid. Almost all of it. I mean, that is the single biggest driver of our federal deficit. And if we don't get control over that, we can't get control over our federal budget. Now, I'm telling all of you things you already know. Maybe more personally, I should just mention the fact that I now have about as good health care as anybody could have. I got a doctor right downstairs. And all of us, when I was in the Senate, and all of you as House and Senate members, have good health care. But remember, maybe when you were younger, when you were first starting off, I can certainly remember Malia coming into the kitchen one day and saying, "I can't breathe, Daddy," and us having to rush her to the emergency room because she had asthma. Or Sasha, when she was a baby, getting meningitis and having to get a spinal tap and being on antibiotics for 3 days, and us not knowing whether or not she was going to emerge okay. In each of those instances, I remember thinking, while sitting in the emergency room, what would have happened if I didn't have reliable health care? My mother, who was self-employed, didn't have reliable health care, and she died of ovarian cancer. And there's probably nothing that modern medicine could have done about that. It was caught late, and that's a hard cancer to diagnose. But I do remember the last 6 months of her life, insurance companies threatening that they would not reimburse her for her costs, and her having to be on the phone in a hospital room arguing with insurance companies when what she should have been doing is spending time with her family. I do remember that. Now, everybody here has those same stories somewhere in their lives. Everybody here understands the desperation that people feel when they're sick. And I think everybody here is profoundly sympathetic and wants to make sure that we have a system that works for all Americans. I was looking through some of the past statements that people have made, and I think this concern is bipartisan. John McCain's talked about how rising health care costs are devastating to middle-class families. Chuck, you've been working on this a long time. You've discussed the unsustainable growth in Medicare and Medicaid in our budget. Mike Enzi, who's worked on this and partnered with Ted Kennedy on a range of health care issues as the chairman of the committee, you said that small businesses in your home state are finding it nearly impossible to afford health care coverage for their employees. And you said the current system's in critical condition. And Mitch, you've said that the need for reform is not in question. And obviously there are comparable statements on the Democratic side as well. So here's the bottom line. We all know this is urgent. And unfortunately, over the course of the year, despite all the hearings that took place and all the negotiations that took place, and people on both sides of the aisle worked long and hard on this issue, and this became a very ideological battle. It became a very partisan battle, and politics, I think, ended up trumping practical common sense. I said at the State of the Union, and I'll repeat, I didn't take this on because I thought it was good politics. This is such a complicated issue that it's inevitably going to be contentious. But what I'm hoping to accomplish today is for everybody to focus not just on where we differ, but focus on where we agree. Because there actually is some significant agreement on a host of issues. I mean, I've looked very carefully at John Boehner's plan that he put forward. I've looked at Tom Coburn and Senator Burr's plan that's been put out there. Paul Ryan has discussed some of the issues surrounding Medicare. I've looked at those very carefully. Mike Enzi, in the past, you've put forward legislation around small businesses that are very important. And so when I look at the ideas that are out there, there is overlap. It's not perfect overlap. It's not 100% overlap, but there's some overlap. Now, what I did, what the White House did several days ago was we posted what we think is the best blend of the House and the Senate legislation that's already passed. The basic concept is that we would set up an exchange, meaning a place where individuals and small businesses could go and get choice and competition for private health care plans, the same way that members of Congress get choice and competition for their health care plans. For people who couldn't afford it, we would provide them some subsidies. But because people would have some pooling power, the costs overall would be lower because they'd be in a stronger position to negotiate. We think it is a plan that works with the existing system, the employer-based system, the private health care system, but allows a lot of people who currently don't have health care to get health care. More importantly, for the vast majority of people who do have some health care, it allows them to get a better deal. We also have some insurance reforms in there that, for example, prohibit people who have pre-existing conditions from being banned from getting coverage. We also talk about how we can help to make the Medicare system more effective and provide better quality care. In each of these cases, there are corresponding ideas on the Republican side that we should be able to bridge. So I promise not to make a long speech. Let me just close by saying this. My hope in the several hours that we're going to be here today, that in each section that we're going to discuss, how do we lower costs for families and small businesses? How do we make sure that the insurance market works for people? How do we make sure that we are dealing with the long-term deficits How do we make sure that people who don't have coverage can get coverage? In each of these areas, what I'm going to do is I'm going to start off by saying, here are some things we agree on. And then let's talk about some areas where we disagree and see if we can bridge those gaps. I don't know that those gaps can be bridged. And it may be that at the end of the day, we come out here and everybody says, well, you know, we have some honest disagreements. People are sincere in wanting to help, but they've got different ideas about how to do it. And we can't bridge the gap between Democrats and Republicans on this. But I'd like to make sure that this discussion is actually a discussion and not just us trading talking points. I hope that this isn't political theater, where we're just playing to the cameras and criticizing each other, but instead are actually trying to solve the problem. That's what the American people are looking for. As controversial as the efforts to reform health care have been thus far, when you ask people, should we move forward and try to reform the system, people still say yes. They still want to see change. And it strikes me that if we've got an open mind, if we're listening to each other, if we're not engaging in sort of the tit for tat and trying to score political points during the next several hours, that we might be able to make some progress. And if not, at least we will have better clarified for the American people what the debate is about. So with that, I just want to say again how much I appreciate everybody for participating. And I am going to now turn it over to Senator McConnell so that he can make some opening remarks, and we'll just go back and forth between the Democratic leaders in the Senate and the Republican leaders, House and Senate, and then we'll just open it up and we'll start diving in. All right?
Thank you very much, Mr. President. John Boehner and I have selected Lamar Alexander of Tennessee to make our opening framing statement, and let me turn to him.
Thanks, Mitch, and John. Mr. President, thank you very much for the invitation. We appreciate being here. Several of us were a part of the summits that you had a year ago, and so I've been asked to try to express what Republicans believe about where we've gotten since then. As a former governor, I also want to try to represent governors' views. They have a big stake in it. I know you met with some governors just the last few days. Yeah. And we believe that our views represent the views of a great number of the American people who have tried to say in every way they know how, through town meetings, through surveys, through elections in Virginia, New Jersey, and Massachusetts, that they oppose the health care bill that passed the Senate on Christmas Eve. And more importantly, we want to talk about, we believe we have a better idea. And that's to take many of the examples that you just mentioned about health care costs. Make that our goal, reducing health care costs, and start over. And let's go step by step toward that goal. And we'd like to briefly mention, I'll briefly mention, and others will talk more about it as we go along, what those ideas are, what some of them are, what some of the suggestions we have are. I'd like to begin with a story. When I was elected governor, some of the media went up to the Democratic leaders of the legislature and said, what are you going to do with this new young Republican governor a few years ago? And they said, I'm going to help him, because if he succeeds, our state succeeds. And they did that for us, the way we worked for 8 years. And but often they had to persuade me to change my direction to get our state where it needed to go. I'd like to say the same thing to you. I mean, we want you to succeed, because if you succeed, our country succeeds. But we would like respectfully to change the direction you're going on health care costs, and that's what I want to mention here in the next few minutes. I was trying to think about if there were any kind of event that this could be compared with, and I was thinking of the Detroit Auto Show, that you had invited us out to watch you unveil the latest model that you and your engineers had created, and ask us to help sell it to the American people. And we go and you do that, and we look at it and we say, hey, that's the same model we saw last year. And we didn't like it, and neither did they, because we don't think it gets us where we need to go, and we can't afford it. So as they also say in Detroit, again, we think we have a better idea. Your stories are a lot like the stories I hear. When I went home for Christmas, after we had that 25 days of consecutive debate and voted on Christmas Eve on health care, a friend of mine from Tullahoma, Tennessee said, I hope you'll kill that health care bill. And then before the words were out of his mouth, he said, but we've got to do something about health care costs. My wife has breast cancer. She got it 11 years ago. Our insurance is $2,000 a month. We couldn't afford it if our employer weren't helping us do that, so we've got to do something. And that's where we are. But we think to do that, we have to start by taking the current bill and putting it on the shelf and starting from a clean sheet of paper. Now, you've presented ideas. There's an 11-page memo on I think it's important for people to understand there's not a presidential bill. There are good suggestions and ideas on the web. We've made our ideas, but it said it's a lot like the Senate bill. It has more taxes, more subsidies, more spending. So what that means is that when it's written, it'll be 2,700 pages more or less, which means it'll probably have a lot of surprises in it. It means it'll cut Medicare by about $500 billion and spend most of that on new programs, not on Medicare and making it stronger, even though it's going broke in 2015. It means there'll be about $500 billion of new taxes in it. It means that for millions of Americans, premiums will go up because when people pay those new taxes, premiums will go up, and they will also go up because of the government mandates. It means that from a governor's point of view, they're going to be what our Democratic governor calls the mother of all unfunded mandates. Nothing used to make me madder as a governor than when Washington politicians would get together and pass a big bill, take credit for it, and then send me the bill to pay. And that's exactly what this does with the expansion of Medicare. And in addition, it dumps 15 to 18 million low-income Americans into a Medicaid program that none of us would want to be a part of because 50% of doctors won't see new patients. So it's like giving someone a ticket to a bus line where the buses only run half the time. When fully implemented, the bill would spend about $2.5 trillion a year, and it still has the sweetheart deals in it. One's out, some are still in. I mean, what's fair about taxpayers in Louisiana paying less than taxpayers in Tennessee? And what's fair about protecting seniors in Florida and not protecting seniors in California and Illinois and Wyoming? So our view, with all respect, is that this is a car that can't be recalled and fixed and that we ought to start over. But we'd like to start over. When I go down on the floor, and I've been there a lot on this issue, some of my Democratic friends will say, well, Lamar, where's the Republican comprehensive bill? And I say back, well, if you're waiting for Mitch McConnell to roll in a wheelbarrow in here with a 2,700-page Republican comprehensive bill, it's not going to happen because we've come to the conclusion that we don't do comprehensive well. We've watched the comprehensive economy-wide cap and trade. We've watched the comprehensive immigration bill. We had the best senators we've got working on that in a bipartisan way. We've watched the comprehensive health care bill, and they fall of their own weight. Our country's too big, too complicated, too decentralized for Washington, a few of us here, just to write a few rules about remaking 17% of the economy all at once. That sort of thinking works in a classroom, but it doesn't work very well in our big, complicated country. And it doesn't work for most of us. I mean, if you look around the table, and I'm sure it's true on the Democratic side as it is on the Republican, we've got, shoe store owners and small business people and a former county judge, and we've got 3 doctors. We've got people who are used to solving problems step by step. And that's why we said 173 times on the Senate floor in the last 6 months of last year, we mentioned our step-by-step plan for reducing health care costs. And I'd like to just mention those in a sentence or two. You mentioned Mike Enzie's work on the small business health care plan. That's a good start. It came up in the Senate. He will explain why it covers more people, costs less, and helps small businesses offer insurance. 2, helping Americans buy insurance across state lines. You've mentioned that yourself. Most of the governors I've talked to think that'd be a good way to increase competition. Number 3, put an end to junk lawsuits against doctors. In our state, in half the counties, pregnant women have to drive to the big city to have prenatal health care or to have their baby because the medical malpractice suits have driven up the insurance policies so high that doctors leave the rural counties. Give states incentives to lower costs, number 4. Number 5, expanding health savings accounts. Number 6, House Republicans have some ideas about how my friend in Tullahoma can continue to afford insurance for his wife who has had breast cancer. because she has a pre-existing condition. It makes it more difficult to buy insurance. So there's 6 ideas. They're just 6 steps, maybe the first 6, but combined with 6 others and 6 more and 6 others, they get us in the right direction. Now, some say we need to rein in the insurance companies. Maybe we do. But I think it's important to note that if we took all the profits of the insurance companies, the health insurance companies, entirely away, every single penny of it, we could pay for 2 days of the health insurance of Americans, and that would leave 363 days with costs that are too high. So that's why we continue to insist that as much as we want to expand access and to do other things in health care, that we shouldn't expand a system that's this expensive, that the best way to reduce cost, to increase access, is to reduce cost. Now, in conclusion, I have a suggestion and a request for how to make this a bipartisan and truly productive session. And I hope that those who are here will agree. I've got a pretty good record of working across party lines and of supporting the President when I believe he's right, even though other members of my party might not on that occasion. And my request is this, is before we go further today, that the Democratic congressional leaders and you, Mr. President, renounce this idea of going back to the Congress and jamming through on a partisan vote through a little used process we call reconciliation, your version of the bill. You can say that this process has been used before, and that would be right, but it's never been used for anything like this. It's not appropriate to use to write the rules for 17% of the economy. Senator Byrd, who is the constitutional historian of the Senate, has said that it would be an outrage to run the health care bill through the Senate like a freight train with this process. So this is the only place, the Senate, where the rights of the minority are protected, and sometimes, as Senator Byrd has said, the minority can be right. I remember reading Alexis de Tocqueville's books, which most of us have read, and he said in his American Democracy that the greatest threat to the American democracy would be the tyranny of the majority. When Republicans were trying to change the rules a few years ago, you and I were both there. Senator McCain was very involved in that, about getting majority vote for judges. Then Senator Obama said the following: what we worry about is essentially having 2 chambers, the House and the Senate, who are simply majoritarian, absolute power on either side. That's just not what the founders intended, which is another way of saying that the founders intended the Senate to be a place where the majority didn't rule on big issues. I mean, Senator Byrd in his book, Senator Reid in his book, writing about the Gang of 14, said that the end of the filibuster, requiring 60 votes to pass a bill, would be the end of the United States Senate. And I think that's why Lyndon Johnson in the 60s passed the civil rights bills in Everett Dirksen's office, the Republican leaders, because he understood that having a bipartisan bill not only would pass it, but it would help the country accept it. Senator Pat Monahan has said before he died that he couldn't remember a big piece of social legislation that passed that wasn't bipartisan. And after World War II, in this very House and the room back over here, President Truman and General Marshall would meet once a week with Senator Arthur Vandenberg, the Republican chairman of the Senate Foreign Relations Committee, and write the Marshall Plan. And General Marshall said that sometimes Van was my right hand and sometimes he was his right hand. And we know how to do that. I mean, John Boehner and George Miller did that on No Child Left Behind. Mike Enzi and Ted Kennedy wrote 35 bills together. You mentioned that in your opening remarks. You and I and many other senators worked together on the America Competes Act. We know how to do that, and we can do that on health care as well. But to do that, we'll have to renounce jamming it through in a partisan way. And if we don't, then the rest of what we do today will not be relevant. I mean, the only thing bipartisan will be the opposition to the bill, and we'll be saying to the American people who have tried to tell us in every way they know how, in town halls and elections and surveys, that they don't want this bill, that they would like for us to start over. So if we can do that, start over, we can write a health care bill. It means putting aside jamming it through. It means working together the way General Marshall and Senator Vandenberg did. It means reducing health care costs and making that our goal for now, and not focusing on the other goals. And it means going step by step together to re-earn the trust of the American people. We'd like to do that, and we appreciate the opportunity that you've given us today to say what our ideas are and to move forward. Thank you very much.
Well, thank you, Lamar. Both I and Lamar went a little bit over our original allocated time. I not wanted to be a hypocrite. I wanted to give you some slack. We're going to have Nancy and Harry. I think my understanding is you guys want to split time.
We are, well,
We'll split it up, and so we'll let them make some quick remarks. What I will then do is just address. John, are you going to make the presentation yourself? Okay. What I will then do is just address a couple of points that were raised by you, Lamar, in terms of process, and then we will start diving in and getting to work. All right? Nancy?
yes, Mr. President. Thank you very much for bringing us here today. I will try to stick to the time because we have many people to hear from. Thank you, Mr. President, again. It was almost a year ago, March 5th of last year, when you brought us together in a bipartisan way to set us on a path to lower cost, improve quality, and expand access to quality health care for all Americans. In the course of that time, in our committees, in the House and the Senate, we've had lively discussions. Here we are today. You began your remarks, Mr. President, by saying there was a glimmer of bipartisanship in the Senate with the passage of the jobs bill. I want you to know there was a blaze of bipartisanship in the House yesterday with, 406 to 19. We passed, under the leadership of Congresswoman Louise Slaughter, Tom Pieriello, Betsy Markey, and others, the repealing of the exemption that insurance companies have on health insurance and the antitrust laws for health insurance. 406 to 19, a very strong message that, yes, the insurance companies need to be reined in. So put us down on that side of the ledger. That day, March 5th, we all remember the bipartisan spirit, the hope that was in the room, and also when Senator Kennedy came into the room and declared himself a foot soldier in the fight for health care for all Americans. And then later he wrote to you and said, this is not just about the details of policy, it is about the character of our country. The character of our country is formed, the backbone of our country are our working middle-class families in America. As we sit around this table, I think we should be mindful of what they do when they sit around their kitchen table. What we do here must be relevant to their lives. And for them, they don't have time for us to start over. Many of them are at the end of the line with their insurance, with their caps, with their this and that. You talked about stories. Senator Alexander did too. I can tell you many stories as I travel the country where I've seen grown men cry. One man in Michigan, Mr. Dingle, told me that his wife had been sick for a long time. He was at the end of the line in terms of his finances. He might have to lose his home, and she was bedridden. He was afraid of what was going to happen. He was too proud to tell his children that he needed help because they were raising their own families. He said, when is something going to happen on health care in America? I can't hold out much longer. I have a letter from Michigan, seems to be where I get some mail on this subject since I've traveled there recently, about a woman who said that their family, when they have to pay their deductible, they have to subtract it from their food budget, and that's just one of the concerns she mentioned. Can't mention health care in Michigan without acknowledging Chairman Dingell, his institutional memory of how difficult it was to pass Medicare, how he has worked over the decades to improve it, how committed he is to preserving it, and how important a part of preserving Medicare is to passing this health care bill. Later, he will inspire us with that, but he, Mr. President, as you know, as a young congressman, gavelled Medicare into law in the House of Representatives. You have talked about how the present system is unsustainable for families, for businesses, large, modern, and large, small, any size, and how it's unsustainable, as you said on March 5th of last year. And health care reform is entitlement reform. Our budget cannot take this upward spiral of cost. We have a moral obligation to reduce the deficit and not heap mountains of debt onto the next generation. But I want to talk for a moment about what it means to the economy. Imagine an economy where people could change jobs, start businesses, become self-employed, whether to pursue their artistic aspirations or be entrepreneurial and start new businesses, if they were not job-locked because they have a child who's bipolar or a family member who's diabetic with a pre-existing condition, and all of the other constraints that having health care or not having health care places on an entrepreneurial spirit. Think of an economy with that dynamism of people following their pursuits, taking risks. We want them to take risks, and yet we lock them down. And we have an anvil around our businesses because of these increasing cost of health care. So this bill is not only about the health security of America, it's about jobs. In its life, it will create 4 million jobs, 400,000 jobs almost immediately. Jobs again, in the healthcare industry, but in the entrepreneurial world as well. You, Mr. President, under your leadership, we passed the American Reinvestment and Recovery Act last January and got a running start on some of the technology and scientific advancements in this by the investments in biomedical research, health IT, health intelligence, information technology, a running start by your signing the SCHIP, the Children's Health Bill, ensuring 11 million children. We got a running start on expanding access, and not only that, doing it in a way that is of the future. This is not just about health care for America. It's about a healthier America. This legislation is about innovation. It's about prevention. It's about wellness. But most people haven't heard about that. And those people sitting at that kitchen table, they don't want to hear about process. They want to hear about results. They want to know what this means to them. And what it means is a health initiative that is about affordability for the middle class, lowering costs, improving access for them. Accessibility, affordability and accessibility are closely aligned, and accountability for the insurance companies. So it's a very important initiative that we have to take, and I want to say, because Medicare was mentioned, unless we pass this legislation, we cannot keep our promises on Medicare. We simply must make the cuts in waste, fraud, and abuse in Medicare so that the benefits and the premiums are untouched. We owe it to our seniors. We owe it to our country. That day, March 5th, Senator Kennedy said, health care is a right, not a privilege. Let us move in a way. Who can say, Ram, we'd started this 6 weeks after your inauguration, just 6 weeks after your inauguration, on March 5th, with you extending a hand of bipartisanship, and many of the provisions that are in our bill are initiatives put forth by the Republicans. Others of our colleagues will talk about this. But I just hope that as we sit around this table, we understand the urgency that the American people have about this issue, how it affects not only their health, but their economic security. And I thank you, Mr. President, for your leadership in getting us to this place.
Mr. President, my friends in the House and in the Senate, I want to spend a few minutes talking about Nevada, about our country, and not what's going on here in Washington. I want to start by talking about a young man by the name of Jesus Gutierrez. He works hard. He has a restaurant in Reno, Nevada. He had everything that he wanted, except a baby. He had health insurance. He had employees that liked him. But he was fortunate. They were going to have a baby. It was going to be a little girl. And the baby was born. And in just a few minutes after the birth of that baby, he was told that the baby had a cleft palate. But that's okay. He was told, we can take care of that. And they did. They did some surgery on the baby, and he was happy. That is, Jesus was happy until he got his mail 4 months later, opened the envelope, and the insurance company said, we didn't realize that your baby had a pre-existing disability. We're not covering the $90,000 in hospital and doctor bills you've already run up. So he's trying to pay that off. The baby needs a couple more surgeries. This shouldn't happen to anyone in America. He had health insurance. He paid his premiums. I say to my friend Lamar, who I have great respect and admiration for, you're entitled to your opinions, but not your own facts. Your opinion is something that is yours, and you're entitled to that, but not your own set of facts. Senator Moynihan said that many years ago, and that's what we have to do here today. Let's make sure that we talk about facts. Last Monday, a week ago Monday, all over America, the results were run from a poll done by the Kaiser Foundation. It's interesting what that poll said. 58% of Americans would be disappointed or angry if we did not do health care reform this year. 58%. Across America, more than 60% of Republicans, Democrats, and Independents want us to reform the way health care works. Is it any wonder? They want it so that businesses can afford health care. They want to give consumers more choices and insurance companies more competition. And the donut hole. What is the donut hole? Well, a senior citizen will tell you what the donut hole is. Under the Medicare law that is in existence, you can be sick and you can get your medication paid for a while. After you spend $2,000 approximately in medication, you are finished until you spend $3,500 more out of your own pocket. And what happens during that hole that we've called the donut hole? Seniors in America are splitting pills in half, not getting their prescriptions filled, taking them every other day. Again, Lamar, you're entitled to your opinion, but not your own facts. No one has said, I read what the President has online, no one has talked about reconciliation, but that's what you folks have talked about ever since that came out, as if it's something that has never been done before. Now, we as leaders here, the Speaker and I, have not talked about doing reconciliation as the only way out of all this. Of course it's not the only way out. But remember, since 1981, reconciliation has been used 21 times. Most of it's been used by Republicans for major things, like much of the Contract for America, Medicare reform, the tax cuts for rich people in America. So reconciliation isn't something that's never been done before. It's as if there's a different mindset, a different set of facts than the reality. Remember, Chairman Dodd in the Help Committee held weeks of markups. And in the bill that he reported out of that committee, there's more than 150 Republican amendments that are part of that legislation. The same happened with Chairman Baucus in the Finance Committee. And those were put together. That's what we brought to the floor. So the bill on the floor that my friend Lamar is lamenting here has significant input from the Republicans. So let's look at the facts a little bit more, because they can be stubborn, you know. Harvard just completed a study that shows 45,000 Americans die every year because they don't have health insurance. Almost 1,000 a week in America. In 2008, about 750,000 bankruptcies were filed. About 70% of those bankruptcies were filed because of health care costs. 80% of the people that filed for bankruptcy because of health care costs had health insurance. America is the only country in the world where if you get sick or hurt, you're going to have to file bankruptcy. 750,000 bankruptcies in 2008. These facts show that the story that I told about Jesus is not just a story of some young businessman in Reno, Nevada running a restaurant that gets jerked around by an insurance company. Happens all over. Health reform shouldn't be about political parties fighting each other. It should be about people fighting for their lives and fighting for a better quality of life. People like Jesus and that little girl. This debate shouldn't be about whether an idea came from Democrats or Republicans or one side of the aisle or the other side of the aisle, but whether the idea will improve the health care delivery system in our country. I know, it's obvious, we've heard it. Our Republican friends oppose our legislation, and that is your right. But also, it becomes your responsibility to propose ideas for making it better. So if you have a better plan for making health insurance more affordable, let's hear it. If you have a better plan for making health insurance companies more accountable, let's face it, let's work on it. If you have a better plan for doing this while cutting the deficit, as our bill did, during the first 10 years, our bill cuts the deficit by $132 billion. The second 10 years up to $1.3 trillion. Those aren't my numbers. They're the Congressional Budget Office. So we're ready to listen. I so appreciate the President getting us together. I want the American people to know that we need to work together. And I want to do everything that I can as a senator to work with my colleagues on both sides of the aisle to get this done. We need to do health care reform. I've spoken with Madam Speaker on many occasions, numerous times, about health care. We spent most of the last year talking about health care. I so admire her tenacity, her legislative brilliance, and I will do everything I can, Mr. President, to get this health care reform over the goal line.
Sure. Well, thank you very much, Harry. Everybody went a little over time, which is not surprising with a room full of elected officials. I wanted to give people a little bit of wide berth starting off, but we're going to need to be more disciplined moving forward if we're going to be able to cover every item. And I'll try to set the example here. I just want to address very quickly, Lamar, the issue of process that you raised at the beginning. And then we'll move on and start talking about the specifics. As I listened to your description of the House Senate bill as well as the proposal that I put on our website, obviously there were some disagreements about how you would characterize the legislation. On the other hand, when I listened to some of the steps that you thought Republicans would be open to, I thought, well, a bunch of these things are things that we'd like to do, and in fact are in the legislative proposals. So part of the goal here, I think, is to figure out what are the areas that we do agree on, what are the areas where we don't agree, and at the end of that process, then make an honest assessment as to whether we can bridge these differences. I don't know yet whether we can. My hope is that we can, and I'm going to be very eager to hear and explore how we might be able to do so. So rather than start at the outset talking about legislative process and what's going to happen in the Senate and the House and this and that, what I'd suggest is let's talk about the substance, how we might help the American people deal with costs, coverage, insurance, these other issues, and we might surprise ourselves and find out that we agree more than we disagree. And that would then help to dictate how we move forward. It may turn out, on the other hand, there's just too big of a gulf, and then we'll have to figure out how we proceed from there. So that would be my proposal. And what I'd like to do then is to start first with something I heard everybody agree on, every single speaker, and that was the issue of cost. It is absolutely true that if all we're doing is adding more people to a broken system, then costs will continue to skyrocket, and eventually somebody's going to be bankrupt, whether it's the federal government, state governments, businesses, or individual families. So we have to deal with costs, and I haven't heard anybody disagree with that. Now, I've already indicated some statistics, but I just want to reemphasize these. More than a quarter of small businesses have reported a premium increase of 20% or more just last year. 20%. As a consequence, a lot of small businesses have dropped coverage altogether. Fewer than half of businesses with fewer than 10 workers now offer coverage. By one estimate, without health care reform, by the end of the decade, premiums for businesses would more than double in most states, and the total cost per employee is expected to rise to more than $28,000. So you can imagine what that does to hiring, what that means for incomes, and you can imagine how many families are going to be unable to afford insurance. As I mentioned earlier, I hear stories from people all the time about how these costs have very concrete impacts on their lives. I spoke to a family, the Links from Nashville, Tennessee. They've always tried to do right by their workers with their family-run company, but they had to do the unthinkable and lay off employees because their health care costs were too high. I've talked to other business people who say, we were going to hire, but we decided not to when we got our monthly premiums. And so one of the goals that I set out very early on in this process was, how do we control costs? Now, what we have done, as I mentioned earlier, was to try to take an idea that is not just a Democratic idea, but actually is a Republican idea, which is to set up exchanges. These are pools where people can come in and get the same purchasing power as members of Congress do as part of the federal employees' health care plan, as people who are lucky enough to work with big businesses can do, because there are a lot of employees in those big businesses. What we've said is that if you join one of these exchanges, you will have choice and you'll have competition. You will have a menu of private insurance options that you'll be able to purchase, but because you're not purchasing it on your own, you're purchasing it as part of a big group, you're going to be able to get lower costs. For folks who, even with those lower costs, still can't afford coverage, we provide some subsidies. But here's what I want to emphasize is that even without the subsidies, it's estimated by the Congressional Budget Office that the plan we put forward would lower the costs in the individual market for the average person who's just trying to buy health insurance and they're not lucky enough to work for a big company, would lower their costs by between 14 and 20%. So, Lamar, when you mentioned earlier that you said premiums go up, that's just not the case according to the Congressional Budget Office.
Mr. President, if you're going to contradict me, I ought to have a chance to. The Congressional Budget Office report says that premiums will rise in the individual market as a result of the Senate bill.
No. Let me, and this is an example of where we've got to get our facts straight.
That's my point.
Well, exactly. So let me respond to what you just said, Lamar, because it's not factually accurate. Here's what the Congressional Budget Office says. The costs for families for the same type of coverage as they're currently receiving would go down 14 to 20%. What the Congressional Budget Office says is that because now they've got a better deal, because policies are cheaper, they may choose to buy better coverage than they have right now. And that might be 10 to 13% more expensive than the bad insurance that they had previously. But they didn't say that the actual premiums would be going up. What they said was they'd be going down by 14 to 20%. I promise you, I've gone through this very carefully with the Congressional Budget Office. And I'll be happy to present this to the press and whoever's listening, because this is an important issue.
Well, may I?
Let me just finish, Lamar. Now, what we've done is we've tried to take every single cost containment idea that's out there. Every proposal that healthcare economists say will reduce healthcare costs, we've tried to adopt in the various proposals. There are some additional ideas that Republicans have presented that we think are interesting, and we also tried to include. So let me give you an example. You mentioned the idea of buying across state lines insurance. That's something that I've put in my proposal that's actually in the Senate proposal. I think that it shows some promise. You mentioned that, that Mike Enzi has previously said that he's interested in small businesses being able to pool in the equivalent of some sort of exchange. So that's where there's some overlap. But I just think it's very important to understand that what we've done is to try to take every single cost containment idea that's out there and try to adopt it in this bill. What I'd like to do is to see if we can proceed and have a very concrete conversation about what are the ideas that you guys have that you don't think are in our bill to contain costs. And what I want to do is to see if maybe we can adopt some of those or refine what we've already done in order to further reduce costs.
Mr. President, I've had
and what
my
I'd
time.
like to do also is to make sure that you maybe suggest some of the ideas that are currently in the bill that you think are good. Because, Lamar, in your opening introduction, what I saw was, sort of the usual critique of why you thought it was bad. But as I said, we've adopted a lot of the ideas that we've heard from your side of the aisle. So I hope maybe you could say, well, those are the ones that we think are good ideas. Here are the things that we think are bad ideas, as opposed to just painting in broad brush. Go ahead.
Mr. President, let me show some respect for my colleagues here. They're all here, eager to speak, all sure they could do a better job than I could on any of these points. And what I would like to do is get back directly to you with why I believe, with respect, you're wrong about the bill. Your bill would increase premiums, I believe. You say it wouldn't. So rather than argue with you in public about it, I'd like to put my facts down, give them to you. Maybe other colleagues will say that. As far as Mike Enzi's proposal, he's ready to talk about it. Others are. So I appreciate the opportunity that Mitch and John gave me to talk. You've made some interesting points, and why not let other members of Congress have a chance to talk?
I think it's a great idea. I'd like to get this issue settled about whether premiums are reduced before we leave today, because I'm pretty certain I'm not wrong. And, you give us the information, and we're going to be here all afternoon. I promise you we'll get this settled before the day's out. All right? Mitch, who would you like to talk about costs?
Mr. President, since some liberties have been taken here, let me just make a quick observation. Then I'm going to call on Dr. Coburn to make our framing statement on the issue of cost containment. Well, one thing I think we need to be acutely aware of, ladies and gentlemen, we are here representing the American people. And Harry mentioned several polls. I think it is not irrelevant that the American people, if you average out all of the polls, are opposed to this bill by 55 to 37. And we know from a USA Today Gallup poll out this morning, they're opposed to using the reconciliation device, the short circuit approach that Lamar referred to that would end up with only bipartisan opposition, by 52 to 39. Now, I'd like to call on Dr. Tom Coburn, who's been a practicing physician for many years, to address the cost containment issue.
Thank you. Well, Mr. President, thanks for having us do this. I think today's going to be enlightening. The first thing I would do is put out a caution to us because what I see the Congress doing and what I saw this last year is us actually performing bad medicine. And that is that we get stuck in the idea of treating the symptom rather than treating the disease. And whether you go to Harvard or whether you go to Thomson Reuters, there's some facts we know about healthcare in America. And the facts we know is 1 out of every $3 that gets spent doesn't help anybody get well, and doesn't prevent anybody from getting sick. The second thing we know is from the Congressional Research Service that most of the mal-drivers today in healthcare come from government rules and regulations. The government now directs over 60% of the healthcare in this country. And if throwing money at it and creating new government programs could solve it, we wouldn't be sitting here today, because we've done all that, it hadn't worked. So what I thought we ought to do is maybe talk about, why does it cost so much? Because the thing that keeps people from getting access to care in our country is cost. You mentioned Malia and Sasha. The fact is with young kids going to the ER, whether they have meningitis or asthma, they're going to get treated in this country. But they may get labeled with a pre-existing illness after that. And that's another thing I'd be happy to talk about at a later time. But the fact is we know how to treat acute asthma. What we don't do a good job of is preventing children from getting acute asthma. We don't do the good job of prevention. So when you break down the costs, what we know is 33% of the costs in healthcare shouldn't be there. And how do we go about doing that? And what are the components of that cost? And when you look at when it's studied, and if you look at what Malcolm Sparrow from Harvard says, he says 20% of the cost of federal government health care is fraud. That's his number. If you look at Thomson Reuters, when they look at all of this, they say at least 15% of government-run health care is fraud. Well, when you look at the total amount of health care that's government-run, you're talking $150 billion a year. So tomorrow, if we got together and fixed fraud, we could cut health care 7.5% tomorrow for people in this country. So what we ought to do is do the Willie Sutton thing. We ought to go for where the money is. What's the other area? What we do know, and I'm guilty of this, Dr. Barrasso's guilty of it, Dr. Bustiani's guilty of it, is a large portion of the tests we order every day aren't for patients. They're for doctors. And the reason they're there is because we are risk averse to the tort system and extortion system that's out there today in healthcare. And there are a lot of ways to fix that. But I just went through last night. If you add up what Thomson Reuters, which looked at all the studies that have been done and combined them in, they say between $625 billion and $850 billion a year of healthcare dollars are wasted. So it seems to me if cost is the number one thing that's keeping people from getting care, then the efforts of us as we go after cost ought to be to go to those areas where the cost is wasted. And there's a philosophical difference in how we do that. One wants more government-centered approach to that. I would personally prefer a more patient-centered, market-oriented approach to that. But nevertheless, there's where we can come together, just on those two areas where we could cut costs 15% tomorrow. And that's for everybody in the country. What would happen to access in this country if tomorrow everybody's health care costs went down 15%? Access would markedly increase. So what I would hope we would do is that we would go back and concentrate on the areas that have the biggest pot of gold for us. And the biggest pot of gold is we don't incentivize prevention. We don't pay rewards for great management of chronic disease. We have a system throughout the country where we're encouraging lawsuits that aren't productive for the country, and what they actually do is cause the cost of health care to go through the roof. We also know there's some other real things that we ought to address. There are conflicts of interest within the medical field. There's nothing wrong with addressing those and taking those off. We know that we absolutely do not incentivize prevention. And I'm not talking about creating walking paths. I'm talking about paying people who actually do a good job to do prevention. Talking about changing the school lunch programs where it meets the needs, nutritional needs of Americans. Changing the food stamp program where it incentivizes people to eat the right things, not the wrong things. We actually create more diabetes through the food stamp program and the school lunch program than probably any other thing, because we're not offering and incentivizing a great response. So I think I think it's great that we're coming together, but the gold is in where's the cost excesses. And what I would hope we would do is we would look at that and say, how do we come together and actually achieve a reduction in the extortion that goes on in this country in terms of medical malpractice? And there's lots of ways to do that without us mandating to the states. I know you have some of that in this new thoughts in terms of incentivizing states to do that. How do we do that in terms of creating an elimination of fraud? You know, when you compare the private sector fraud rates, it's 1% compared to Medicare and Medicaid. You know, there's estimates that there's $15 billion worth of fraud in Medicaid a year in New York City alone. So we haven't attacked that. We haven't gone where the money is. And my hope would be that we would look at where the money is. And if truly it's accurate, and I don't know many people that will disagree that $1 in $3 doesn't help somebody get well and doesn't prevent them, then we ought to be going for that $1 in $3. And we ought to do it not by creating a whole bunch of new government programs, but by creating an incentive to reward people. In your new bill, you have good fraud programs, but you lack the biggest thing to do. The biggest thing on fraud is to have undercover patients, so that people know we're checking on whether or not this is a legitimate bill. And you don't know who's an undercover patient and who's not. And all of a sudden, you start changing your attitude of whether or not you're going to milk Medicare or you're going to milk Medicaid. So,
Mr. President, if I could just say that I'm not an expert on much, but I am filibusters, and we have 40 members of Congress here.
Tom, you made some powerful points. You want to just wrap up real quick?
No, I'll just finish with that. Is with $1 out of $3 not helping everybody, we ought to go for where it is.
Well, Tom, I appreciate what you said. I think we're going to have Steny Hoyer go next. I just want to make this quick point. Every good idea that we've heard about reducing fraud and abuse in the Medicare and Medicaid system, we've adopted in our legislation. So that's an example of where we agree. We want to eliminate fraud and abuse within the government systems. Let's recognize, though, that those savings in the government systems, which will help taxpayers and allow us to do more, doesn't account for the rising costs in the private marketplace. Now, the private marketplace, you mentioned the issue of medical malpractice and frivolous lawsuits, and as you indicated, these are areas where Secretary Sebelius has already begun to try to give states some incentives to do that. On the prevention side, there's a whole host of provisions inside the legislation that's been passed by the House and the Senate, and I think Steny will talk about it. So we've identified some areas we agree on, and then the question just is, does that help the average family in the individual market who potentially can get costs? But Steny, why don't you?
Let me just respond to one thing. You get cost shifted every penny that gets wasted in Medicare, and that gets cost shifted to the private sector. So if in fact we're wasting it in the public sector, we're shifting it to the private sector.
You and I agree on this. Steny?
Mr. President, thank you very much. A quote I will use is, we should have available and affordable health care to every American citizen, to every family. I suppose there are a whole lot of every Americans and American families listening to us today and watching us. And they're hoping the world is sitting around here talking about them, not about us. That's the message they're sending to all of us. And they're absolutely correct. And we believe that we have been addressing them and trying to get some of these stories that all of us hear to a place where they won't be so tragic for individuals and for families. Every one of us has a story. I had a message on my telephone answering machine just a little while ago, a couple of weeks ago. A woman that I know well called me up. She said, Steny, I was just diagnosed with a tumor, and I've got to be operated on. I don't have any insurance. My husband makes $28,000. I work part-time and make about $5,000. She says, we're making too much money from Medicaid. And we're going to go to the University of Maryland Hospital. They want 50% down of a $25,000 bill. She doesn't have that. And we're working on that, trying to get her some additional help. Hopefully we can. I had a small business in my district, like all of you, who last year paid $1,100. Couple, healthy, paid $1,100. Their bill is going to go up to $1,830 next year. That's a 67% increase. They called me up and said, we don't know that we can afford to keep our small business going. So all of us, John McCain, my good friend, that was your quote, as you probably recall, in the debate that you had with President Obama. And the good thing was that both of you, in effect, said the same thing, that we need to get to the objective of covering all Americans and having them have access to affordable health care. We agree with that. I think probably everyone around this table agrees to it. So what we're going to talk about is the how. Cost containment is clearly one of those issues that we need to deal with. Cost containment for that small business that is having a 67% increase. Cost containment for that woman who can't afford insurance but has a health care issue that she can't avoid. It's not optional for her. So we have to deal with that. Many in my caucus believe that one way of doing that is to increase competition, to have an open, free market that is transparent. I think all of us around this table agree that a free market does that. An open market, a transparent market where people can compare prices and compare what they're going to get. And that's what we've tried to do in both these bills. Did a little differently, but that's what we tried to do. We hope we can get agreement on doing that. An open, transparent market will bring down costs, we believe. And in addition to that, Senator Coburn, we certainly agree with you that $1 in $3 is not being spent as effectively as it should be. And we have a lot of provisions in both bills, as you well know, that try to get us to a place where administrative costs, health information technology, so many other things are done to wring the costs out. And in addition, you speak eloquently and correctly about wringing fraud, waste, and abuse out of this system. I know you're happy to have seen in our bill, in the House bill and in the Senate bill, very substantial investment in doing just what you suggest. So I think we have agreement on conflict of interest in delivery of medicine as well. We've dealt with that in our bill. We've dealt with it previously, as you well know. We've put incentives for prevention in here, which you mentioned. We absolutely agree on that. We think this bill does that. Now, you may have a better way of doing it. We need to talk about how that better way is, but we certainly have addressed the issue of making sure that we have wellness as a focus, not sickness. We have to deal with sickness, but what we really want is wellness. So we've worked very hard on that in this bill. You mentioned the school lunch and food stamp programs. I'm sure we can get there too, in agreement. We certainly agree with the premise you stated. We'll figure out the way and means to get there. What have we done? We've stopped premium discrimination. That clearly ups cost. If you're in a small market, as the President pointed out, you're going to pay a higher price. We don't do that. Why? Because we're in a big market. We have a competitive edge, and the insurance company doesn't have pre-existing conditions for us. They just take us as a group. That's what we're trying to get for every American, that they have access to a large group, whether they're an individual, this woman who has the tumor, or whether they're a small business, they can get into a large group. We're trying to do that. We want to go after fraud, waste, and abuse. I'll reiterate that. Transparent market, stop premium discrimination, and make sure that people with a pre-existing condition, as none of us have a problem with, but a lot of people do have, because we're in a big group, that are in a large group, and we prohibit that. You agree with that rhetorically. Now, it's not in your legislation, but you certainly agree with capping out-of-pocket expenses on an annual basis or lifetime basis, that you don't think that's right, that people ought to continue to be covered. We believe there needs to be better coordination of care. You're a doctor. You have a number of doctors in the room. We believe that there ought to be a way that we can incentivize the coordination of care. We also believe that there should be incentives to provide care based upon best practices, not based upon simply procedures being reimbursed. I think we all agree on that. You're shaking your head in agreement, and I know we all agree on that. And you're right, we have to get there. But I would suggest to you that one of the things that many in my caucus felt very strongly about in terms of competition was having a public option. Now, there was real disagreement on that issue, but many in my caucus thought that would open up competition, would provide for access for every citizen if they didn't have access in some other way. Now, Senator Baucus is going to speak at more specifically in terms of our cost containment, but donut hole certainly is one of the issues that we need to deal with. Donut hole we deal with in our legislation in the House. We would hope that it is in legislation that we agree upon, because seniors are confronted with extraordinary out-of-pocket costs for a very significant portion of the cost of their prescription drug. And seniors are concerned about that. We take care of that in our bill. But I think what the American public that's listening and watching expects us to do, Mr. President, is what you're doing, bringing us together, coming to agreement to make sure that we get to a place where we reach the objective that President Obama and candidate McCain expressed as the objective on behalf of the American people. Thank you, Mr. President.
Mr. President. Mr. President.
You know, before you go, Max, I just want to ask whether it's you, Tom, or anybody else on the Republican side, and maybe some of the House members might be interested. You know, Senator Coburn mentioned some cost containment issues where it sounds like we agree. Fraud and abuse, we agree. It sounds like you have maybe one other idea that you don't think is in our proposal, but the idea of undercover patients, but that's something that I'd be very interested in exploring. I don't think conceptually that would be a problem. The issue of prevention, and that includes, by the way, things like how our kids are eating and getting exercise, and I'm proud of the First Lady for working to see what she can do on that front, and there are some provisions in the legislation that's already been passed through the Senate and the House that directly relate to this that I think you'd be supportive of. The issue of defensive medicine, as I indicated, Secretary Sebelius is working on this, but I think that there are things that we could do at the state level to help foster innovation and eliminate some of the concerns that you've got. I would be interested in hearing from any of our Republican colleagues what objections they have to what we consider one of the biggest ways of driving down costs, and that's what Steny just referred to, which is allowing individuals and small businesses who are currently trapped in a very expensive market. Essentially, they're having to be out there fending for themselves, to be able to buy into essentially a large group, to become part of a large group, just like all of us as government employees are part of a large group, so that they have more negotiating power with the insurance companies, which I think we all agree would drive down costs. You know, if you've got some bigger purchasing power, insurance companies want more customers, they would drive down those costs. I know some of you have agreed to this as a concept in the past, and so my question is there something in terms of the way the House and Senate bills have been structured that leads you to be concerned or want to not move forward on that approach? John?
Well, Mr. President, I'd like to yield to Mr. Klein from Minnesota, who will talk about the small business health plans in terms of how we would propose to do this.
Thank you, Leader. Thank you, Mr. President. I think that Senator Alexander framed our overall position very well when he said that we're looking at thousands of pages of legislation, and we believe a better approach is to go step by step to address these issues of cost. We certainly agree that you get better economies of scale if you can come together. We have proposed in both the House and the Senate, in fact, for a number of years, that small businesses be able to band together in small business health plans or association health plans. We all know, and I've heard everybody say here, that small businesses are the engine that drives our economy. We also know that about half of the uninsured either work for small businesses or depend upon somebody who does. And so we believe that we ought to address that issue by allowing these small businesses to band together in the same way that I think, Mr. President, you mentioned, large companies do. And I mean really the same way, so that they get all the advantages of, if they self-insure, being able to avoid the 50 state mandates, being able to lower their administrative costs because they're not having to deal with that. And it will lower the cost of premiums for these small businesses and allow them to insure more people and to keep people, they're already insured, on the books, because we all know stories like we've heard here of small businesses that are saying, I can no longer provide insurance for my employees. Yeah. Small businesses have been asking for this for years. It's not a new idea.
Right.
They've been asking for it for years, and we think it's a far better way to get these economies of scale than the exchange thing that's in the huge bill. That this will actually allow businesses to be able to lower their costs exactly the same way that large businesses do.
Okay. Max is going to go, and then I'll go to you, Rob. Max, do you want to address this issue of how we can allow people to buy into large groups, how the Senate bill accomplishes it, and I don't know if you want to remark on what John just said.
Yeah, well, absolutely. I'd go first like to say something that just strikes me just in spades. Frankly, we all studied this issue a lot, healthcare reform. We basically know what the problems are, all of us. We basically know the need, the current system is unsustainable. We are actually quite close. There's not a lot of difference. Close in the sense, without being corny and dramatic about this, if the American people want us to do something that's basically reasonable, doesn't have to be one congressman, one senator's provision, but basically reasonable. We are on the verge and the cusp with not too much effort to try to bridge a lot of gaps here, because the gaps in my judgment are not that great. Let's take the list, for example, that Lamar mentioned. As you said, Mr. President, we are basically including most of those provisions, if not all, in our joint legislation. Selling insurance across state lines, for example. We allow for that, not exactly in the way that some would, but sure, with compacts, and once the state exchanges are up, people will be able to buy and sell insurance across state lines and achieve that competition. In addition, you mentioned lawsuits. Secretary Sebelius is working to try and find ways to encourage states to settle, resolve issues before they become big bad lawsuits. Add to that, Lamar says we should find ways for states to be able to lower their costs, so we do that. We let states opt out. They can do what they want to do. And Senator Wyden also has a proposal. Senator Cantwell has a proposal. We give a lot of flexibility in that regard. Expand HSAs, that's fine. There's nothing wrong with HSAs, but we also have to have products for poorer people, lower income people. HSAs work pretty well if you have middle or high income. Pre-existing conditions, clearly, we all agree on that. We have those provisions in our bill. Respect to small business, we're not that far apart. Some suggest association health plans, where small business people can band together in an association pool and get better insurance. That's fine. What we provide for in our legislation is something similar. It's called the SHOP Act. Various senators, bipartisan, have worked on this. And basically it allows, sets up a small business arrangement in exchanges. Small business participates in their own exchange and gets the advantage of all the pooling. And then they can do what federal employees do today. They can shop and compare and to get the best deal. And I would guess that most small businessmen would like to do that. I might add that we're also providing tax incentives, tax credits for businesses, small business, that wants to purchase health insurance for its employees. And it's pretty good. It's 35% tax credit first couple of years. Then once the exchange is up, it's 50%. So the main point is we're not really that far apart. We're trying to find ways for small business to pool, small business to take advantage of competition, to shop and compare. Also some tax provisions that enable to encourage businesses to get health insurance. So I might say too that if you look at all the provisions that Stanley outlined, many of them, we agree on prevention. There are major prevention provisions in our legislation, as Senator Coburn mentioned. We also agree on trying to change the way we reimburse docs. I think the biggest game changer here, frankly, is how we reimburse our doctors. They're based more on quality rather than quantity. I know Tom Coburn really agrees with that as a doctor. And most doctors do. And it's another example we really are close. And I think that once we keep pushing on those areas that we're close, it's going to make a difference. The exchanges, as you mentioned, Mr. President, it's a Republican idea. It works. What I like about exchange, it's like Orbitz. It's like Expedia. You know, you go to Orbitz or Expedia to buy an airline ticket. You compare it, get the best price. That's basically what this is. It's an exchange. You go to the exchange, you shop around, and you get your best price. That's going to help, in my judgment. I also think that we should, where the hospitals should publish the cost of their basic procedures, whether it's appendectomy or colonoscopy or whatnot, to enable consumers to shop around. Where's the best price? We all know that there's a wide disparity in what hospitals charge for the same procedures. Let's see. I think disinfectant of sunshine helps. It helps consumers. It helps our people. And fraud and waste. We've talked about that. We have major provisions in our bill to fraud and waste. Mr. President, I compliment you because in your proposal you go even farther.
We took some additional ideas from folks like Congressman Ross.
They're great ideas, and we address the unnecessary readmission rates, from hospitals, et cetera. The main point is we basically agree. There's not a lot of difference here, and I just like us to kind of just, there's an opportunity for us to work out some of these differences.
Mitch, is there somebody?
Yeah, Mr. President, I'm going to yield to John here.
John?
I'd like to yield to Dave Camp to continue this conversation about cost containment.
Dave?
Thank you, Leader Boehner. Thank you, Leader Boehner, and thank you, Mr. President, for the invitation today. I think as we focus this part of the conversation on cost, a lot of Americans say to me, if you're really interested in controlling costs, well, maybe you shouldn't be spending $1 trillion on health care, as the Senate and House bills do. Also, cutting Medicare benefits by $500 billion to fund this new entitlement is, I think, a step in the wrong direction, and many Americans do as well. The nonpartisan actuaries at the Center for Medicare and Medicaid Services say on page 4 of their letter on the Senate-passed bill that it would bend the cost curve in the wrong direction by about $250 billion. They specifically say the health expenditures under the Senate bill would increase by $222 billion. A key way of reducing costs that's missing from the House and Senate bills is responsible lawsuit reform that guarantees injured parties, much like our two largest states have adopted, Texas and California, access to all economic damages, such as future medical care. If they need nursing care in the future, they'll get it. Lost wages, reasonable awards for punitive damages and pain and suffering. On page 4 of its letter to Senator Hatch, CBO found that this common sense reform would reduce the federal deficit by more than $50 billion. Now that's just on the government side, because as we know, CBO doesn't score the private side on this. And PricewaterhouseCoopers has done a study that said savings could be as high as $239 billion if this reform were adopted. There are two features in the House and Senate bills that move in the wrong direction. Both bills feature restrictions on health spending accounts where people can save tax-free for their health care, as well as FSAs, flexible spending accounts. These changes are such as they ban the use of over-the-counter medication out of both of these plans. There's a new cap on FSA contributions of $2,500. That text, that language is found on page 1,959 of the Senate bill, and that will hinder the growth of those plans, and which encourage Americans to consider quality and price when they purchase health care. And let me just say, under HSA plans, Premiums increased just 1.3% for individuals in 2007 to 2008 and declined 5.4% for families in that same period. And when people switch from a PPO, a preferred provider organization, to a health savings account, their premiums declined by an average of $3,800. Now, another concern I have is the Senate bill, which on page 982 creates an unelected board charged with recommending even more Medicare reductions. And if Congress doesn't accept these recommendations, they have to find other Medicare spending to cut instead. And that gives, I think, too much authority to unelected bureaucrats rather than to elected representatives of the people, and the power to decide whether to cut Medicare and by how much. Now, holding down health care costs for the government is important, but I think it's also important to hold down costs for families and employees.
Dave, I don't mean to interrupt, but we're going to have the whole section talking about deficits, and we can talk about the changes in Medicare. We were trying to focus on costs related to lowering families. And, you know, the only concern I've got is, look, if every speaker, at least on one side, is going through every provision and saying what they don't like, it's going to be hard for us to see if we can arrive at some agreements on things that we all agree on. So I don't want to try to cut you off. Please finish up, but I just want to kind of point out that
I do want to say on this issue on premiums, CBO in their letter on page 4 does say that the estimated average premium per person for non-group policies would increase by 10 to 13%.
This is the discussion that I just had about Lamar.
Yes,
and
they do say that, and they do say that the value of the benefit is higher, and that is why it goes up. But the reason the value of the benefit is higher is because of the mandates contained in the legislation. And this is one of our big concerns with a lot of the issues that have been raised. Yes, we have similarities, but when all of this is structured around a government-centered exchange that sets the standard for these policies, states can't get out of these requirements unless they seek a waiver from the Secretary. That kind of approach raises costs, and so both of your comments were correct that costs do go up, and it's because they have a richer benefit, but the reason it's richer is because of the mandates contained in these very large bills.
Okay, I'm going to let Rob, feel free to respond to anything that Dave indicated or to any of the other issues that have been discussed.
Thank you, Mr. President. I want to thank my friend Tom Coburn and John Klein for the spirit of conversation which they offered and try to carry that forward a little bit. The President asked at the beginning of this, what ideas do we share about cutting costs? And Tom, I think you had some very good ones. Fraud, that the President has a proposal that says we should have a database. If you've committed fraud against Medicare once, you can't make a contract again. Wellness, there's a lot of good ideas in the bills. Junk lawsuits, I think that there's what Secretary Sebelius is doing is very important in curtailing that. And then the President asked the question about whether we can find agreement on pooling the purchasing power of small businesses and individuals so they can get the same deal that big companies and members of Congress get. And my friend John Klein talked about the Association Health Plan proposal. Respectfully, John, I think that what you're talking about with Association Health Plans and what we're talking about with exchanges is a semantic difference. It's a matter of pooling the purchasing power of small businesses and individuals to get a better deal. But there is one substantive difference that I want to ask about because we are concerned about it. If we can resolve this, I think we could agree. Let's take the case of a woman who has a baby by C-section. And she lives in one of the many states that say you can't be kicked out of the hospital after you've had a C-section until your doctor thinks it's time for you and the baby to go home. Now, under the Association Health Plan proposal, that rule wouldn't apply to that lady and her baby, that there would be no protection of her in that situation. We think, John, that there shouldn't be necessarily, 51 different rules for each state, but there ought to be some minimum federal standards in these exchanges to protect people in cases like that. So I think the issue is if we could find a way to agree that in a case like this where, a lady has a baby by C-section and has the ability to not have the insurance company get between her and her doctor, so the doctor makes a decision about when they go home. We could figure this out. And how do you feel about that?
If I could just respond to that, my friend knows very well that there are large companies today who operate under what I'm proposing for association health plans. They get a waiver. They don't have to comply with the individual mandates of all 50 states. And I don't hear people complaining about the insurance policies that they're getting from their big companies. In fact,
we do.
Many of those now would fall into what we've been calling Cadillac plans, because they provide very excellent service. So I think that, frankly, is a red herring, and I think that you're not going to have adequate coverage if you have an association health plan that's working under the same rules as a large company.
But, John, would you favor a standard that says they have to do something like that, or would we just leave it up to the insurance company?
I would say that we put the association health plans in exactly the same position that large companies are today, with exactly the same rules under ERISA.
See, we don't, I mean, with all respect, we don't agree with that. We don't agree with the idea that the insurance company should get to make that kind of decision about whether the lady goes home Thursday or Sunday. Now, I don't think that's intrusive. I think that makes common sense. But if we could find a way to bridge that gap, and I think we could, then I think the AHPs that you support aren't all that different than the exchanges that we do, and I would think that would be a common ground.
This has been a useful conversation. Paul Ryan wants to make a comment.
Can I just interject one quick point here, very quick, just in terms of trying to keep everything fair, which I know you want to do. To this point, the Republicans have used 24 minutes, the Democrats 52 minutes. Let's try to have as much balance as we can.
I think the Republican leaders are controlling the time for the Republicans, if I'm not mistaken. Is that right?
I don't think that's quite right, but I'm just going back and forth here, Mitch. I think we're just trying to go back and forth, but that's okay. Paul, I was about to call on you, if that's all right. Go ahead.
All right, Rob, here's basically what we're looking at. The difference is this. We don't think all the answers lie in Washington regulating all of this. So the problem with the approach we're seeing that you're offering, which I do believe, Senator, is very different than what we're saying, is we don't want to sit in Washington and mandate all of these things. So what you're doing is you're defining exactly what kind of health insurance people can have. You're mandating them to buy this kind of health insurance. And so we simply say, look, if the National Restaurant Association or the National Federation of Independent Business, on behalf of their members, wants to set up an association health plan, we think they'll probably do a good job on behalf of their members. Let them decide to do that instead of restricting insurance competition by federalizing the regulation of insurance and by mandating exactly how it will work. You make it more expensive and you reduce the competition among insurers for people's business. We want to decentralize the system, give more power to small businesses, more power to individuals, and make insurers compete more. But if you federalize it, standardize it, and mandate it, you do not achieve that. And that's the big difference we have.
Paul, would you yield? Mr. President, may I ask him to yield?
We're not in a formal hearing here, okay. So go ahead.
Paul, I read your roadmap, and I thought one of the things that you said is that there should be some minimum consumer protections in the exchanges that you propose. Did I get that wrong?
And there are in every state. And so what we're simply saying is, look, lots of us have offered lots of different ideas. We've got dozens of Republican ideas offered in the House, in bills, in the Senate. And many of us look at the point of the fact that the states, do we distrust our governors? Do we distrust our state legislatures? Do we distrust all the state insurance? Yeah, okay, some of you may do that.
Depends on who it is.
But should we regulate all of this? Should people in Washington decide exactly how this works and what you can and cannot buy?
Paul,
there's just a difference in philosophy.
No. Look, I think this is an important point. We've got a couple other people who want to speak. We've gone about 45 minutes on this section. We're running over because we went long on the opening statements, and you're right, there was an imbalance on the opening statements because I'm the president, and so I made I didn't count my time in terms of dividing it evenly. In this section, Mitch, we've gone back and forth
Senator
pretty
Schumer
well.
for the Senate.
I know Senator Schumer wants to speak, and I know that Jim Clyburn wants to say something very quickly, and you guys may want to.
John Kyle would like to.
And John, but what I want to do though is just focus in on this philosophical debate. This is a legitimate debate. And it actually speaks to the point that Congressman Camp was making earlier about what's happening in the exchanges. You know, when I was young, just got out of college, I had to buy auto insurance. I had a beat-up old car. And I won't name the name of the insurance company, but there was a company, let's call it Acme Insurance, in Illinois. And I was paying my premiums every month. After about 6 months, I got rear-ended, and I called up Acme and said, you know, I'd like to see if I can get my car repaired. And they laughed at me over the phone because really this was set up not to actually provide insurance. What it was set up was to meet the legal requirements, but it really wasn't serious insurance. Now, it's one thing if you got an old beat-up car that you can't get fixed. It's another thing if your kid is sick or you've got breast cancer. So the general idea has been here that we should set up some minimum standards within the exchange, that a plan that people are buying into, whether it's a small business or an individual, should be at least solid enough that if your kid got sick, they're actually going to be treated. That if something happened, that you weren't left with a huge bunch of out-of-pocket costs. It is true that you can always get cheaper insurance if it has really high deductibles or really high co-payments or doesn't cover as many things. And so there has to be a balance that's struck there. I just want to point out, though, that the principle of pooling is at the center of both the Senate and the House bill. And the reason I'm pointing this out is because there was a lot of talk about government takeover of health care. And the implication, I think, was that everybody was going to have to sign up for a government health care plan. Now, that's not the issue. What the issue here, which we've had an honest disagreement about, is how much should government set a baseline versus just letting people decide that, you know, I can't really get decent insurance, but, you know, maybe this is better than nothing. And that's a legitimate argument. I don't disagree with that, but I just wanted to point out that when we start talking about how much government involvement is at issue here, it's not because the House or the Senate bills are a government takeover of health care. It is that the House and the Senate bills put in place some regulations that restrict how insurance companies operate, and if there's an exchange or a pool that's set up, that there's a baseline sort of minimum requirements that were expected, and I understand that there may be some philosophical differences on the other side of the aisle about that issue. Chuck, go ahead.
Thank you, Mr. President, and I thank you. I think this has been a constructive dialogue. I was glad to hear my friend Tom Coburn's remarks. I think we agree with most of them, and particularly the point that about a third of all of the spending that's done in Medicare, Medicaid, I would imagine a lot of it's in the private sector as well, doesn't go to really good health care, goes to other things. And the real nub of this is how do we wring that waste out, that fraud, abuse, duplication, without interfering with the good care that we want every person on Medicare, Medicaid, and private insurance to get. The average citizen knows this happens. How many times when you look at your medical bill, you've undergone a minor procedure, and you see Dr. Smith, $4,000, and you sort of vaguely remember he just waved and poked his head in the door? Or how about, probably it's happening right now, there's some salesman talking to some doctor and saying, hey, my company will finance a machine for you for $1 million. So you don't have to pay for it. You can gradually pay it. We'll show you how to fill it up all the time, and you'll increase your income by $200,000. And there's another machine 3 blocks away that's already working and available. So these are the things we have to go after. And Tom, I thought your suggestion of undercover patients, and I tried to check here, I don't think we do it now, is a great idea. And it's one that we can come together on. I think there are other things that we can come together on. Senator Cantwell put a provision in the Senate bill that said we ought to reward doctors for doing quality, not quantity. So that doctor, and there's a small number of doctors that go on, these studies showed thing in the New Yorker that I think we've all read, that a small number of people who are just trying to maximize their income throw the whole system off. It threw the whole city of McAllen, Texas off, while El Paso had much lower rates. Maria Cantwell has a provision in there which I would think you folks could agree on, that says that we ought to reward doctors for the quality, not the quantity, not the number of times they could put someone through a machine, but how good the care is. There's a provision in there, Senator Rockefeller authored, it comes in the insurance part, that says 80 to 85% of what insurance companies put forward should go to the get money in for, should go to the patient. So I think we can do all of these things, but if we're going to eliminate the waste, fraud, and abuse in Medicare, it does mean we're going to cut some of that out. And when I hear my friend Dave Camp say, you cannot cut money out of Medicare, well, we don't want to cut the good stuff that you point out, or add the prevention, but if we're going to, if what Senator Coburn says, that 1/3 of Medicare doesn't go to patient care, you can't just get up there and say, we don't want to cut anything out of Medicare. We want to cut the bad stuff and keep the good stuff. And I think that's where we can find common ground on some of the things you've mentioned, some of the things that are in our bill. And I hope at least in this area we can move forward that way, because frankly, the Republican Party has always stood for getting rid of the waste, fraud, and abuse in the system. In '97, it was the centerpiece of your program. And all of a sudden this year we're hearing, don't do any of that. That's something that I think we can come together on. I thank you.
Mr. President, can we turn to John? I'm sorry.
Sure. I'm sorry. You had John. We're going to go to John, and then we're going to go to Jim Clyburn, and then I think we're going to take a break because we've run out of time. So, John.
Thank you, Mr. President. I think you framed the issue very well just a moment ago, because there are some fundamental differences between us here that we cannot paper over. And, Mr. President, when you said that this is a philosophical debate and it's a legitimate debate, I agree with that. We do not agree about the fundamental question of who should be mostly in charge. And you identified this question as central. Do you trust the states, or do you trust Washington? Do you trust patients and doctors making the decision, or do you trust Washington? Now, there's a mix of both, of course, in health care. But there is a big difference between our approaches. And there is so much in the bills that you've supported that puts control in Washington that we have a very difficult time supporting those provisions. And it's not a matter of just saying we all agree on the goal of reducing waste, fraud, and abuse. We all do, of course. It's how you do it. Now, let me give you a couple of examples. Dave Camp, I think, pointed out the answer to the dispute that you and Lamar Alexander had a moment ago, and he was exactly right. Let me quote from the Congressional Budget Office letter. This is from Doug Elmendorf to Evan Bayh, November 30th, 2009. Quote, CBO and Joint Tax Committee estimate that the average premium per person covered, including dependents, for new non-group policies would be about 10% to 13% higher in 2016 than the average premium for non-group coverage in the same year under current law. Oliver Wyman, a very respected third-party group, says it's even more, about 54%. In my state of Arizona, 72% increase. Why is it so? For a variety of reasons, but one of which both you and Dave Camp agreed on. It is a richer benefit. How did it get that way? Because the federal government would mandate it under your legislation in the insurance exchanges. And as a result, there would be a higher cost. How does this happen? There is an actuarial requirement of 60% actuarial value in the exchange for the least costly plan. But the average in the country today of a high deductible plan is 48%. The range today is 40 to 80%, and the average is between 55 and 60. So what the government is doing here is saying, we're going to mandate that the insurance cover more things than it does right now, and therefore the cost is going to go up. Second example, you say, how can we help small businesses? Well, we know one way you don't help small businesses is by raising the payroll, the Medicare payroll tax on them, which is what this legislation does. Besides that, it's a job killer. Look at the taxes on beneficiaries as well. This is a third example. You don't cut costs when you raise taxes on medical devices that help us, when you raise taxes on pharmaceutical products, when you raise taxes on the insurance premiums themselves. Quote, "These fees on insurers, medical devices, and pharmaceuticals would increase costs for the affected firms, which would be passed on to purchasers and would ultimately raise insurance premiums by a corresponding amount." Congressional Budget Office. So when you raise these taxes in all of the different fees that are in this legislation, it inevitably increases the costs on the consumer. And why do you have to raise all of this money? Because of the expenses of the legislation that underlie all of this. That's why Republicans would rather start not by having to raise a lot of money in order to pay the high cost of this bill, but to start a piece at a time, directing solutions to specific problems. That way you don't incur all of the costs up front, which require you to raise the taxes. Last quick point. One of the worst things about this is, for people that have catastrophic medical expenses today, after you've spent 7.5% of your adjusted gross income, you can deduct that. This bill would raise that to 10%. Who does that hurt? The very people you promised, Mr. President, that you wouldn't allow taxes to be raised on. Average age, 45. Average income, $69,000. These are not wealthy people. Just another example of why, because the bill has to raise so much money, it ends up hurting the very people that we want to help.
Okay. John, I'm going to go to you, Jim, but since, as has tended to happen here, we end up talking about criticisms of the existing bill as opposed to where we might find agreement. I feel obliged just to go through a couple of the points that you raised. Just to go back to the original argument that Lamar and I had, and we've now chased around for quite some time. Look, if I'm a self-employed person who right now can't get coverage or can only buy the equivalent of Acme insurance that I had for my car. So I have some sort of high deductible plan. It's basically not health insurance, it's house insurance. I'm buying that to protect me from some catastrophic situation. Otherwise, I'm just paying out of pocket. I don't go to the doctor, I don't get preventive care. There are a whole bunch of things I just do without. But if I get hit by a truck, maybe I don't go bankrupt. All right, so that's what I'm purchasing right now. What the Congressional Budget Office is saying is that if I now have the opportunity to actually buy a decent package inside the exchange that costs me about 10 to 13% more, but is actually real insurance, then there are going to be a bunch of people who take advantage of that. So yes, I'm paying 10 to 13% more because instead of buying an apple, I'm getting an orange. They're two different things. Now, you still have an option of, let me finish. The way that this bill is structured uses a high cost pool, a catastrophic pool, for people who can't afford to buy that better insurance. But overall, for a basic package, which by the way is a lot less generous than we give ourselves in Congress. So, I'm amused when people say, let people have this not so good plan, but let them have a high deductible. But there'd be a riot in Congress if we suddenly said, let's have Congress have a high deductible plan, because we all think it's pretty important to provide coverage for our families. And the federal health insurance program has a minimum benefit that all of us take advantage of. And I haven't seen any Republicans or Democrats in Congress suddenly say, you know what, we should have more choices and not have to have this minimum benefit. So what we're basically saying is we're going to do the same thing for these other folks that we do for ourselves, on the taxpayer's dime, by the way. Now, there is a legitimate philosophical difference around that, but I think it's just very important for us to remember that saying there's a baseline of coverage that people should be able to get if they're participating in this big pool is not some radical idea. And it's an idea that a lot of states, we were talking earlier about what states do. A lot of states already do it. This, by the way, goes to the other difference that we have when it comes to interstate purchase of insurance. Actually, this is a Republican idea, been championed by the Republicans. We actually agree with the idea that maybe if you get more regional markets and national markets as opposed to just state-by-state markets, you might get more choice and competition. People would be able to say, gosh, there's a great insurance company in Nevada, and I live in New York, and maybe I can purchase it. That's actually something that we find attractive. So do you guys. But again, the one difference, as I understand it, and the reason you're not supporting the approach that we take is what we say is there should be sort of a minimum baseline benefit, because if not, what ends up happening is you can have a company set up in Nevada. Let's assume there were no rules there. There are no protections for the woman who's got breast cancer. They go into New York. They offer pretty cheap insurance to everybody who's healthy. They don't offer the same insurance to people who aren't so healthy or have pre-existing conditions. They drain from New York all the healthy people who are getting cheaper rates, but now suddenly everybody left in New York who doesn't qualify for that cheaper plan is in a pool that's sicker, older, and their premiums go up. So what we've said is, well, if we can set a baseline, then you can have interstate competition, but it's not a race to the bottom. Rather, everybody's got some basic care. Now, these are legitimate arguments to have, but I just want to point out that this issue of government regulation, and which we're going to also be talking about with respect to insurance, is very different than the way this has been framed during the course of the debate over the last year, which is government takeover of insurance. This is not a government takeover of insurance. What it is saying, let's set up some baselines and then use market principles, the private sector, and pooling in order to make sure that people get a better deal. So, Jim, and then what we're going to do is we're just going to move on to the next topic, but anybody who wants to pick up on what we've just talked about obviously can return to that as well.
Thank you very much, Mr. President. Mr. President, leaders and members of the Congress. Look, there are two cost containment issues that I think have not been sufficiently vetted here today. And let me set this up by sharing with you a conversation I had on yesterday with the administrators of the Dillon or McLeod Healthcare Center in Dillon, South Carolina, a little town, Mr. President, you've become quite familiar with. They told me that their emergency room activities have doubled over the past several years. And they were looking for some assistance to expand the size of that emergency room. When I began to question them as to why in this small county, not in my district, they had such a doubling, what it turns out is that they told me that 31% of the people that they treat in that emergency room are not there for emergencies. They are there for primary care. Now, they said to me that some of these people do not have health insurance, but many of them do have health insurance, but they cannot afford the $1,500 to $2,000 deductibles that they would have to pay if they were to go to a private primary care provider. So they are now treating people who've got employer-based health care that they cannot use. They're holding that for some catastrophic event, but they need some assistance. Now, I think that no matter what kind of plan we develop, there will be many people left uncovered, and we need a safety net for those people. I believe that the one way to provide that safety net and to take care of all of those people who may be uncovered and those people who have $2,000 deductibles with primary care is for a significant expansion of community health centers. And we have not spoken about that here today, But I know that your proposals, Mr. President, I know that both the House and Senate plans have that in them, and I do believe that that is very, very important. We have more than a 40-year experience with these healthcare centers, and I do believe that no matter what we do, there ought to be a significant expansion of those healthcare centers. Secondly, Mr. President, a lot of other things have been said about what I have on this paper, but one other thing I would like to mention, and it has to do with people who really cannot navigate the system. People who work very hard, they know what they need for themselves, but I was reminded of that when we talked about putting together restaurant owners who will design plans for their members. I would hope that when we started designing plans for the members of small businesses, let's keep in mind that the employees of those small businesses are not negotiating these plans. They are at the mercy of the small business owners, and the question is whether or not the plans are sufficient that they will not fall into the same category that these people with $1,500 to $2,000 deductibles. Finally, Mr. President, this morning I was doing one of these call-in shows on C-SPAN. A gentleman called in, and he was very, very emotional. He said to me that he was getting ready to have transplant surgery. But he was told by the hospital that because he's on Medicare, that his post-operative treatment is going to be limited to 3 years. After that, he'll have to find some way to pay. This man was very emotional today. What we're doing here fixes that, and I do believe that we ought to really be honest with the American people. When we talk about what we are doing with Medicare, we're trying to make sure that Medicare is there for that man and so many others who will find themselves in his position. With that, I'll yield back, Mr. President.
Okay, I think this has actually been a very useful conversation. What I'm going to do is move on to the next topic, but maybe after we break for lunch and come back, I want to go through some areas where we decided we agreed. I know the abuse is a good example. Some areas where we still disagree. One thing, John, you shook your head when I said that people would be able to choose the better plan because the notion was, well, people are mandated. Actually, any insurance that you currently have would be grandfathered in so you could keep. And so you could decide not to get in the exchange the better plan. I could keep my Acme insurance, just a high deductible catastrophic plan. I would not be required to get the better one. If I chose to get the better one, it would be 14 to 20% cheaper than if I were going into the individual market. I just want to clarify that issue.
Mr. President, if I could clarify, that's for a very limited period of time, number one. Secondly, the incentives are set up so that employers would drop you from their coverage because it's cheaper for them to pay the fine than to continue to pay the insurance, so they wouldn't be able to keep what they have. And third, there are still mandates in the legislation as to what you can do with what you have, such that it doesn't end up being the same coverage. So with all due respect, I disagree. And it's just a fundamental disagreement between us. Does Washington know best about the coverage people should have, or should people have that choice themselves? Pay a little less, get a little less coverage, or pay a little more and get more coverage?
Can I just say that at this point, anytime the question is phrased as, does Washington know better, I think we're kind of tipping the scales a little bit there, since we all know that everybody is angry at Washington right now. I think so it's a good way of framing. It's a good talking point, but it doesn't actually answer the underlying question, which is, do we want to make sure that people have a baseline of protection? And this topic of the insurance market reforms, I think, is a good additional example of what may be philosophical differences, but what we may have in common. Rather than go through the problem, because I think everybody understands out there the issue of people with pre-existing conditions not being able to get insurance, people coming up with, bumping up against lifetime caps and suddenly thinking, as a family I met in Colorado, they thought their child was covered. Suddenly they hit the lifetime cap and they started having to scramble to figure out how they pay the additional costs. We all are familiar with these examples. I just want to go through areas where I think we agree on insurance reforms, or at least some Republicans and some Democrats agree. I think that we agree on the notion that you can't just drop somebody if they've already purchased coverage. Looking at your bill, John, the idea that you ban rescissions. We agree on the idea of extending dependent coverage to a certain age. Some people say up to 25, some people say up to 26, but we basically agree on that concept. We agree on no annual or lifetime limits. We agree philosophically that we want to end the prohibition on pre-existing conditions. I think the thing we're going to have to talk about is how do you actually accomplish that? There may be a disagreement as to whether you can do that without making sure that everybody's covered. But that's something that we can talk about. In addition, though, there are some other insurance reforms that have been proposed by the House and Senate in their legislation that I think we should explore. And maybe we can narrow the gaps there and come up with some, even a longer list of areas that we agree on. So what I do is, since I want to make sure that Mitch doesn't give me a time clock tally again, let me first go to Mitch, and I don't know who wants to make the presentation with respect to insurance reform.
Mr. President, I'd like to yield to Dr. Bastani to continue this conversation about insurance reform.
Thank you, Leader Boehner, and thank you, Mr. President. I come at this as a physician, a cardiovascular surgeon with over 20 years of practice doing open heart surgery, dealing with patients who have come to me with very, very challenging cases at very difficult times in their lives. And along with my colleagues, Dr. Coburn and Dr. Barrasso, we bring a wealth of experience in dealing with insurance companies and all these everyday problems that so many American families face. We all agree that we need insurance reform. There's no question about it. The question is, how do we do it? Now, we've all been through a long year. Town hall meetings, telephone calls, emails, it goes on and on. And one thing that has become very clear, the American people have spoken out very loudly and very clearly. They want us to take a step back and go step by step with a common sense plan that really brings the cost down for American families and small business owners. They want insurance companies to treat them just like they treat big labor unions and large companies. It's been a resounding message we've heard over and over. So how can we achieve all this? Well, we've talked about some of it. I think one of the things we ought to really look at is how do you simplify, streamline, and standardize all the paperwork that's involved? Because I can tell you as a doctor, and my two colleagues who are physicians will know, that it takes you away from patient care. It interferes with the doctor-patient relationship. It runs up cost in medical practices, and it's a real issue. So I think we can all agree on that. We need to address that issue. A second area is how do you really promote choice and competition? We've all talked about it, and I think we've had a lot of discussion already on those issues. We put forth a plan earlier in the year during debate that actually the Congressional Budget Office showed that it brings down the cost of premiums up to about 10%. And actually for individuals seeking and families seeking insurance in the individual market, those cost savings could even be higher. As opposed to the bill we have here, where we've had some discussion already, and Mr. Camp has already outlined, as well as Mr. Kyle, that this bill would actually raise premium cost. We've talked about small business health plans. You know, again, I ran a small business. It was a medical practice. And when I wanted insurance, when those premiums were going up in double digits every year, I'd call an insurance agent. They would come in, and we had very limited choice. Very limited, and the cost kept going up. Small business health plans is one way to really deal with this and allow for pooling. And where our big disagreement is, frankly, it's with how you do it. And if you create a plan with exchanges that are overly restrictive, it really doesn't, it defeats the purpose. And I believe we can have faith in the American public to figure out, if it's transparent enough, what's their best deal? What's the best deal for a small business owner or a family in this sort of arrangement? The same goes for purchasing insurance across state lines. I'm glad to hear our Democratic colleagues agree that this is an approach that needs to be taken to promote choice and competition. But again, we feel that this bill restricts those options too much. And we think we can do it in a responsible way. I believe we probably could come together on this. But I think the existing proposals restrict it far too much. Health savings accounts. These are very, very popular among small business owners and families. And I think the one impediment today is the inability to save enough in these. And I think there are ways that we could promote these health savings accounts and promote real savings that will actually make a difference. It won't solve all the problems, but it's an important insurance reform that I think small businesses will really jump on if we could expand those savings opportunities. The current bill, as has been stated, adds some restrictions and some additional tax provisions on these, which make them less palatable. We all agree on prohibiting insurance companies from arbitrarily canceling insurance policies. That's a no-brainer. There's a strong agreement on both sides of the aisle there. Now, with regard to pre-existing conditions, this is an issue that is very difficult, and many of us and our families may have been faced with it. I can tell you I faced it when I closed my medical practice because I had a health condition, an arthritis condition. And I went to the same insurance carrier that covered my small medical practice for 14 years and got the big red no. Can't insure you or your family. Now, that's frankly unacceptable. Now, what we propose is using risk pools, expanding these risk pools, and reinsurance. It's an affordable way to do it. It creates certainty for a family that's faced with this very difficult set of circumstances. Certainty is important. And our plan would not raise premium costs extravagantly, whereas the proposal here would raise those costs, and it doesn't really create the kind of certainty a family needs because there are waiting lists, and that proposal is only temporary to something else that we don't know what it's going to be. The other thing we do is we create a way for small business owners to actually shop and compare apples to apples. Transparency. And this is critical. Our plan does this without creating the kinds of restrictions that we see with the exchange process. And we agree that we have to eliminate annual and lifetime caps, so we have broad agreement there. So again, I think it's clear that the American people have rejected the bills that have gone through so far because they see increases in premiums for families. They see that it raises taxes significantly on families and raids Medicare to create a new entitlement. This doesn't really bring down the cost. This is really not the answer. What American families want is a common sense, step-by-step approach that will really lower the cost for families and small businesses.
All right.
I believe we have a duty to reform health care, but we have an obligation to get it right.
Okay. Thanks, Charles. We're going to go to George Miller, and if you want to respond to specific things that Charles raised or make some more general points, we'll then go back to a Republican. At some point in this discussion, and we're going to have to be a little more disciplined in our time in order to stay on schedule on this section. At some point, I'd like Secretary Sebelius, who is not only a former governor but also insurance commissioner, to address some of the issues that have been coming up around insurance and minimum payments.
Mr. President, I don't know if any of us were told of what the time limits are.
Well, I'm trying to be flexible.
No, I'm just curious if you've got a certain amount of time.
We've got about half an hour remaining for this section. So if people can keep their
Thank you.
Mr. President,
points brief.
From the Senate, we have Senator Harkin and Rockefeller respond
Right.
for the Democrats.
And I've got a list. George?
Thank you very much. This issue of insurance reform is, I think, where most families intersect with their insurance companies, with the health security of their families. And let's start out with our commonalities in the bill that Congressman Boehner, Leader Boehner, offered on the floor. He agreed that lifetime caps should be abolished, that annual caps should be abolished, that young people should be able to stay on their parents' plan. I think it was 25. I think in your suggestion, Mr. President, it's 26. So there's that kind of commonality there. But we think that, and our bill goes further in some of the suggestions you've made in the interim since the House and Senate have passed these bills, is that clearly we think that preventative care should not carry a copay with it, that we ought to encourage people to get that kind of preventative care for themselves, certainly for their children. We allow the health savings accounts to continue. That's a variation on, as my colleague talked about, what they think insurance reform should reflect. Clearly now, when we see the request in California for a 38% increase, in Michigan for 56% increase, I think in Maine it's 27% increase, you've suggested stronger language than we have in either the House or Senate bill, I think along the lines what Senator Feinstein has been talking about in terms of rate review. People are trapped in these systems. But the one area where there still seems to be disagreement, it was not in the substitute offered by the Republicans when we were on the floor, and that is this question of pre-existing conditions, because this is a real trap for families. Either because you find out that you need to go to get care for a disease or an illness, and you may get a checkup and they may discover that you have arthritis, but you didn't disclose you had arthritis. So now that's a pre-existing condition, and you may lose that policy. You may have to provide more. And the fact of the matter is, you hate to admit this at my age, but I sit here with 2 artificial hips, a little bit of arthritis, and I have a kidney stone. I'm dead in that insurance market if I have to switch policies or switch companies or look for another chance. Now, why should that be? Those hip replacements have been with me for 15 years. And I have no trouble, but it's a way of denying me care. And if you have acne, it's a way of denying you care. In fact, what you see from one of the Blue Cross companies here is 3 pages of things that will keep you out of care, will keep you from changing your jobs. And it goes on and on and on. With those, back pain will keep you, a pre-existing condition, acne that I mentioned, a cleft palate that we talked about earlier here. It means that. So what does that mean when you want to change jobs? What does that mean when you want to start your own company? It means you go without insurance. Or you pay some policy that has a $5,000 deductible or $7,000 deductible. This is a real issue to American families. 56 million people right now have insurance policies where pre-existing conditions can knock them out at any given time. We know that 13 million people were denied coverage over the last 3 years because of pre-existing conditions. And so now you're trapped. You have a pre-existing condition. You can continue maybe with that insurance company if you pay more, but you can't shop in the marketplace for another insurance company. You can't go from Blue Shield to Kaiser because you have a pre-existing condition. You start to see the economic trap and uncertainty that families are confronted with. Now, the interesting thing was, during these negotiations, Senator Dodd and I worked very hard on these issues. Most of the business community signed off on getting rid of these pre-existing conditions, and I think that that's important for us to understand, that is what real insurance reform is about. Should you still be able to charge women more than men? Should you rate based upon gender? To what extent can you rate based upon ages? What's the essential benefit that we're providing? We can all describe that plan that's really inexpensive. It just doesn't have many benefits that go with it for families. And so I think that this is a very important part of this discussion. I know, and when I go home, my district, I hear about this from the people I represent. I hear about this from my wife, and she's talking about our kids and her friends and people she spends time with, how they struggle with these. And what we're really talking about is the manipulation to move people around within the insurance market. And yes, you can go to a high-risk pool. So yes, because you have a pre-existing condition, because I have 2 artificial hips, I can go to the most expensive insurance system in the country. I'm now in a high-risk pool, and I'm trapped in that high-risk pool forever. You can make it a high-risk pool among states. You can make it a high-risk pool among small businesses. You can make it a high-risk pool among large businesses. I'm still trapped in the most expensive insurance because of something that happened to me that I had no control over. I have a cleft child with a cleft palate. I have a child with acne. How can this possibly be? Now, fortunately, in our discussions, as I said, a lot of the business organizations have agreed that these things should be phased out over time. Some can be put in right away, as it's not terribly expensive to cover people 18 to 26, and that can be done right away, and we have that commonality. So I would just hope that we would focus on this issue of what real insurance reform looks like with respect to the impacts on families and individuals as they try to navigate this insurance market.
Thank you, George.
Mr. President, we'll turn now to John McCain.
Well, thank you, Mr. President. Thank you for doing this. And I understand the 4 categories, but there's a big category that the people in my state and across this country are deeply concerned about. And that's not just the product that we are examining today, the 2,400 pages, but the process we've gone through to reach that. Now, both of us during the campaign promised change in Washington. In fact, 8 times you said that negotiations on health care reform would be conducted with the C-SPAN cameras. I'm glad more than a year later that they are here. Unfortunately, this product was not produced in that fashion. It was produced behind closed doors. It was produced with unsavory, I say that with respect, deal making. The Louisiana Purchase, funding of $300 million for one state. The Cornhusker kickback, which is, I understand now, been done away with. One of the things that, as provisions of this legislation that was particularly offensive was the carve-out for 800,000 Florida seniors exempt from cuts in Medicare Advantage program. There's 330,000 seniors under Medicare Advantage in my home state of Arizona. They're deeply concerned about that. They're deeply concerned about the carve-outs for Vermont, Massachusetts, Hawaii, Michigan, Connecticut. $100 million for a hospital in Connecticut. Why should that happen? They don't understand it. And at the town hall meetings that I conduct all over my state, people are angry. We promised them change in Washington, and what we got was a process that you and I both said we would change in Washington. So then we got into the special interests, whether it be the Hospital Association or the AMA or others, and one of them that was particularly egregious, and I won't go through the whole list, was pharma. Pharma got an $80 billion deal, and in return for which they ran $150 million worth of ads in favor of, quote, health reform. Their over $2 million a year lobbyist was here at the White House and was reported to say in the media, a deal is a deal. And part of that deal was that there would not be competition amongst pharmaceutical companies for Medicare patients. The other, well, among others, was that the administration would oppose drug reimportation from Canada, a proposal that you supported in the United States Senate.
John,
can I just say, can I just finish, please?
Well,
and then at Christmas Day, I believe it was Christmas, the majority leader said, quote, "A number of states are treated differently than other states. That's what legislation is all about. That's compromise." Compromise is not the word for that. So when my constituents and Americans now who overwhelmingly reject this proposal say go back to the beginning, they want us to go back to the beginning. They want us not to do this kind of legislating. They want us to sit down together and do what's best for all Americans, not just for some people that live in Florida or happen to live in other favored states. They want a uniform treatment of all Americans. So I hope that that would be an argument for us to go through this 2,400-page document, remove all the special deals for the special interests and favored few, and treat all Americans the same under provisions of the law so that they will know that geography does not dictate what kind of health care they would receive. I thank you, Mr. President.
Let me just make this point, John, because we're not campaigning anymore. The election's over.
I'm reminded of that every day.
So we can spend the remainder of the time with our respective talking points going back and forth. We were supposed to be talking about insurance. Obviously, I'm sure that Harry Reid and Chris Dodd and others who went through an exhaustive process through both the House and the Senate with the most hearings, the most debates on the floor, the longest markup in 22 years on each and every one of these bills would have a response for you. My concern is that if we do that, then we're essentially back on Fox News or MSNBC on the split screen just arguing back and forth. So my hope would be that we can just focus on the issues of how we actually get a bill done. And this would probably be a good time to turn it over to Secretary Sebelius.
Could I just say, Mr. President, the American people care about what we did and how we did it. And I think we ought, and it's a subject that I think we should discuss, and I thank you.
They absolutely do care about it, John. And I think that the way you characterized it obviously would get some strong objections from the other side. We can have a debate about process, or we can have a debate about how we're actually going to help the American people at this point. And I think that's the latter debate's the one that they care about a little bit more. So, Kathleen, why don't you just address some of the issues related to insurance reform? There is some agreement here, but I know that on the Republican side there are a couple of concerns about the issue of rate review, the issue of setting up some benchmark standards that insurance companies have to abide by. Some people may think that those have been a little bit too aggressive. You've been both a governor as well as an insurance commissioner. Maybe you can talk a little bit about what you've seen at all those different levels and how you think we can best move forward to protect American families.
Well, thank you, Mr. President, and I know there are lots of people who want to comment on these topics, but I don't think there's any question, and I think there's a lot of agreement that the current insurance market really fails way too many people. It is a system that is not a market for about 40 million Americans who are either in an individual policy or in a small group policy, have no choice. There is no competition. According to the American Medical Association, in their study yesterday, 99% of the market in metropolitan areas, 75% of the markets across the country are very concentrated, which means they're monopolies. They're not markets. So we got a trap. And I think the rules allow people to be locked out from the front end if you've got pre-existing conditions, allow people to be thrown out with a stop on benefits during the course of a treatment, or when your policy expires and you're supposed to renew, you're dumped out of the market, or to be priced out, which is going on across this country. There's been a highlight of a couple of rates, but double-digit rates across the country, on top of double-digit rates, on top of double-digit rates, and people have no choices. So The common areas, I think, of agreement, high-risk pools. There are lots of states across the country running high-risk pools. As an insurance commissioner, we ran the high-risk pool in Kansas. It is a strategy that's been in place for almost 30 years in many states. 200,000 people total in the entire United States are in high-risk pools because they're so expensive that they really don't offer it. Because when you put all the sick people together and you say, okay, you get to buy a policy and you get no help with that policy, it is a death spiral. You will always have the highest cost, and on top of that, the highest cost, and you've got the sickest people who are already paying the highest cost for treatment. They don't work very well. They are a stopgap measure that the House and Senate have proposed to get people from here to a new market. I think what the exchanges have a lot in similarity with the health plans that have been talked about by the House and Senate. There's a big difference, and it's not a Washington difference, it's a state difference. The state insurance commissioners across this country have unanimously opposed health plans for decades, and they feel that it takes people. It isn't the pooling that's objectionable, it's the fact that there is no consumer protection, that there is no ability to apply common sense rules. And we had the drive-by deliveries in Kansas where people were being kicked out of the hospital 18 hours after having a baby to save money, only to be readmitted with jaundice and to be readmitted with dehydration. It's not a particularly good idea. So getting rid of pre-existing conditions, getting rid of caps on yearly benefits and long-time benefits, allowing kids to stay on plans are ideas that have been accepted by both, setting up a new marketplace, giving small business owners and individuals choice and competition in the private sector, but making the private sector operate on a different set of rules, including having some loss benefit analysis. How many of those dollars, you heard Senator Coburn eloquently talk about the 30 cents of every dollar that goes to pay for expenses other than medical costs. A loss benefit analysis, a medical ratio would do just that. How many of your dollars are you actually spending on provider care, on prescriptions, on treatments, and how much is going to overhead and CEO salaries and advertising to try and get a handle on rates, having some rate review, having some transparency and some opportunity to have people make choices and make companies compete with one another and not separate the marketplace. I think the most dangerous part of the system right now is having people, having insurance companies pick and choose who gets coverage and who doesn't based on your health condition. It's a lot cheaper to insure people who promise never to get sick. I watched it as insurance commissioner, but segregating that market is not insurance. It's not pooling a risk. And I think your proposal, Mr. President, gets back to the notion that there'd be a pool. There'd be an opportunity to pool that risk and have people have the kind of negotiating power as a governor. And like Senator Alexander, I am a former governor. We both ran our state employee health pools. I don't know about Tennessee, but in Kansas, that was the largest pool in the state, 90,000 covered lives. We had a lot of negotiating power. We could get a pretty good deal on a couple of companies competing on hospital rates, on doctor rates. That's what this kind of pooling mechanism and a new exchange would give everybody, and it's around a set of standards that made sense.
Okay.
Mr. President. Mr. Cantor, please.
Eric?
Mr. President, thank you again very much for having us and for staying with us for the 6 hours. Appreciate that. I don't know if you will after the 6 hours or not, but
I gather, let me just guess, that's the 2,400-page health care bill. Is that right?
Well, actually, Mr. President, this is the Senate bill along with the 11-page proposal that you put up online that really I think is the basis for the discussion here. So, but I do want to go back to your suggestion as to why we're here. And you suggested that maybe we are here to find some points of agreement to bridge the gap in our differences. And I I do like to go back to basics. We're here because we Republicans care about health care just as the Democrats in this room. And when the Speaker cites her letters from the folks in Michigan and the leader talks about the letters he's received, Mr. Andrews his, all of us share the concerns when people are allegedly wronged in our health care system. I mean, I think that is sort of a given. We don't care for this bill. I think you know that. The American people don't care for the bill. I think that we've demonstrated, in the polling that they don't. But there is a reason why we all voted no. And it does have to do with the philosophical difference that you point out. It does have to do with our fear that if you say that Washington can be the one to define essential health benefits, there may be a problem with that. And that's the language in the Section 1302 of this bill, that it says that the Secretary shall define for people what essential health benefits are. But let's, in the spirit of trying to come together, let's try and say maybe if we assume that Washington could do that, could really take the place of every American and decide what is most essential, what would be the consequences? And that's also where we have a big difference in this bill and what would happen. First of all, the cost. And John Kyle laid out the tremendous costs and the nearly $1 trillion of this bill, and I don't quite know because CBO said it couldn't assess how much your additions would cost to it, but we do know that there are plenty of taxes on income now. You suggest investment income should be taxed. We have additional taxes on medical devices and the rest. What is the consequence of that? We know there are consequences that small businesses will feel because of the impact on job creation. But also, Mr. President, when we were here about a year ago across the street, you started the Healthcare Summit by saying one of the promises you want to make is that people ought to be able to keep the health insurance that they have. Because as we also know, most people in this country do have insurance, and overwhelming majority of people do like that coverage. It's just too expensive. Well, the CBO sent a letter, I think it was to Leader Reid, about the Senate bill, and in that letter it suggested that between 8 million and 9 million people may very well lose the coverage that they have because of this, because of the construct of this bill. That's our concern. And so as we're in the market, in the section of this discussion about health insurance reform, I know, Mr. President, that you have suggested strengthening oversight of insurance premium increases because we want to make sure that there aren't excessive insurance premium increases that take place. The problem is when you start to mandate all of the essential benefits, there are going to be some insurance premium increases. None of us really want to see them, but if you stop them, who's going to pay for it? Well, when we get back to the fact that businesses won't be able to pay for it and people are going to lose their coverage. So I guess my question to you is, in the construct of this bill, if we want to find agreement, we really do need to set this aside. And we really do need to say, okay, the fundamental structure is something we can agree on, but there are certainly plenty of areas of agreement. And because I don't think that you can answer the question in the positive to say that people will be able to maintain their coverage, people will be able to see the doctors they want in the kind of bill that you're proposing.
Well, let me, since you asked me a question, let me respond. The 8 to 9 million people that you refer to that might have to change their coverage, keep in mind out of the 300 million Americans that we're talking about, would be folks who the CBO, the Congressional Budget Office, estimates would find the deal in the exchange better, would be a better deal. So yes, they would change coverage because they've got more choice and competition. So let's just be clear about that, point number one. Point number two. When we do props like this, you stack it up and you repeat 2,400 pages, et cetera, the truth of the matter is that healthcare is very complicated. And we can try to pretend that it's not, but it is. Every single item that we've talked about on the Republican side, if we wanted to exhaustively deal with fraud and abuse, would generate a bunch of pages. So I point that out just because, these are the kind of political things we do that prevent us from actually having a conversation. Now, let me respond to your question. We could set up a system where food was probably cheaper than it is right now if we just eliminated meat inspectors. And we eliminated any regulations in terms of how food's distributed and how it's stored. I'll bet in terms of drug prices, we would definitely reduce prescription drug prices if we didn't have a drug administration that makes sure that we test the drugs so that they don't kill us. But we don't do that. We make some decisions to protect consumers in every aspect of our lives. And we have bipartisan support for doing it, because what we don't want is a situation in which suddenly people think they're getting one thing and they're getting something else. They're harmed by a product. What Secretary Sebelius just referred to, which is not a Washington thing. In fact, state insurance standards in many states are higher than anything that's done in Washington, is as a consequence of seeing consistent abuses by the insurance companies and people finding themselves helpless to deal with them. Now, we can have a philosophical disagreement about how much insurance regulation is appropriate. What you've indicated to me, just based on the bills that I've seen, is you guys believe in some regulations. You already said you did. You believe in making sure that you can't just drop somebody with coverage. Now, if you don't have a law there, let me tell you, that happens all the time. I've got a bunch of stories in here of folks who thought they had insurance, got sick, the insurance company goes back and figures out a way to drop them. I'm not making this up. I'm not trying to just add to the pages of that bill. It's in response to an actual problem, and you guys have agreed to it. So, philosophically at least, on a whole range of issues, you agree that we should have some insurance regulation. My suggestion had been that we try to focus on what are the specific regulations, since we agree that there have to be some. What are the specific ones that you object to? Now, let me just close by saying this. Pre-existing conditions is one that theoretically we all say we agree on. Theoretically, everybody thinks it's a bad deal if my wife's had breast cancer, I lose my job, I now try to buy insurance, and they say, well, you know what, we can't cover you because your wife has a history of cancer. We all think that's a bad deal. There are two ways of dealing with that. One is what Kathleen raised, which is a high-risk pool. You could say, you know what, you can go in there and buy it in a big high-risk pool. And by the way, you could probably set up a high-risk pool without having as many pages in the bill. And it's an option that's been around for 30 years. Here's the problem. What happens is the reason that all our rates as members of Congress or as elected officials are pretty low is we've got such a big pool. There are millions of federal workers. And as a consequence, any single one of us have cancer, any single one of us have a child with a disability, our costs are spread out over millions of people, and so all of us are able to keep our rates relatively low. Even though if any individual in that situation was trying to buy insurance, it would skyrocket. That's the concept of pooling, is you get the healthy people and the young people alongside the not so healthy and the older people. But we're all kind of spreading our risk because each of us don't know at any given time what might happen. Maybe our kid's the one who gets diagnosed, heaven forbid, for something. And as a consequence, we insure ourselves by making sure that we're also insuring somebody else. When you get into something like a high-risk pool, what happens is all the sicker, older people are in that pool. All the younger people, they end up getting really cheap rates, and overall, you could say, well, that's how the market works. It's a good thing. There's more choice. There's more choice for the young, healthy person, but not for the person who, heaven forbid, got sick. Now, on pre-existing conditions, we've got a similar situation. The challenge we have, I'd love to just pass a law that said, insurance companies, you can't exclude people based on pre-existing conditions. The problem is, what they'll say to you is, well, you know what prevents somebody from not buying insurance until they get sick, and then going in and just buying it and gaming the system? So we've tried to respond to a difficult problem by saying, well, let's make sure everybody has some coverage. Without that, it's hard to do. So I just wanted to respond to, yes, we've got a philosophical objection, but let's not pretend that any form of regulation of the insurance market is somehow some onerous burden that's going to result in terrible things happening to consumers. That's a good thing.
Mr. President, if I could respond.
Please.
We again have a very difficult bridge to gap here because I know that this is something that we don't want to look at, but these are, as you say, the complexities of what this is about. But when you start to mandate that everyone in this country have insurance, and you lay on top of that now the mandates that we all would like to see in a perfect world, there are consequences to that. We just can't afford this. I mean, that's the ultimate problem here, is in a perfect world, everyone would have everything they want. This government can't afford it. Businesses can't afford it. That's why we continue to say, go step by step, try and address the cost, and we could ultimately get there. But we're asking that you set aside this mandated form of insurance this mandated form of health care regulation, and let's go back to things we can agree on without this trillion-dollar attempt here. That's all.
I think the cost issue is legitimate, and whether we can afford it or not, we'll be discussing that. And I think that's an entirely legitimate discussion.
Mr. President, can I have 10 seconds? Literally 10 seconds. We don't have a philosophic disagreement. If you agree that you can't be dropped, there has to be dependent coverage, if there's no annual lifetime cap, then in fact you've acknowledged that it is the government's role. The question is how far to go. So this idea we have a fundamental philosophic difference, you're either in or you're out. You say the government can't do it, none of it, or they can do some of it, we argue how much.
The cost issue is legitimate. We're going to address that.
Mr. President, if I could, it's the cost issue, but it's being driven by the fact that you've got in the bill, which I assume that your proposal supports, that the Secretary define what a health benefit package should be.
Only in the exchange. Only as part of the pool that people who don't have health insurance would buy into. If you were working at a big company that already has a big pool, then but you know what, I want to make sure, because Eric, we're going to end up in a back and forth that cuts everybody else out. I've got on the Democratic side a couple of people that want to speak, and there are probably a couple of Republicans. We're already over time. I've burned some of it. I apologize. I'm going to go to Luis. Then
to Mike Enzi.
Mike Enzi. I'll go to Tom Harkin, and then go back to Dave. So I've got 5 speakers, and I don't have a lot of time. Go ahead.
Thank you, Mr. President, and thanks to all my colleagues for being here. I am pretty succinct and pretty timely. I will not take up a lot of time, but I sure do have to say some things. The first one is the pre-existing conditions absolutely has to go. It is cruel, it is capricious, and it is done only to enhance the bottom line. This was not even anything we talked about 10 or 15 years ago, but it was mentioned that all Americans should be treated the same. Let me give you a little history on that. 8 states in this country right now have declared that domestic violence is a pre-existing condition on the grounds, I assume, that if you've been unlucky enough to get yourself beaten up once, you might go around and do it again. 48% is the higher cost for women, in many cases, to buy their own insurance. Believe you me, that is really discriminatory. In 1991, women were not included in any of the trials at the NIH because we had hormones. It wasn't until we had a critical mass of women here that said this will not do for more than half the population of the United States who pay taxes, that we made certain that diseases like osteoporosis, mainly a woman's disease, cervical cancer, only a woman's disease, uterine cancer, and others were really looked at. Up to that point, 1991, all research at the Institutes of Health was done on white males. Now, think about that for a minute, if you will. We couldn't do that because we said, kindly, would you stop doing that? It took legislation. Doing this will take legislation. I've been through this before. I was here when we had the Clinton debate. It was started, some of you will remember, by Lee Iacocca, who said we cannot export our automobiles. There is a $1,000 cost for health care in every one of them. My competitors are way ahead of me. They are eating my lunch. That was one of the main reasons, Mr. President, if you recall, that we decided we had to do something about that. In the 13, 15 years since that's happened, we have done nothing about health care. We don't export so much anymore. The automobile business is basically gone. We have done nothing to encourage entrepreneurs. The speaker spoke of this morning. We need to think more about the economic benefits of doing this. Those of us who are trying to redo some trade policies and maybe let us make something else again in the United States really want to make sure that it succeeds, and this would be a great part of that. I think it's terribly important that we do that. Also, since the Clinton health care plan, we've seen some pretty awful things. We saw hospitals abandoned to the streets, critically ill, elderly, mentally ill persons, and there was no great hue and cry out there. And now I understand there is actually a proposal, which God knows I hope never sees the light of day, that shut down Medicare and turned that into a voucher system, and where obviously we would not pay the full cost of health care, as these poor people have to go to the public market and try to find some. So what are we going to be doing then? We're going to be, once again, abandoning our elderly, abandoning our mentally ill, and our seriously ill to the streets. We're better people than that. I think it would be really a good thing for us today while we're here in this room together to really think about what's absolutely important here. Not nitpick over little pieces of this and that, but think about all the people out there every single day. The number of people with excess deaths because they have no health insurance. I even had one constituent, you will not believe this, and I know you won't, but it's true. Her sister died. This poor woman had no dentures. She wore her dead sister's teeth, which of course were uncomfortable and did not fit. Do you ever believe that in America that that's where we would be? This is the last chance as far as I'm concerned, particularly on the export business. We have fallen behind. We're no longer the biggest manufacturer in the world. We've lost our technological edge. We have an opportunity to do that, but a major part of the success of that is getting this health care bill passed. Thank you very much.
Louise, thank you. I was just informed. And by the way, this has been a terrific conversation so far. The House had to schedule a vote on an item, and my understanding is it has already started. So what I'd like to do is this. We've got 4 remaining speakers, Mike, Enzi, Dave Camp, I guess, again, and as well as Tom Harkin, 4 remaining speakers, and Jay Rockefeller. What I'd like to do is to break so that the House can take the vote. When we come back, we will start with Mike, and we will return to finish up the issue of insurance reform, and then we will move on to the questions of coverage. All right?
Mr. President, can I
so we are scheduled to be back here at 1:45.
I just want to inform the House members, Mr. President, there's only one vote. The vote is on. Obviously, they'll hold it until we get there, but we need to vote and then come right back.
All right. Thank you, everybody.
Buses outside.
How you doing, Eric, Vice President? Good. All right. It's easy being Vice President. You don't do anything. It's like being a grandfather. Yeah, that's it.
All right, everybody, let's get started. Okay. All right. There were several people who were still in the queue who didn't have a chance to speak prior to us breaking. The topic was still insurance reform, although obviously these things interrelate, and I suspect that people may, have some other issues that they want to raise. After this, we're going to go to the issue of deficit, and which touches on some of the issues related to Medicare that have been raised already. And I'm going to actually have Joe Biden open that up.
Mr. President, before you leave, health reform, could I get on the list? I didn't know. I thought the whole thing was going to deal with health reform.
Well, no. I mean, we will be talking about health reform, Charlie. I guarantee you will be called on before. You'll have a chance to talk about all these issues. All right.
Mr. President, what time do you expect to end the meeting?
My hope is that we get out of here. We're running a little bit late, but for having a lot of elected officials sitting around a table, we're not too late. My hope is that we can adjourn by 4:15. All right? Okay. 4:15. Originally it was scheduled to go to 4. We're starting a little bit late on this front. So we'll see if we can get out here by 4:15. All right? That will require probably a little more discipline on all our parts, including myself, than was shown in the morning session. Although, let me just say that I thought the tone of the discussion was helpful, and I appreciate everybody's participation so far. With that, I'm going to go to Mike Enzi. I'm going to go to...
As long as you're talking about leaving, Mr. President, please put me on the list.
Well, I guarantee you guys are all going to have a chance to speak. But we're going to go to Mike Enzi, and then we're going to go to Tom Harkin. I know that we had Jay Rockefeller was still on the list. Was there another Republican that wanted to speak just on the insurance reform issues, or you want to go to John Barrazo? All right. We'll let you guys split time on this one. All right, Mike.
Thank you, Mr. President. Colleagues, when we're talking about insurance reform, we haven't really talked about, but Representative Slaughter kind of opened the door on it, and that's Medicare. Seniors out there are really nervous. Seniors are the ones objecting the most to the program, and it's because they see $500 billion coming out of their program. If Medicare were separate and any savings that we did in Medicare reform went back into Medicare, it would do a lot to relieve the tension that's out there. It'd even be a way to pay for the doc fix. So I'm hoping that that can be a piece of what we're doing. I really appreciate this exchange. It would have been helpful had we had this 9 months or a year earlier and had it in even more detail and for more days. What we were presented with in the Help Committee, of course, was a bill that was already half drafted. And we started the markup on it, and then we got the other half later. And since we had not had any input to the drafting, we're credited with 150 amendments. Well, 17 of those amendments were Senator Murkowski, where she was inserting Native Americans and tribal in 17 different places. I had 11 of them where we put in a thing that required agencies to cooperate. So the ideas that we had, when Senator Kennedy and I were working bills, we'd set down some principles and then put some detail in and then draft the bills together. And I hope that that's something that we go to on future bills. It works. In a 3-year period, he and I got 38 bills signed by the President. In the last year, I've gotten 2 that I've gotten pens from this President. And the way that we've done those has been through that kind of a process. And unless we go through that kind of a process, I don't think we're going to. I don't think we can get to the bipartisan thing. And that's what the purpose of this meeting is to kind of get all these ideas together and see how they gel. In insurance reform, small business health plans, that's different than the AHPs, which is what they were talking about, and it covers some of the problems that were talked about. One of the problems is mandates, and Olympia Snow contributed to that part. She had a provision that if 26 of the states adopted a mandate, it would be a mandate nationwide. And as other mandates became 26, they'd be included with it too. We talked about health savings accounts. I don't think that meets some of the federal minimum standards that the federal government might put on it. And that's going to disappoint some of our employees, because that is one of the options that federal employees have, is health savings accounts. And it's particularly good for the younger, healthier people. They can get that. They've got catastrophic coverage. If they put the amount of money that they would have spent on a Blue Cross plan or some other plan, the difference between the two, into a savings account, in 3 years they've covered the huge deductible. And they can continue to do that tax-free. So it's a process that would be really objected to if it's excluded or changed. I like the exchanges, and the reason I like the exchanges is it's kind of a form of bidding. It's more transparency. People can see what they're buying, and that would be a big help. When we were in the shoe business, my wife used to, after 10 years, she decided she'd bid out our insurance. We didn't know there was that much flexibility in insurance. She saved a bunch. And then, of course, she didn't, since we were selling shoes, it's kind of a fixed price, so she didn't really take the low bid and then go back to somebody else and say, can you make this a little lower? But that insurance company we'd been with for 10 years came to us and said, we could have done a better deal. She said, you should have when I was buying the insurance. And we got much better bids the next year. So these exchanges can be good. But what I would hope you would consider is having the exchanges to list anybody's insurance that wants to put it on there, and then mark the ones that meet the federal minimum standards, so that people can decide really what's out there in the market. And I think it would pull up some of the ones that are lower down up into the category, and at the same time everybody could see what all's on the market out there, and hopefully regardless of states. Thank you, Mr. President.
Thank you very much, Mike, and thanks for staying succinct. Thank you very much. And I thought you shared some important ideas there. Tom Harkin.
Mr. President, thank you again for bringing us together today. I think, if anything, what I've learned here so far is that, quite frankly, we may be closer together than people really think in actually getting agreement that we can move forward on. I hope that's the case. There's been a lot of figures thrown out here and a lot of process things, but I keep thinking we got to bring it back home to what this is all about. We all have our stories. I got a letter yesterday from a farmer in Iowa. It really encapsulates. I'm a 57-year-old Iowa farmer. I'm writing to voice my concern regarding my family's rapidly escalating health care costs. On Saturday, February 20th, I received a notice from well-marked Blue Cross Blue Shield of Iowa informing me that our health insurance premium will be increasing $193.90 per month to a monthly total of $1,516.20. This is a 14.6% increase and will result in a yearly cost of $18,194.40 for a family of 4. 10 years ago, our monthly health insurance premium was $373.50 per month for a similar policy, which had a lower deductible and covered 3 additional children. Health care costs are out of control, and as a self-employed individual, I feel powerless. At the current rate of increase, by the time I reach Medicare age, my premiums will cost $42,000 per year. As a farmer, I manage risk on a daily basis. Weather, weeds, insects, and fluctuating commodity prices. I have not yet found a way to control my exposure to health care expenses. Because of pre-existing conditions, I've been denied access to coverage under more economical insurance plans. Therefore, I'm stuck in an expensive pool and have few options. The best option would be for the U.S. Congress to pass comprehensive health care reform, resulting in affordable health care for all.
The health of my family and the future of my small business depends on it. Sincerely, Raymond Smith, Buffalo Center, Iowa. Mr. President, I hear talk about, well, we got to start over and do all this thing again. You know, we spent 1 year considering a range of ideas from experts from all over the political spectrum. 2 committees, the Health Committee under the able leadership of Senator Dodd, the Finance Committee under the leadership of Senator Baucus, held over 100 bipartisan meetings and walkthroughs to discuss this bill. Our bill contains over 147 distinct Republican amendments. Now, on the issue of health insurance reform, of the 10 key elements in the House bill, we have 9 of them in our bill. 9 out of 10, that's not bad. The only one that's missing is the health savings accounts. But 9 out of 10 are in our bill that are in the House Republicans' bill. Now, again, those, what are they? You know, again, pre-existing conditions, we covered that. No rescission when you get sick. No lifetime annual caps. No gender-based ratings. Keeping your kids on until they're age 26. That's in the House Republican bill. That's in our bill. So I think we're very close on this. Last 2 things I just want to address myself to is this idea that somehow we can do a little bit. We can take an incremental type of an approach. Somehow we can do insurance reforms, but we don't have to do anything else. Well, quite frankly, if we want insurance reforms, you can only do that if everybody's in the pool. You can only get everybody in the pool if you make it affordable for middle-class families and others. You can only make it affordable for middle-class families and others if you have cost controls. What I'm saying, Mr. President, and others, is this all hangs together. You can't pick one out and do it without doing it all together. It all hangs together. Cases in point. Some states in the 90s tried to do health insurance reform without doing anything else. And they found it to be a debacle because the insurance premiums skyrocketed. New Hampshire, Kentucky, and Washington were forced to repeal their reforms because of that. Case in point, Massachusetts in the 90s put in health insurance reforms on anything else. Individual market premiums doubled. 4 years ago, when they did their comprehensive reform and they put the package together, premiums dropped by 40% in Massachusetts. That's why you can't do this incremental approach. Every time I hear about, we're sinking, we're drowning in this country on health care. An incremental approach is like a swimmer who's 50 feet offshore drowning, and you throw him a 10-foot rope. And you say, well, it didn't reach him, but we'll get it back in. We'll throw him a 20-foot rope next time. Then we'll throw him a 30-foot and a 40. By that time, the swimmer's drowned. And that's what's going to happen to Ray Smith and so many other families in this country. They're going to drown by the time, if we do this kind of incremental type of an approach that I hear others talking about. Lastly, I'd like to put this in a different kind of a contextual framework. We don't allow segregation in our country on the basis of race, creed, color, national origin, etc. 20 years ago this year, we also said we're not going to allow segregation on the basis of disability when we passed the Americans with Disabilities Act. And yet, we still allow segregation in America today on the basis of your health. Why should we? Why should we allow that to happen? It's time to stop segregating people on the basis of their health. That's why insurance reform is so vital, because the health insurance industry in this country is based on a flaw. And the flaw is their ratings are based on segregating people because of their health. Think about that. Whenever I hear the word pool, this pool, that pool, this pool, I think segregation. You're segregating people out because of their health status. I think it's time to end that. I sold insurance. I was an insurance agent when I was a young man. And there's one principle of insurance I learned then that I've never forgotten. The more people in the pool, cheaper it is for everybody. You start setting up these pools, you're going to make it more expensive, and you're going to be segregating people on the basis of health.
Let's think about that. It's time to stop that kind of segregation in our country.
All right. Tom, Dave Kane.
Thank you very much. On the issue of insurance reform and pre-existing conditions, there are responsible ways to solve this problem and reduce the cost of health insurance for everyone. And we support state universal access programs that address high-risk pools and reinsurance that makes affordable coverage available to those who are sick and those who have a pre-existing condition. And I won't go through all of those things that Dr. Bustani and others here have talked about. But and our approaches are somewhat similar on this issue pre-2014 in the period where the House and Senate bills are ramping up. But there is a pretty big distinction, and that is that there's a key difference in the approaches. We prevent waiting lists during that period, and we have these programs managed by the state level, and they're robust enough that CBO has scored that they'll be effective. And what the House and Senate approaches are is that those rules are set in Washington. And the House and Senate bills are similar in that if you look at the Senate bill on page 48, 51, and 52, it's the unelected Secretary of Health and Human Services who has the authority to establish waiting periods for access to these programs, raise premiums, reduce benefits. And so it is we are similar in what we talk about. There's a very key different approach there. And then after 2014, when the bill fully comes into play, you have a very different approach there. And what you do is establish pre-existing condition and link it with the individual mandate. And the American people have told us they don't want to be forced to buy health insurance that they don't want and they can't afford. And this is a significant issue across the country. And the American people are telling us that the individual the mandates, the requirements to buy insurance are something that they want us to scrap and start over on. And that's why you're seeing state legislatures around the country passing resolutions saying our citizens are going to have a choice on whether they buy health care. They're going to have a choice on the kind of coverage they want to have. And so this is a fundamental difference in this area of insurance reform that I think we have to really begin again and really take into what the American people are saying and expressing this through their elected representatives in the state legislators. I know there's a lot of former state legislators here. I'm one as well, and I think that's a very serious point that we need to address.
I'll just touch on your last point, which is the whole issue of pre-existing conditions. Tom Harkin mentioned it, but I'll be very brief because I know that we've got to move on to the next topic. The way I understand Leader Boehner's bill works, and I think that's the one you're referring to, the way you deal with a pre-existing condition is to essentially set up a high-risk pool. I mean, that's the mechanism. So what you're saying is if you're sick or older or you got hip replacements or what have you, and you're having trouble buying insurance on the open market, you're going to be able to buy into a high-risk pool. Now, Tom made the point earlier that, and this is indisputable, I don't think anybody would disagree with this, that if you set up a high-risk pool in which you don't have healthy people, younger people in the same pool as older, sicker people, the premiums for the older, sicker people who've been segregated into this pool is just going to be higher. Now, we looked at the Boehner bill to see sort of how you approach that, and you've got some reinsurance, and keep in mind, we use a high-risk pool as well until we get to the exchange, and we have reinsurance, for example, for federal, or for people who are on retiree plans. We want to help employers maintain those plans, and they've got an older population, so we want to help reinsure them. But given the amount of money that you have allocated for that pool, it's just not going to be a very useful tool for the vast majority of people who've got pre-existing conditions, just because there's just not enough money that you guys put into it to be able to cover all the people with pre-existing conditions, which is why other states have high-risk pools Kathleen mentioned. I don't know how many states, but let's say 20, 21 states currently have high-risk pools. Out of all those 21 states, about 200,000 people use the high-risk pool. And the reason is because by just dealing with older, less healthy individuals separately, or people with pre-existing conditions, it is very, very expensive. Tom's point was, if everybody's in it, because presumably none of us know at any given moment who's going to end up being healthy and who's not. We don't know whether our kids are going to be suffering some sort of disease that we don't anticipate yet, or our spouses get ill, that if everybody's in it, then that drives prices down cheaper for everybody. So it's not that I think that the high-risk pool idea is a bad one. As I said, the House, the Senate bill, the proposal that I put forward, all use the high-risk pool as a stopgap measure to get to a broader pool, but the goal has to be to get everybody in a place where those risks are spread more broadly.
And if I just might say, we support high-risk pools and reinsurance with $25 billion in funding.
Right.
The House and Senate versions are $5 billion in funding, and because of that robust support, CBO says this will work. The fundamental difference after that is that the Health and Human Services Secretary, in that 4-year period when they're somewhat similar, has the authority to raise the premium. So all of that is brought to Washington. We leave that authority in the states so that they can manage their state pools. And then after the bill becomes effective in 2014, the real problem becomes the mandate and the cost, the forcing of the purchase of insurance, which many Americans find objectionable. And that you can avoid that mandate if you continue to design this as we do in the beginning.
Well,
and both plans are somewhat similar on that, but it's a very different structure.
What I'd like to do is to move on to the topic, which I think underlies...
Jay Rockefeller.
Oh, I'm sorry. We still got Jay. My apologies. Jay, please go ahead.
Thanks, Mr. President. We really haven't discussed, I think, what is at the basis of the frustration about this whole business of pre-existing conditions and lifetime limits, all the rest of it. And that is the way and the nature of the health insurance industry, for the most part. They are among all industries I've ever encountered, and in the Commerce Committee we have spent a year analyzing and bringing out some of their sins and ills. They're terrible. They're in it for the money. A nice lady who runs WellPoint said, "We will not sacrifice profitability for membership. Money first, people second." We had a fellow named Wendell Potter who worked for Cigna for 20 years as a high executive. He came before us on his own, volunteered, and described the way health insurance companies operate. They are looking for reasons to kick you out. They are looking for reasons, if you already have the health insurance, for doing the rescissions. Yes, we're going to ban those, but not unless we pass a bill. And in fact, often employees are incentivized financially to find reasons to kick people off of the insurance which they're paying for. So you can be paying your premiums, and then they discover they come up with something they found in your background they don't like, and they just kick you off. They can do that now legally. And so people say, well, you know, maybe the states ought to do this, they can do it better. Well, that's the situation we have now, but 44 of the 50 states make it perfectly legal for health insurance companies to do this pre-existing condition, to simply deny coverage for something which people just got sick, as babies or as adults or whatever. I got a letter from the CEO of Cigna written to me, and he said, "I want to apologize because we had said that we'd spent $5 billion on the small group insurance market. Well, I checked a little bit more. In fact, we hadn't. Now, why don't people know that? Because the health insurance industry is the shark that swims just below the water. And you don't see that shark until you feel the teeth of that shark. Now, unless I be accused of trying to over-dramatize my statement, this is the way they operate. Nobody has particular oversight of them. They're not under any antitrust type rules. They can do what they want. They so dominate the market, as the Secretary pointed out, that there really isn't any real competition. They can do what they want, and they do. And it's money. It's money. And it makes me sick. It shouldn't happen in America. People say, well, government run. You're going to do this or put that restriction on them. If you don't put the restriction on them, they're going to go on doing this. And so, you know, the public option was, I like that a lot, but that's not going to probably be possible. So you have to go at them to clip their wings in every way that you can. And that's why, and with his general agreement on pre-existing conditions and rescissions and lifetime annual limits, I mean, you know, it's not a lot of fun to see an 8-year-old kid, which I have done, and I knew this kid, Samuel Board, and he had leukemia, and he had life, you know, annual limits, and he ran out, and then he died because there was no insurance. Could they have cured his cancer? I don't know, but that's what insurance is for. So this is a rapacious industry that does what it wants, unknown in their behavior to the people of America, except on an individual basis, and individuals can't shake up us the way they're now doing it, I think. So when you talk about the individual mandate, that's not in there for some government makes that decision purpose. It's there because you got to have a big pool. Everybody's made that point. I got a son who's old enough to have health insurance. He doesn't have it. And when my wife and I found out about it, we told him to get it the next day. He didn't think he needed to have it. He would live forever. Well, of course, that's the premise among young people. That's why we have the requirement that people sign up for health insurance. And they don't know if they're going to need it. And he doesn't know that he's going to need it. So you make everybody participate, and then you have a bigger risk pool. You can do a better job. I want to say one word about medical loss ratio, because it's sort of a crazy name, but it's a really good concept. What we say is that the health insurance industry says that they spend 87% of all of their revenues from premiums or any investment that they might have on health care. That doesn't work out quite that way. For large businesses, they do a much better job. But for small businesses and the individual market, they're down in West Virginia in the high 60s and the low 70s. So how do you stop that? You can't stop that by asking them to. You stop that by having a law, which is a good law, saying that you have to spend between 80 and 85% of everything you take in revenue on medical care for your patients. And if you don't, we will know about it because we'll be tracking it, and then you have to rebate that difference to the people. So there's a reason for doing that. It's good public policy. It can't just happen on a voluntary basis. I mean, but it's a way to make sure you get your objective. Let me just close on one other issue. The rate review, and I wish we could talk about the Medicare board, advisory Medicare board, which is controversial, but which is
well, we will have a chance to talk about it next. So,
well,
Jay, let's wrap it up because I want to make sure.
I'm going to wrap it up. The insurance rate review is important, and if Kathleen Sebelius is to be called an unelected person and she's head of the group that does all of Medicaid and Medicare and Health and Human Services, and she's been an insurance commissioner, she's been a governor, she knows the whole thing. I don't call her down because she's not elected, but was appointed by you, and it was a brilliant choice. People say decisions can't all come from Washington. Sometimes decisions have to come from Washington, because what we're about here is not trying to run by government. We're trying to protect consumers. And if you're going to protect consumers, you've got to have a way that they really do get protection, and that they know it, and that they feel it in their lives. So this insurance reform is important. It's a profoundly emotional subject out there, and we got to do something about it.
Mr. President, Ms. Blackburn was on the list, I thought, before we left.
Okay, go ahead.
Thank you, Mr. President. And yes, one of the points that we did want to cover today was the across-state line purchasing of insurance. You've alluded to that a couple of times and mentioned that you felt like we were close on that issue. I think that there are some very important structural differences in the way we approach this, just as I think that there are very deep philosophical differences in how we approach health care reform. Now, a lot of the people that I talk to want us to start over in this issue, and they want us to give them the ability to hold insurance companies accountable. One of those ways is through very robust competition. And when you have a district like mine in Tennessee, where the bulk of our constituents are within 15 miles of a state line, the ability for those individuals who have families and live and work and have employees on the other side of the state line who shop for major purchases every day is to allow them to be able to make those purchases. Also, when you talk about holding insurance companies accountable, if you want to empower patients in front of those insurance companies, take the power away from them, then give them the ability to buy a policy that suits their needs. They are really tired of paying for coverage they don't want. If you want to prevent premium acceleration, such as the issue in California right now, where the premiums have gone up 39%. If you are siding with protecting those insurance companies and not allowing across state line competition, then what you're doing is denying Californians the ability to go to Oregon, where they could buy a policy for 25% less, or individuals in New Jersey who could go to Pennsylvania and buy a policy and lower their cost 26%, or go to Wisconsin and buy one and lower their cost 74%. Now, some of the very differences in our bill, we have a way to do this without putting a federal bureaucracy in charge of it. States can already do compacts, but the Senate bill legislation would require state action and then federal approval for those compacts to take place. There's another important point here. The bill that you all are proposing would not put these in place until 2016. And quite frankly, I think a lot of the American people agree with us that care delayed and access delayed as care and access denied. And they would like to see those, basically what you have, state lines right now basically have stop signs up. When it comes to across state line access, they would like to see that come down and like to see those access portals opened up so that they can first lower their cost, secondly, so that they have greater ability to hold insurance companies accountable, and then also state legislators, even some of our governors, many of the governors favor approaching this model and allowing our constituents a way to access this, get the cost down, and I will be brief so that we can move on to other topics. Thank you.
Well, I appreciate that very much, Marcia. Just to close, because there have been two issues that were raised. One, the purchasing insurance across state lines, and the other was the issue of the mandate, and I just want to address those very briefly, and then I'm going to turn it over to Joe. I support the idea of purchasing insurance across state lines. And you're right that the way we structure it is to have compacts between states so that you start getting a regional market. But I think there are two things that are important to understand. Number one, with respect to California, for example, the problem, as was presented yesterday in California, was not that there were a whole bunch of insurance companies from other states who were clamoring in to get into California to sell insurance to those individuals who saw their premiums spike by 39%. There weren't. The problem has to do with the fact, according to them, that people who have lost their jobs now, who are healthy and can't afford the individual market, have basically just decided, I'm going to go without insurance. I'll see, I got to take my chances because I just can't afford it. What that's left is people who, because of pre-existing conditions, because of special health care needs, because of age, they have to keep their insurance. And so the pool has become older and sicker. Now, the way to get at that problem is actually what we've discussed earlier, which is to broaden the pool. Make sure everybody's in the pool. And that's what the exchanges do. I actually think that on the purchasing insurance across state lines, there may be a way of resolving the philosophical difference. Not entirely, but there's a potential way of bridging this gap, and that is to say that once there was a national exchange with some minimum standards, then potentially you could just have a national marketplace and anybody could be able to sell into the exchange. This is something that Mike Enzi just mentioned. I actually think that could be workable once the exchange was stood up. So there may be a way of bridging this difference. Yeah. Now, on the mandate, though, because the mandate issue is connected, and so I'm just going to mention this real quickly and then we'll move on. When I ran in the Democratic primary, I was opposed to the mandate.
Bless you.
Well, because my theory was, you know what, people, the reason they don't have health insurance isn't because somebody's not telling them to get it, but because they just can't afford it. And that if we lowered costs enough, then everybody would be able to get it. So I was dragged kicking and screaming to the conclusion that I arrived at, which is that it makes sense for us to have everybody purchase insurance. And I have to say, this is not a Democratic idea. I mean, there are a number of Republicans sitting around this table who have previously supported the idea of an individual mandate, responsibility. The reason I came to this conclusion is twofold. One is cost shifting, which is a fancy term for saying everybody here who has health insurance is one way or another paying for those who don't. Every time somebody goes into the emergency room, if Jay's son got hit by a bus and his dad wasn't Jay Rockefeller, and he ends up in the emergency room, we'd give him emergency treatment, and we'd all pick up the tab. And the calculation, not our calculation, but independent economists, is that each family with health insurance right now is picking up $1,000 to $1,100 worth of costs for people who don't have health insurance. So when Tom Coburn earlier said, you know, if a kid comes to the emergency room, they're going to get treated. Yeah, they will get treated. Who's paying for it? Well, we're paying for it. Every American family who's got health insurance is paying for it. Every employer who is covering their employees is paying for it. So we're already putting the money in. It's just in a very inefficient way. And so the notion that somehow if we don't ask people to carry their responsibilities, that we're saving money. No, we're not saving money. It's just we don't see it. It's called uncompensated care, and we all get charged an extra $1,000. So that's part of the reason. The second reason has to do with the issue of pre-existing conditions in the pool that we've already discussed. But I just wanted to address those two issues. Marcia, you had one thing that
Yes.
you wanted to respond to?
Yes, Mr. President, I did very quickly. I would just suggest that we're looking at this from, in your example, we're looking at it the wrong way. You're talking about letting companies into California. I'm talking about letting individuals out.
No, it's the same idea, Marcia. It doesn't matter whether the companies are going in or people going out. I promise you.
Free it up.
No.
Free it up.
I promise you that the problem that's going on in California is going on in every state. It's not unique to California. It's not as if there are insurance companies that are given great deals in Iowa. That gentleman farmer who just talked about it, these are some structural problems that exist in every state. It is what is true.
Yes, let him
No, I want to say this. Hold on a second, guys. What is absolutely true is that some states probably have higher mandates than others, and so you can probably attribute a certain amount of the cost in a a state that has more requirements for bare minimum coverage, doesn't allow, drive-by deliveries or requires mammograms or what have you. Those things all may add some incremental cost, but the truth of the matter is that that's not the reason that you're seeing such problems. In a lot of states, the problem is just you don't have competition at all. We want competition. We just want some minimum standards. All right, Joe, let's talk about cost because, and now we're not talking about cost of families, but we're talking about deficit, how much respective ideas cost. I think this is a good place to talk about Medicare as well because it's been brought up several times. Joe, go ahead.
Mr. President, I'll try to be brief. There's a lot to talk about. I'd like to focus it, though, on the deficit, impact on the deficit, which we're all talking about. And I must tell you, maybe I've been around too long, but I'm always reluctant after being here 37 years to tell people what the American people think. I think it requires a little bit of humility to be able to know what the American people think. And I don't. I can't swear I do. I know what I think. I think I know what they think, but I'm not sure what they think. The second point I'd make is, this probably has an echo, and this is slightly off point, but this debate about the philosophic difference has an echo of the debate that probably took place in the mid-30s on Social Security. It was mandated. And it was mandated because everybody knew you couldn't get insurance unless everybody was in the pool. And they knew if only some people were in the pool, what would happen is a lot of people, when they got old, we'd take care of them anyway, and you'd have to pay for them. So it's kind of it's not the same thing. I'm not making it exact, but it's the same philosophic debate that took place back in the 30s. But look, I think if I can lay out, Mr. President, what I think we all agree on, and then figure out whether there's a way to deal with the deficit end of this, bending the cost curve, to use the phrase you and many others have used, Mr. President. First of all, everybody agrees we have the finest docs and the finest hospitals and the finest nurses in the world. And we don't have quite enough of them, but we have the finest. Everybody also agrees, I got from this morning, but I think we had before, that Senator Coburn is right, that we waste a heck of a lot of money, and that somewhere around a third of all the dollars we spend on Medicare goes for nothing useful. The third thing it seems I assume we can all agree on is that over the last decade, costs have doubled for health care in America. Costs have doubled for government-provided health care, but everybody's health care. And that meant that right now, everybody knows that wrecks budgets. It wrecks state budgets, it wrecks family budgets, it wrecks federal budgets. Every 35 cents of every dollar spent on health care is spent by the federal government or the state governments for Medicare and Medicaid. 35 cents on the dollar. That doesn't count veterans and other things, just those two. And so, and what's happened is, on the dollar, on every health care dollar. And so we're facing, all of us around this table, Democrat and Republicans are facing the fact that there's $919 billion now we're spending on Medicare and the federal portion of Medicaid. And that if things, I don't see any firewall is going to keep costs from doubling again. We're going to be talking about in the year, 2019, we're going to be spending $1.7 trillion, $700 billion. If we don't do something to bend that curve. So and the fourth point I think we can agree on is that whether you agree how it is arrived at, CBO's gone out and scored the various plans as to whether or not they bend the cost curve. And everybody's acting in good faith. John's plan, they've gone out and points out over 20 years it will, and I don't know if that's a Republican plan or John, I don't think there's any one plan that is out there, but John's plan cuts those costs by $300 billion over 20 years, according to CBO. The Senate plan cuts it by over $1 trillion over 20 years, $100 billion over 10. Again, we can argue on the margins, but the fact is, it's not just CBO that said this. You had the Business Roundtable you had studied that shows that the Senate plan slows growth by 15 to 20%, and that business costs per employee by the year 2019 to be $3,000 less per employee. Again, it may be wrong. It may be wrong the exact amount. It may be $3,800, it may be $2,200, but it cuts cost. And so it seems to me that there is, and I might add that in the process here, it wasn't part of the, specifically part of the long-term debt debate, but, you know, as has been pointed out here, we're not cutting Medicare benefits in this. We're trying to eliminate the third of the problem that's a waste. And as Senator Enzi, who I have an inordinate amount of respect for, points out, he said it'd be nice if we put some of these savings back into Medicare. Well, the fact is we do. We close the prescription drug donut hole. We provide for preventative care for seniors, which they don't have now without a copay. And we also, it's everyone, I think most every major study agrees that it's going to extend the life of Medicare trust fund, and it changes these changes, the actuarial group pointed out, would save about $200 on a premium per Medicare recipient out there. The people are paying. So look, and the source of how we do this is getting rid of waste, making sure that we don't overpay insurance companies for Medicare Advantage. I want to remind everybody about Medicare Advantage, because some of us around here, probably all of us around this table, were here when it got put in. What was the rationale for Medicare Advantage? The rationale for Medicare Advantage a decade ago was that private insurers could provide insurance, better insurance, cheaper than the government can do it. They can do it better. And we said the reason why we're going to pay them more than what they're going to give at the front end is to incentivize them to get in the business of doing it. And so we paid them $1.15 for every dollar's worth what we could have bought for $1. We did that, and it was a rational thing to try. We did that because we wanted them to get engaged in the business we thought government didn't do as well as the private sector did. Well, here we are. We're overpaying insurance companies about 15 cents on the buck that we could buy for $1, and we call for eliminating that. And so the other point I'd make, Mr. President, is that that we're in a situation here where at the end of the day, nobody in this room, I don't think anybody in this room is going to say, you know something, we are really going to be reforming the health care system without affecting the effect on the long-term deficit. Unless we bend that cost curve, we're in trouble. And Mr. President, we can argue, which we will, about whether or not the way you and I want to go after dealing with a long-term debt, whether commissions make sense, whether or not we're ever going to deal with entitlement. This is a big entitlement. It's a big entitlement. Medicare. It exists. We got to figure out how to keep it from bankrupting the country without denying seniors what they're entitled to in a nation like ours, decent health care that provides for their needs. So I'd like us, Mr. President, I'm going to hush, I'd like us to talk about, if we can, specifically, what we all agree on. What do we do about bending the cost curve? What's the best way to do it? And I yield the floor.
Mr. President.
Say as a senator.
Mr. President, Mr. Ryan's going to open this conversation on behalf of us.
Thank you. Look, we agree on the problem here, and the problem is health inflation is driving us off of a fiscal cliff. Mr. President, you've said health care reform is budget reform. You're right. We agree with that. Medicare right now has a $38 trillion unfunded liability. That's $38 trillion in empty promises to my parents' generation, our kids' generation. Medicaid's growing at 21% this year. It's suffocating states' budgets. It's adding trillions in obligations that we have no means to pay for it. Now, you're right to frame the debate on cost and health inflation. And in September, when you spoke to us in the well of the House, you basically said, and I totally agree with this, I will not sign a plan that adds one dime to our deficits, either now or in the future. Since the Congressional Budget Office can't score your bill because it doesn't have sufficient detail, but it tracks very similar to the Senate bill, I want to unpack the Senate score a little bit. And if you take a look at the CBO analysis from your chief actuary, I think it's very revealing. This bill does not control costs. This bill does not reduce deficits. Instead, this bill adds a new health care entitlement at a time when we have no idea how to pay for the entitlements we already have. Now, let me go through why I say that. The majority leader said the bill scores as reducing the deficit $131 billion over the next 10 years. First, a little bit about CBO. I work with them every single day. Very good people, great professionals. They do their jobs well, but their job is to score what is placed in front of them. And what has been placed in front of them is a bill that is full of gimmicks and smoke and mirrors. Now, what do I mean when I say that? Well, first off, the bill has 10 years of tax increases, about $500 billion, with 10 years of Medicare cuts, about $500 billion, to pay for 6 years of spending. Now, what's the true 10-year cost of this bill? In 10 years, that's $2.3 trillion. It does a couple of other things. It takes $52 billion in higher Social Security tax revenues and counts them as offsets, but that's really reserved for Social Security. So either we're double counting them or we don't intend on paying those Social Security benefits. It takes $72 billion and claims money from the Class Act. That's the long-term care insurance program. It takes the money from premiums that are designed for that benefit and instead counts them as offsets. The Senate Budget Committee chairman said that this is a Ponzi scheme that would make Bernie Madoff proud. Now, when you take a look at the Medicare cuts, what this bill essentially does, it treats Medicare like a piggy bank. It raids $500 billion out of Medicare, not to shore up Medicare solvency, but to spend on this new government program. Now, when you take a look at what this does is, according to the chief actuary of Medicare, he's saying as much as 20% of Medicare's providers will either go out of business or will have to stop seeing Medicare beneficiaries. Millions of seniors who have chosen Medicare Advantage will lose the coverage that they now enjoy. You can't say that you're using this money to either extend Medicare solvency and also offset the cost of this new program. That's double counting. And so when you take a look at all of this, when you strip out the double counting and what I would call these gimmicks, the full 10-year cost of this bill has a $460 billion deficit. The second 10-year cost of this bill has a $1.4 trillion deficit. And I think probably the most cynical gimmick in this bill is something that we all probably agree on. We don't think we should cut doctors 21% next year. We've stopped those cuts from occurring every year for the last 7 years. We all call this here in Washington the doc fix. Well, the doc fix, according to your numbers, cost $371 billion. It was in the first iteration of all these bills. But because it was a big price tag and it made the score look bad, made it look like a deficit, that provision was taken out, and it's been going on as standalone legislation. But ignoring these costs does not remove them from the backs of taxpayers. Hiding spending does not reduce spending. And so when you take a look at all of this, it just doesn't add up. And so I'll finish with the cost curve. Are we bending the cost curve down or are we bending the cost curve up? Well, if you look at your own chief actuary at Medicare, we're bending it up. He's claiming that we're going up $222 billion, adding more to the unsustainable fiscal situation we have. And so when you take a look at this, it's really deeper than the deficits or the budget gimmicks or the actuarial analysis. There really is a difference between us. And we've been talking about how much we agree on different issues, but there really is a difference between us. And it's basically this. We don't think the government should be in control of all of this. We want people to be in control. And that, at the end of the day, is the big difference. Now, we've offered lots of ideas all last year, all this year, because we agree that status quo is unsustainable. It's got to get fixed. It's bankrupting families. It's bankrupting our government. It's hurting families with pre-existing conditions. We all want to fix this, but we don't think that this is the answer to the solution, and all of the analysis we get proves that point. Now, I'll just simply say this, and I respectfully disagree with the Vice President about what the American people are or are not saying, or whether we're qualified to speak on their behalf. So we are all representatives of the American people. We all do town hall meetings. We all talk to our constituents. And I've got to tell you, the American people are engaged. And if you think they want a government takeover of health care, I would respectfully submit you're not listening to them. So what we simply want to do is start over, work on a clean shaded paper, move through these issues step by step, and fix them and bring down health care costs and not raise them. And that's basically the point.
I'm going to call on Javier Becerra, but I just want to follow up on a couple points. There's some strong disagreements on the numbers here, Paul, and but I don't want to get too bogged down. And first question I have is whether your side thinks Medicare Advantage is working well, because I think it's important just to point out that when we keep on talking about cuts in Medicare, what we're really talking about is what Joe alluded to, which is a decision was made a while back to set up a system in which Medicare costs, let's say, $1 under the government program that 80% of people still use and are perfectly satisfied with, and there's no showing that it's not working for them. We said we'd give it to private insurers, and we'd give them a bonus of $1.15 for every dollar in the normal plan. And it turns out that people aren't healthier because of that extra $15 or 15 cents. It's estimated that it's costing us about $180 billion over 10 years, let's say $18 billion a year. And essentially what my proposal would do and what the House and Senate proposals would do would say, instead of having the insurance companies get that money, let's take that money. The savings are between $400 and $500 billion a year. And let's devote some of that money to closing the donut hole, which has already been talked about. Seniors who need more prescription drugs than Medicare currently is willing to pay for hit this gap where suddenly they've got to use it out of pocket and they just stop taking the drugs, or they break them in half or what have you. Let's fill that. That costs around $30 billion a year, or $300 billion. And let's make some other changes that would result in actually the 80% of seniors who aren't in Medicare Advantage getting a better deal. So we can address some of the broader issues, but I just want to focus on Medicare Advantage because I haven't seen an independent analyst look at this and say seniors are healthier for it or taxpayers are better off for it. That's what we're talking about reforming. We're not talking about cutting benefits under the Medicare program as is required under law. What we're talking about is Medicare Advantage. And it may be that some people here think that it's working. I know that there are some Republicans who are sitting at this table who don't think it's working. You can argue and say, okay, let's not do Medicare Advantage and let's not close the donut hole, for example. Or there may be other ways you want to spend that money, but I just want to establish whether we've got some agreement that the Medicare Advantage program, which is what we are proposing to reform, is actually not a good deal for taxpayers or for seniors, and certainly not a good deal for the 80% of seniors who aren't in Medicare Advantage, because, by the way, a premium of about $90 a year to subsidize the 20% who are in Medicare Advantage.
Mr. President, John McCain also would like to address that issue.
I'm sorry. So if somebody else wants to address it,
Just make one comment. Why in the world, then, would we carve out 800,000 people in Florida that would not have their Medicare Advantage cut? Now, I propose an amendment on the floor to say everybody will be treated the same. Now, Mr. President, why should we carve out 800,000 people because they live in Florida to keep the Medicare Advantage program and then want to do away with it?
I think you make a legitimate point.
Well, maybe...
I think you do.
Thank you very much.
Yeah.
Mr. President, let me just jump in for a minute.
I'm happy to respond.
I'm ready.
I'm going to Javier. In fairness, I asked a question, so I'm going to let one of the Republicans respond, and then I'll go to Javier. Okay, go ahead.
You know, the assumption, I think it's important for the American public to hear, we have Medicare Part D, except no senior in this country ever paid a tax dollar for it. And we're talking about filling a donut hole on a program that they're already benefiting from. We're going to leave $11 trillion in debt for our children. I'm not sure the seniors want us to leave more debt for their children to fill a donut hole. And when we talk about filling the donut hole by taking away from people who can't afford to buy a supplemental policy, that's where Medicare Part A helps poor people in Oklahoma, is they get to buy Medicare Part C. We never call it Part C, but that's what it is. And they don't have to buy a supplemental policy. So consequently, they get lots of the benefits that other people who have better buying power in Medicare with a supplemental policy. So it's a trade-off of whether or not we say, where are we going to give the benefits? What we really should be doing is saying, we're broke, Medicare's broke, we're working, struggling together to try to get there. Let's not add new benefits anywhere, and let's make sure the benefits that we have today get applied more equitably.
Well, I think that's a legitimate point. I would just point out that 80% of seniors are helping to pay in extra premiums for the 20% who are in this Medicare Advantage. And it's not means tested, so it's not as if the people who are in Medicare Advantage are somehow the poor people who can't afford supplementals. It's pretty random. And what we also know is, and I just want to point this out, Tom, 180 billion of it's going to insurance companies. It's not going to seniors. It's going to insurance companies, including big insurance company profits, so, without any appreciable improvement in health care benefits. That's not a good way for us to spend money. I agree with you about the fact that the prescription drug plan added to our deficits because we didn't pay for it. And I just have to point out that didn't happen under my watch. It happened under the previous Congress. There's some people, you know, John is an example of somebody who was true to his convictions and didn't vote for it.
I didn't vote for it.
But the fact of the matter is that you know, that was costly, and we do have to deal with that. On the other hand, the problem I don't think is that we gave seniors prescription drug benefit. I think the problem is that we didn't pay for it, and we should try to find a way to pay for it. Taking some of that money out of Medicare Advantage and putting it into that donut hole does pay for it. Yeah. All right, I really breached protocol here, but I thought that was important to just get clear. We are talking about Medicare Advantage in terms of where these cuts come from, not Medicare benefits through the traditional Medicare plan. Javier.
Mr. President, thank you very much for bringing us all together. And I do want to address something that my friend Paul Ryan said, because I almost think that we can't have this discussion any further without addressing something Paul said, and that, Paul, you called into question the Congressional Budget Office. Now, we could all agree to disagree, we could all have our politics, but if there's no referee on the field, right, we can never agree how the game should be played.
Let me clarify, just to be
let
clear.
me, if I could just finish. And so I think we have to decide, do we believe in the Congressional Budget Office or not? Because, Paul, you and I have sat on the Budget Committee for years together, and you have, on any number of occasions in those years, cited the Congressional Budget Office to make your point, referred to the Congressional Budget Office's projections to make your points, and today you essentially said you can't trust the Congressional Budget Office.
That is not what I'm saying.
Well, that was my interpretation.
No, let me be
I
clear.
apologize. I apologize if I misinterpreted.
I am not questioning the
if I could just
quality of their
finish
score.
my,
I'm questioning the reality of their score.
Okay, I take your point on your clarification.
Let me just say it.
But
10
if I
years of
could-
tax increases, 10 years of Medicare cuts to pay for 6 years of spending.
If I could just try to make my point. Okay. So then I'm assuming then that you do believe that the CBO is a legitimate agency to render decisions on spending for the Congress?
You know I believe that.
Okay, so then let's work with that. Because quite honestly, if we can't work with CBO numbers, we're lost. We're lost because then we really will get into a food fight. And so I apologize, Paul, if I misinterpreted what I had heard. I appreciate that we left the referee on the field.
I'll just
and so
simply
if the
say-
referee is on the field, then we have to at least accept what the referee has said. And the referee said that the bills that are before us reduce the deficit, the federal government's deficit, by over $100 billion in the first 10 years. The Congressional Budget Office, the referee, not political parties, the referee said that these bills reduce the deficit in the succeeding years, after the first 10 years, by over $1 trillion. Now, you're right. All the discussion makes it clear. It wasn't easy. There are going to be some savings that we extract out of Medicare. What we do in these bills is try to make the point that as we reduce the deficit, we're not going to put the onus, the burden of those cuts on seniors who receive Medicare. We're asking the providers to stop, as some of my colleagues on the Senate said, overutilizing or over spending in services so that we don't see someone having 4 different x-rays for chest pain. And so what we're trying to do is figure out the ways to reduce the costs without impacting benefits. In fact, that's how in these 2 bills that the Senate and House passed, we were actually able to close the donut hole for prescription drug coverage in Medicare and still extract, according to the CBO, over $100 billion in savings. So, Mr. President, I would just say the thing that I would love for us to get into the details of in terms of those deficit reductions that are made is the fact that we do it while putting the brakes on Medicare overpayments that went to insurance companies, which were getting reimbursed at greater levels than were doctors and hospitals that relied on traditional Medicare fee-for-service to provide services to our seniors. We have any number of provisions that deal with the issue of fraud, which it says at least total $60 billion. And working with some of our Republican colleagues, we're doing exactly that, going after the waste that's in the system, certainly the fraud, and that's how we extract a number of the savings. And finally, perhaps one of the unsung secrets of what we learned from listening to doctors and hospitals and all the different providers is that we can actually do a far better job of coordinating care for people. And if you make sure that someone who walks in the door of any one of the great physicians who were in this room when they were practicing and made sure that we followed them through not just that first visit to the primary care or family doctor, but then into the specialist, and then into the hospital, and then afterwards to perhaps the nursing home or the home health center, that what you do is if you coordinate the care instead of have each provider do just its share and forget about the patient, if you coordinate the care, you can actually reduce costs dramatically. And that's how we were able to reduce the cost for Medicare. That's how we were able to extract, according to the referee on the field, the Congressional Budget Office, over $100 billion in deficit reduction and over $1 trillion in deficit reduction in the second 10 years. So I believe, Mr. President, what we have is a chance to discuss how we can actually put this country back on a good fiscal track and still do right by our seniors in Medicare and increase the amount of people who get covered by health insurance by about 31 million.
Mr. President, we'll now turn to Chuck.
First of all, to clarify something, if anybody says that Medicare Advantage is a subsidy going to insurance companies, let me say what the statute says. The statute says that 75, with a bid differential where it goes, 75% goes to beneficiaries and benefits and 25% to the federal government.
I'm sorry, Chuck, I just want to make sure that I don't think that doesn't sound right to me, because that would mean 100% of it is going to either benefits or the federal government, which means the insurance companies
No,
aren't making any money.
75% to beneficiaries and benefits, and 25% to the federal government. We consider, I consider CBO God around here because it takes 60 votes in the Senate to overrule them. So I'm not questioning a CBO, but in regard to what Mr. Ryan said, I want to back it up with a quote from December 23rd letter from CBO about this double accounting. The key point is that the savings to the Health Insurance Trust Fund under the bill would be received by the government only once, so they cannot be set aside to pay for future Medicare spending and at the same time pay for current spending on other parts of the legislation. Then skip a couple sentences and say to describe the full amount of the HI Trust Fund savings as both, with emphasis upon both, improving the government's ability to pay future Medicare benefits and financing new spending outside of Medicare would be essential, double count a large share of those savings and thus overstate the improvement in the government's fiscal position. Now, you can argue about the exact amount of savings or whether there isn't any savings, but you can't argue that you can't count a dollar twice. You just can't argue that. That common sense tells you that. You don't even have to have an accountant tell you that. Now, I think what we want to remember here is that there are consequences to things we do. You change tax policy and there's consequences to tax policy. You decide you're going to save money in certain areas, there's consequences to that. So we have big tax increases. I think that without a doubt, when you put tax on labor, it's harmful and it doesn't do anything to create employment. Both bills hit small business with higher tax rates. The House bill by 33%, the Senate bill by 20%. The House bill hits small business harder, obviously. The Senate bill hits the middle class harder. It's a fact that when you do these things, you hurt the economy because small business is the machine that brings employment in America, 70% of new employment. We got to be careful how you treat small business. And small business can be, health care needs of small business can be taken care of with these association health plans and other things that can be done to make it beneficial. 35 states have high-risk pools. Most of them, 150%, is the maximum cost. So you can build on those high-risk pools to take care of people that have need, particularly those that are would be hit by the mandate and might not be able to afford the insurance without the high cost. The high cost of this bill comes from an unconstitutional mandate. It comes from the fact that for the first time in the 225-year history of the country, the federal government's telling you got to buy something. That just doesn't make sense to a lot of people at grassroots of the Midwest. And if you think I don't listen to my people, I've had 32 town meetings so far this year. I think I have a good feeling of what's out there at the grassroots. Now, we have unrealistic cuts in here. Not unrealistic from the standpoint of the way CBO scored them. Not at all. CBO's got around here. They say we give them policy, it's going to save X number of dollars, it's going to save X number of dollars. But do you think that we're going to sit around in rural America or even in urban, downtown urban America, in the poverty parts of the city, that we're going to let hospitals close down? And they raise the concern about access to health care. No, we aren't going to reduce benefits for seniors at all. But when you put our health care institutions and our delivery system in jeopardy, well, you're going to promise people health care they aren't going to get. You're going to put 14 or 18 million people under this bill into Medicaid. Medicaid pays about, in my state, I think about 60-some%. Medicare pays 80% of costs. Doctors don't take Medicaid. So you're going to promise 14 to 18 million people in Medicaid that they're going to be covered. But if you don't have doctors to service them, isn't that a little bit intellectually dishonest to promise something that you can't deliver on? And so there are these things in this bill, Medicare, Medicaid cuts, that I don't see any future Congress having any more guts than we do to close a rural hospital. So I think that you got to take into consideration, you've got to take into consideration the consequences of the acts or the unproven promises of cuts that aren't going to materialize. That's just the way I see it. And working in those 31 meetings, hundreds of hours of meetings with Senator Baucus, I learned a lot about health care. Now, we didn't get a bill out of that bipartisan effort, but I'm sure glad I spent all that time there, because I learned a heck of a lot about our health care system that I wouldn't have otherwise known.
Thank you, Chuck. I'm going to go to Kent next. I just want to make one point. If the notion is that we can't make some hard decisions about how entitlements work because it's just not realistic, nobody's going to have the guts to do it, then we're in big trouble. Because that means that the federal budget and state budgets and then business budgets and family budgets are all going to be gobbled up by this thing. So I hope that, in fact, we've got the courage to make some of these changes. Now, when I say that Medicare Advantage is not a useful way for us to spend tax dollars to provide health care to seniors, at least the way it's currently structured, as I said, that's not a Democratic idea. I mean, there are a whole bunch of Republican commentators and some of the folks who've sat around this table before who suggested that that's probably right. You can make an argument that whatever savings we get out of Medicare Advantage should not go to filling the donut hole, for example. That's a legitimate argument. You can make an argument that it should go just to deficit reduction. Those are all legitimate arguments, but my point is that the savings that are obtained here are from a program in which insurance companies are making a lot of money, but seniors who are in these kinds of programs are not better off. And the 80% of the people who are in these programs are paying an extra 90 bucks a year to subsidize the folks who are in them. And that just doesn't seem like a good deal for them or for the taxpayer. Ken Conrad.
Will you give me 30 seconds, please?
Sure.
Yeah. I think we've already had it laid out here in 4 or 5 different ways how a heck of a lot of money can be saved. And I think that those things that we can agree on, we ought to proceed on. But I think that it's legitimate to take into consideration that if you're going to have program cuts that CBO says out there in the second decade could be 15 to 20% a year, that you got to have a system left to serve the people that we're promising health insurance to.
But what I'm saying
and
is,
that's
Chuck,
the point I'm making.
I think it's a legitimate point. What I'm saying is that on Medicare Advantage, that does not have to do with the concerns that you've got about hospitals or doctors getting properly reimbursed. This is a program that's going to insurance companies. But I want to make sure that Kent gets in here, because Kent knows something about the budget as the chairman of the Budget Committee. Kent?
Well, thank you, Mr. President. Thank you for allowing us to come and visit about what really is the 800-pound gorilla facing the federal budget, and that is the health care accounts of the United States, Medicare, Medicaid, and the rest. What we all know that is true is the biggest unfunded liability of the United States is Medicare. What we all know is true is the trustees have told us Medicare is going to go broke in 8 years. So the idea that we don't have to do anything about Medicare is utterly disconnected from reality. The idea that we don't have to find savings in Medicare is an admission that we are headed for a fiscal cliff that we're going to go right over. And if we really want to endanger the benefits to people who are getting Medicare, the best way to do that is to do nothing. Because if we do nothing, we will guarantee that Medicare goes broke. So together, we can either do this together or we can have this imposed on us. I very much hope we do it together. Senator Coburn, and I'm sorry, did he leave? I'm sorry that he's not here, because he said something that I thought was one of the most important comments made here today, and something that I think has gotten way too little attention. And that's the question of those who are chronically ill. As we analyzed Medicare, we found a startling statistic. 5% of Medicare beneficiaries, 5%, use half of all the money. I think Paul knows this well. 5% use 50% of the money. Who are they? They're the chronically ill. People who have multiple serious conditions. And I think Dr. Coburn was really referencing that when he talked about the need to better coordinate their care, because we are wasting massive amounts of money and getting worse health care outcomes than we could if we better coordinated their care. What do we mean by that? A study was done with 20,000 patients. They put a care coordinator on each one of them. These are chronically ill patients. And what they found was by coordinating their care, and the first thing they did, by the way, is go into their kitchen tables, sit down, get out all their prescription drugs. On average, they found they were taking 16. They found that by looking at them, they could eliminate 8. The result was hundreds of thousands of dollars of savings per patient, better health care outcomes. You know, I did this with my own father-in-law in his final illness. Went to his kitchen table, didn't know it was his final illness, got out all his prescription drugs. Sure enough, he was taking 16. I get on the phone to the doctor. I go down the list. Dr. Coburn, you were out of the room. I referenced you because you said something that really triggered a thought in my mind that I think is important. Went down the list of what my father-in-law was taking, 16 prescription drugs. I get in the line to the doctor, and he says, well, Kent, I get down to about the third one. He shouldn't be taking that. He shouldn't have been taking that the last 5 years. I get a little further down the list, 2 drugs. He says, well, Kent, he shouldn't be taking those 2 drugs. They work against each other. I said, Doc, how does this happen? He said, Kent, it's very simple. He's got a heart condition. He's got a serious lung condition. He's got orthopedic issues. He's got doctors for each one of those. He's getting prescription drugs mail order. He's getting them at the hospital pharmacy. He's getting them down at the beach. He's sick and confused. His wife's sick and confused. We've got chaos. And my conclusion, after all of these hundreds of hours of hearings and meetings that Senator Grassley and Senator Baucus were part of and Senator Enzi, was that indeed we do. We have a system that is characterized, especially for those people, by chaos. We can do better, and we really don't have a choice, because we've got a debt now, a gross debt, 100% of our GDP, headed for 400%, that nobody believes is sustainable. So I just pray that we find a way to come together and deal with these things seriously, because if we don't, we will rue the day.
President, it's a little bit, if I might, I want to make sure that we're balancing off time between Democrats and Republicans here. So,
Mr. President. Well, I'm sorry.
And House and Senate as well. Well, John, go ahead.
Mr. President, I'm going to say thank you for having us here. I think it's been a useful conversation. And as I listened to you open up this meeting, I thought to myself, I don't disagree with anything that you said at the beginning of the meeting in terms of the premise for why we're here. The American families are struggling with health care. We all know it. The American people want us to address this in a responsible way. And so I really do say thanks for having us all here. I think our job, on behalf of our constituents and on behalf of the American people, is to listen. And I spend time in my district. I spend time a lot of places. I've heard an awful lot. And I can tell you the thing that I've heard more than anything over the last 6 or 7 months is that the American people want us to scrap this bill. They've said it loud. They've said it clear. And let me help understand why. First thing is we've heard from the 2 budget directors about our fiscal condition. We have Medicare that's going broke. We have Social Security that's going broke. We have Medicaid that is bankrupting not only the federal government, but all the states. And yet here we are having a conversation about creating a new entitlement program that will bankrupt our country. And it will bankrupt our country. It's not that we can't do health insurance reform to help bring down costs, to help save the system. This bill, this 2,700-page bill, will bankrupt our country. And secondly, Mr. President, I point out that I think this right here is a dangerous experiment. We may have problems in our health care system, but we do have the best health care system in the world, by far. And having a government takeover of health care, and I believe that's what this is a dangerous experiment with the best health care system in the world that I don't think we should do. So why did I bring this bill today? I'll tell you why I brought it. We have $500 billion in new taxes here over the next 10 years. At a time when our economy is struggling, the last thing we need to do is to be raising taxes on the American people. Secondly, we've got $500 billion worth of Medicare cuts here. I agree with Kent Conrad. We need to deal with the problem of Medicare. But if we're going to deal with the problem with Medicare and find savings in Medicare, why don't we use it to extend the life of the Medicare program, as opposed to spending that $500 billion creating a new entitlement program? But it's not just, Mr. President, the taxes or the Medicare cuts. You've got the individual mandate in here, which I think is unwise, and I too believe is unconstitutional. You've got an employer mandate in here that says that employers, you've got to provide health insurance to the American people, or you're going to pay this tax. It's going to drive up the cost of employment at a time when we have over 10% or near 10% unemployment in America. And beyond that, a lot of employers are going to look at this and say, well, I'll pay the tax, and they're going to dump their employees into the so-called exchange. Because that, in 5 years, every American is going to have to go to the exchange to get their health care. And who's going to design every health care bill offered in the exchange? Under this bill, the federal government's going to design every single health care bill in America within 5 years, once this bill were to pass. I could go on and on and on. Let me just make one other point. I'll save you. For 30 years, we've had a federal law that says that we're not going to have taxpayer funding of abortions. We've had this debate in the House. It was a very serious debate. But in the House spoke. And the House upheld the language we've had in law for 30 years, that there will be no taxpayer funding of abortions. This bill that we have before us, and there was no reference to that issue in your outline, Mr. President, begins for the first time in 30 years, allows for the taxpayer funding of abortions. So, Mr. President, what we've been saying for a long time is let's scrap the bill. Let's start with a clean sheet of paper on those things that we can agree on. Let's take a step-by-step approach that'll bring down the cost of health insurance in America, because if we bring down the cost of health insurance, we can expand access. Mr. President, I told you the day after, maybe it was the day you were sworn in as president, that I would never say anything outside of the room that I wouldn't say inside the room. I've been patient. I've listened to the debate that's gone on here. But why can't we agree on those insurance reforms that we've talked about? Why can't we come to an agreement on purchasing across state lines? Why can't we do something about the biggest cost driver, which is medical malpractice and the defensive medicine that doctors practice? Let's start with a clean sheet of paper, and we can actually get somewhere, and we can get it into law here in the next several months.
John, you know, the challenge I have here, and this has happened periodically, is every so often we have a pretty good conversation trying to get on some specifics, and then we go back to, you know, the standard talking points that Democrats and Republicans have had for the last year. And that doesn't drive us to an agreement on issues. There's so many things that you just said that people on this side would profoundly disagree with. And I would have to say, you know, based on my analysis, just aren't true, that I think the conversation would start bogging down pretty quick. Now, we were trying to focus on the deficit issue. And the fact of the matter is, as we indicated before, that according to the Congressional Budget Office, this would reduce the deficit. Paul has different ideas about it. Other folks may think that there are better ways of doing it. But right now what we're doing is focusing on the issue of federal entitlements and whether we can make some changes. I will come back to you, I think, at the end of this session to answer a range of the questions that you just asked. Right now, what I want to do is go to Jim Cooper, who I think everybody knows cares pretty deeply about the federal budget. He's been championing this for a very long time. Jim, do you want to address some of the issues that have been raised in terms of both Medicare and Medicaid?
Thank you, Mr. President. We're all here. We're dressed up. We're on good behavior. But I think folks back home are wondering how we behave when the camera's off. The deficit, in my opinion, is probably the most important single issue we face. Paul Ryan said it well. Health inflation is driving us off a cliff. And I'm kind of intrigued by the conversation because so far we've heard a lot of folks trying to outdo each other in deficit reduction. I welcome that competition, especially if it's backed up with votes. Because it's easy to talk tough on this. It's harder to deliver. I personally like Senator McCain's suggestion. Let's get rid of all the special deals. That's just a starting point. Paul Ryan is right again, and Tom Coburn is right when they point out that we're probably wasting a third of medical spending. Medicare alone is $37 trillion in the hole. And that means for all the folks who want to talk tough and not vote tough, that's not good enough. It means that for all the folks who want to do this next year or next decade or leave it to their successor, that's not good enough. We've had some examples of how we've behaved recently. A wonderful bipartisan measure, the Conrad-Gregg bill, completely bipartisan for years, and a bipartisan fiscal responsibility commission was brought up for vote in the Senate. We had the 60 votes, but only 53 people showed up for work. 7 people who'd been original co-sponsors of that measure suddenly got different ideas when the moment of truth came. So, Mr. President, I'm thankful you have appointed a presidential fiscal responsibility commission with Alan Simpson and Erskine Bowles to try to force us as a Congress and force the nation to address these fundamental problems. Because if you love Medicare, you need to act to save it fast. Every day matters. A report will come out issued by the Treasury Department. It's come out every year. It'll come out in the next few days. It's the only report that uses real accounting to describe America's fiscal problems, and the news is not pretty. It will reaffirm what's been discussed here about Medicare and Medicaid and other vital American programs being deeply in the hole. And the opportunity of cost for delay is extraordinary. So we can face these problems, Mr. President. We can solve them with political will, but the talking points won't do it. We've got to acknowledge the real questions. And as every business person in America knows, if you can't measure it, you can't manage it.
And too many people in the federal government are refusing to measure it, much less take the tough votes that are required. Because the reason we have a Medicare Advantage program, Mr. President, as you know, is in 2003, when the other party was completely in charge of everything here, we passed a program that, has been pointed out, was almost completely unfunded and added $8 trillion in one bill to our children and grandchildren. Now, those benefits, if offered, should be paid for. So this is a challenge for everybody in both parties, because nobody's hands are clean in this. Well, let's have a new day, a new beginning. I think we can do this. And this bill is a great place to start, because if you don't think this bill reduces the deficit enough, according to CBO, vote for more savings. If you want to reform Medicare some more, vote for it. Don't just talk a good game. So I hope the American people are watching, and they're going to be watching after the cameras are turned off too. And I'm thankful you called this meeting, because this is a moment of truth for our country. And together, we can solve this problem.
I want to see if there are any Republicans who want to speak. I still have Dick Durbin.
Mr. President, I think John McCain.
Thank you, Mr. President. And, I say to my friend from North Dakota, none of us want to do nothing, but we do want to start over. We've just had a discussion about the 800,000 carve-out and all of the other special deals and special interests that were included in this bill, which is more than offensive. But I want to talk about one specific issue on deficit reduction, and that is medical malpractice reform. Last year, Mr. President, you said, when you spoke to the Congress, you asked your distinguished Secretary of Health and Human Services to look at ways that we could address the issue, and then again this year, and I pay close attention to all of your speeches.
Thank you. That's more than Michelle does.
Thank you. And the point is that we don't have to go very far. There's two examples right now of medical malpractice reform that is working. One's called California, the other called Texas. I won't talk about California because we Arizonans hate California because they've stolen our water. But the fact is that Texas has established a $750,000 stack cap for non-economic damages, caps doctors at $250,000, hospitals at $250,000, and any additional institution $250,000, and patients harmed due to a finding of medical malpractice are not subject to any limitations on recoveries for economic losses. And I hope you'll examine it. But the important aspect of what they've done in Texas is the following. Lawsuit filings are down. Defensive medicine increases annual medical costs by 10%. They've saved 200 physicians. Recruitment is up. In the last 2 years, 6,945 new physicians have been licensed. 65% increase from 2 years preceding their reforms. 31% increase in recruitment of rural emergency medicine physicians. Amarillo lost 26 physicians in the 2 years preceding the legislation, has gained 37. The largest malpractice insurance company in the state slashed its premiums by 35%, saving doctors some $217 million over 4 years. There are now over 30 companies competing for business. It's already there. Now, all we have to do is enact this into legislation, and it's already been proven. So I don't think we have to experiment around. There are 2 states that have proven that you can enact medical malpractice reform and you can enact great savings and provide health care providers with the incentives they need. I'd just like to finally mention one other thing. There's an issue that's overhanging this entire conversation. We all know what it is. It's whether the majority leader of the Senate will impose the, quote, reconciliation with 51 votes. Now, having been in the majority and the minority, I prefer the majority. I understand the frustration that the majority feels when they can't get their agenda through. And it's real, and I understand it, and I have some sympathy. But I remember, and I think you do too, Mr. President, the last time when there was a proposal that we Republicans in the majority would adopt a 51-vote majority on the issue of the confirmation of judges. There was a group of us that got together, said, no, that's not the right way to go, because that could deal a fatal blow to the unique aspect of the United States Senate, which is a 60-vote majority. And then we came to an agreement, and it was brought to a halt. if a 51 vote reconciliation is enacted on 1/6 of our gross national product, never before has there have been reconciliation, but not at the level of an issue of this magnitude. And I think it could harm the future of our country and our institution, which I love a great deal, for a long, long time.
Okay, let me just address two of the points that you made, and then I'm going to turn to Dick. This issue of reconciliation has been brought up. Again, I think the American people aren't always all that interested in procedures inside the Senate. I do think that they want a vote on how we're going to move this forward. And, I think most Americans think that a majority vote makes sense. But I also think that this is an issue that could be bridged if we can arrive at some agreement on ways to move forward. Medicare, the issue of malpractice that you brought up. I've already said that I think this is a real issue. I disagree with John Boehner that, John, when you say that it's the single biggest driver of medical inflation, that's just not the case. The Congressional Budget Office took a look at the proposal you've got for medical malpractice and estimates that the government system would save about $50 billion over 10 years, which is $5 billion a year, which is real money, but understand that we've got a $2 trillion system. Let's assume that you extrapolate that into the private marketplace. Let's say it's another $5 billion or another $10 billion. It's still a small portion of our overall health inflation problem. But having said that, it's still something that I care about. And I've said I care about it. Now, not only have I asked Kathleen to initiate some pilot programs at the state level, but there are some examples of legislation that I actually would be interested in pursuing. Tom Coburn, you and Richard Burr have talked about incentivizing and allowing states to experiment much more vigorously with ways to reduce frivolous lawsuits, to pursue settlements, to reduce defensive medicine. That's something I'd like to see if we could potentially get going. So I might not agree to what John Boehner's proposed, and it's interesting that I think I've heard a lot today about how we shouldn't have Washington impose on the states ideas, except when it comes to the ideas that you guys like, in which case it's fine to override what states are doing. There seems to be a little bit of a contradiction on this, but I think there may be a way of doing it that allows states to tackle this issue in a very serious way. And I'd be interested in working with you, John, and working with Tom to see if we can potentially make that happen, if we can arrive at a package that also deals with the other drivers of healthcare inflation that are so important. Now, we're running out of time. I've got Dick Durbin. And then what we're going to just do is go into coverage, and that will, I know that Henry and John and Charles have been interested in talking about it, and frankly, is something that we haven't spoken a lot about lately, and that is a whole bunch of people who just don't have health care. Okay.
Mr. President.
Go ahead, Dick.
I've been biding my time throughout this entire meeting. I thank you for inviting us on the issue of medical malpractice. Before I was elected to Congress, I worked in a courtroom. For years, I defended doctors and hospitals, and for years, I sued them on behalf of people who were victims of medical malpractice. So I've sat at both tables in a courtroom. At least many years ago, I think I kind of understood this area of the law better than some. But I listen time and again as our friends on the other side, when they're asked what are the most important things you can do when it comes to our healthcare system in America, the first thing they say is medical malpractice. It's the first thing they say. Today it was the first thing that was said. The point that's been made by the President is if we do believe the Congressional Budget Office, when Orrin Hatch asked them, how much will we save if we implement the Republican plan on medical malpractice from the House, they said $54 billion over 10 years. $5.4 billion a year is a lot of money, except in the context of a $2.5 trillion bill that we pay each year for health care. It represents 1/5 of 1% of the amount of money we spend each year on health care. The Congressional Budget Office said something else. They said, and as you lose accountability for what the doctors and hospitals are doing, more people will die. 4,800 a year, according to the Congressional Budget Office's reference to this study. Now, the Institute of Medicine tells us 98,000 people a year die in America because of medical malpractice. I think there are things that we have put in this bill to change that. Most of you have heard of this Dr. Gawande. We've read him. I've talked to him on the phone. His checklist manifesto is a very basic approach to reducing medical errors, which is what we should be focused on. And I want to say, Mr. President, I think what you and the Secretary have done is the right thing, incentivizing states to find innovative ways to reduce medical errors and reduce those lawsuits that should not be filed. But let me tell you what, limiting the recovery for pain and suffering for someone who is entitled because they're innocent victims to be paid, isn't eliminating junk lawsuits. I will tell you that as far as the President's concerned, in his neighborhood there is a great hospital, which I will not name, and at this hospital a woman went in for a simple removal of a mole from her face, and under general anesthesia the oxygen caught fire, burning her face. She went through repeated surgeries, scars, and deformity. Her life will never be the same. And you are saying that this innocent woman is only entitled to $250,000 in pain and suffering. I don't think it's fair. Our jury system makes that decision, and the states, 30 of them, have made a decision on what to do. If you were asked in basic question, over the last 20 years, has the number of paid malpractice claims in America doubled or been cut in half? If you listen to most people here, you'd say they must have doubled. No. According to the Kaiser Foundation, they've been cut in half. Oh, but how about the money that's being paid for these malpractice claims? Clearly, that's gone through the roof. No. Between 2003 and 2008, the total amount paid for malpractice claims in America was cut in half, from $8 billion to $4 billion. This is an important issue. I don't dispute it, and I think we have treated it as an important issue. But to make it the overriding issue is to, I think, really trivialize some of the other things that should be part of this conversation. I've been asked to speak about deficit reduction. I will not, other than to say one general thing. When I hear my friend John Boehner say that we have the best health care in the world, I don't dispute it for a moment. If I were sick, this is the country I want to be in, with these doctors, these hospitals, and these medical professionals. But step back for a second and look at who we are in this room. As was said many years ago, the law in its majestic equality forbids both the wealthy and the poor from sleeping under bridges. When it comes to the wealthy in health care, per capita, we're the wealthiest people in America. The Federal Employees Health Benefit Program, administered by the federal government, setting minimum standards for the health insurance that we enjoy as individuals and want for our families, is all we're asking for in this bill for families across America. If you think it's a socialist plot and it's wrong, for goodness sakes, drop out of the Federal Employees Health Benefit Program. But if you think it's good enough for your family, shouldn't our health insurance be good enough for the rest of America? That's what it gets down to. Why have this double standard? Tom Harkin is right. Why do we continue to discriminate against people when we know that each one of us is only one accident or one diagnosis away from being one of those unfortunate few who can't afford or can't find health insurance?
All right. What I'd like to do is this. It is now 3:45. I said we'd try to get out of here 4:15. We have not spoken about coverage, and we're going to need to wrap this up. I know that some people may be on a tight schedule. I'm going to ask that people are willing to stay till 4:30, which gives us 45 minutes. And what I'd like to do is to round out this conversation by focusing on what I think is probably at the core one of the bigger philosophical disagreements between the parties in how we address health care moving forward. I think we've identified one already, which is the issue of insurance and minimum standards. And that was a debate surrounding the exchange. That was a debate that we discussed when it came to being able to buy insurance across interstate lines. I think the second issue, which Eric Cantor alluded to earlier, John Boehner just alluded to, is the issue of coverage. And that is, can America, the wealthiest nation on earth, do what every other advanced nation does, which is make sure that every person here can get adequate health care coverage, whether they're young or old, whether they are rich or poor. And, you know, I think that the effort in the House and the Senate has been to control costs, to reform the insurance industry, to deal with some of the structural deficit issues surrounding entitlements, and to do that all in a context in which everybody is getting a fair shake. And right now, frankly, there are 30 million people who don't have health insurance at all. There are a whole bunch of people who aren't added to that list who all they have is a catastrophic plan, and again, they never go to visit a doctor unless they're really sick. The way we tried to do it was not a government-run health care plan, Paul. I mean, that was, you know, some good poll-tested language that has been used quite a bit, but the fact of the matter is that, as Dick just alluded to, the way we've structured it through the exchange would be to allow people to pool, allow everybody to join a big group, and for people who can't afford it, to give them subsidies, including small businesses. And so the question is whether there is a way for us to arrive at an agreement that would reach those people. John Boehner, I looked at your bill. I think, as I said, there's some overlap on some issues. But when it comes to the coverage issue, the Congressional Budget Office says yours would potentially increase coverage for 3 million people, and the efforts of the House and the Senate would cover 30 million. So that's a 27 million person difference. We can have an honest disagreement as to whether we should try to give some help to those 27 million people who don't have coverage. So that's, I think, the last aspect of this, and this is probably going to be the most contentious because you know, there is no doubt that providing those tax credits to families and small businesses cost money. And we do raise revenues in order to pay for that. And it may be that the other side just feels as if, you know what, it's just not worth us doing that. But one of the things I hope we don't do is to pretend that somehow for free we're going to be able to get those 30 million people covered. We're not. You know, if we think it's important as a society to not leave people out, then we're going to have to figure out how to pay for it. If we don't, then we should acknowledge that we're not going to do that. But what we shouldn't do is pretend that we're going to do it and that there's some magic wand to do it without paying for it. So with that, what I'm going to do is I will go to whoever you want first, Mitch.
Mr. President, Dr. John Barrasso is going to make our opening statement on coverage.
And then I will call Henry Waxman, and we'll just go back and forth.
Thank you very much.
And because we are short on time, let's keep our remarks relatively brief.
Well, thank you very much, Mr. President. For people who don't know me, I practiced medicine in Casper, Wyoming for 25 years as an orthopedic surgeon taking care of families in Wyoming. I've been the chief of staff of the largest hospital in our state. My wife is a breast cancer survivor. Bobby's been through 3 operations, a couple of bouts of chemotherapy. We've seen this from all the different sides of care. And this discussion needs to be about all Americans because everyone is affected, not just people that don't have insurance. And I've had dozens and dozens of visits to senior centers and town hall meetings and visited at service clubs. And if you go to any community in America and you ask the question, do you believe that this bill up here, that this bill will, if it becomes law, do you believe you will pay more for your health care? You personally, every hand goes up. And then you say, do you believe if this bill becomes law, overall health care and the spending in the country will go up? Every hand goes up. And then you ask the most personal question of all, do you believe if this bill becomes law, the quality of your own personal care will get worse? Every hand goes up. And most worried of all are the seniors when you go to the senior centers.
because they know there's going to be $500 billion taken away from those who depend upon Medicare for their health care. And it's not just Medicare Advantage. It's hospitals, it's the doctors, it's the nursing homes, it's home health, which is a lifeline for people that are home alone. It's hospice for people in their final days of life. That's all going to be cut. That's why the seniors are most concerned. And even the White House own actuary says, you know, if this goes into play, 1 in 5 hospitals, 1 in 5 nursing homes will be operating at a loss in 10 years. That's what we're looking at. Now, for 25 years practicing medicine, I never asked anybody if they were Republican or a Democrat or an independent, didn't ask if they had insurance or not, took care of everybody. And many, many doctors, I know Dr. Coburn, Dr. Bustani, do that. We take care of everyone, regardless of ability to pay. Doctors work long hours, nurses work long hours. And Mr. President, when you say with catastrophic plans, they don't go for care until later, I say sometimes the people with catastrophic plans are the people that are best consumers of health care and using the way they use their health care dollars. Because a lot of people come in and say, you know, my knee hurts, maybe I should get an MRI, they say, and then they say, well, will my insurance cover it? That's the first question. And if I say yes, then they say, okay, let's do it. If I say no, then they say, well, what is it going to cost? And what's it cost ought to be the first question. And that's why sometimes people with catastrophic health plans ask the best questions, shop around, are the best consumers of health care. But to put 15 million more people on Medicaid, a program where many doctors in the country do not see them, as Senator Grassley said, you know, you say, how are you going to help those folks? And Mr. President, you know, when I talk to doctors, I say, I have a way, put all the doctors who take care of Medicaid patients under the Federal Tort Claims Act. That will help them because they're not getting paid enough to see the patients. But if they're Medicare, if they accept those patients and then their liability insurance is covered under the Federal Tort Claims Act, I think you'd have a lot more participation in that program. I do believe we have the best health care system in the world. That's why the premier of one of Canadian provinces came here just last week to have his heart operated on. He said, it's my heart, it's my life. I want to go where it's the best, and he came to the United States. It's where a member of parliament, a Canadian member of parliament with cancer came to the United States for her care. They all have coverage there, but what they want is care, so coverage does not equal care. What we heard from Senator Conrad is also right. Half of all the money we spend in this country on health care is on just 5% of the people. Those are people, for the most part, that eat too much, exercise too little, and smoke. And as a result, we need to focus on those people. So the focus ought to be on the best possible care. People are happy with the quality of care they get and the availability, but they sure don't like the affordability because it's not affordable. And, you know, Mr. President, the first week in medical school, we got our stethoscopes, and the professor of cardiology who just died this past year, he said, this is to listen. This is to listen to your patients. Listen to their heart, listen to their lungs, but it's a constant reminder to listen to them. Listen to what they are telling you. And it means to listen to the other people in the room. If you're seeing a child, listen to what the mother is saying. If you're with an elderly person, listen to what their adult child is saying. It's a constant reminder to listen. And I have great concerns that people around this table are not listening to the American people and are fearful of the consequences of this large bill, which is why only 1 in 3 people of America support what is being proposed here. And that's why so many people, Mr. President, are saying it's time to start over.
I mean, let me just, there's one thing I've got to, there are a number of issues as usual that I've got significant difference with. I just am curious. Would you be satisfied if every member of Congress just had catastrophic care? You think we'd be better health care purchasers? I mean, you think, is that a change that we should make?
Yeah, I think actually we would. We'd really focus on it. You'd have more, as we say, skin in the game.
Because
people would, and especially if they had a savings account, a health savings account, they could put their money into that, and they'd be spending the money out of that.
Would you feel the same way if you were making $40,000 or you had that was your income? Because that's the reality for a lot of folks. I mean, it is very important for us, when you say to listen to that farmer that Tom mentioned in Iowa, to listen to the folks that we get letters from. Because the truth of the matter, John, is they're not premiers of any place. They're not sultans from wherever. They don't fly in to Mayo and suddenly, decide they're going to spend a couple $1 million on the absolute best health care. They're folks who are left out. And this notion somehow that for them, the system was working, and that if they just ate a little better and were better health care consumers, they could manage, is just not the case. The vast majority of these 27 million people or 30 million people that we're talking about, they work every day. Some of them work 2 jobs. But if they're working for a small business, they can't get health care. If they are self-employed, they can't get health care. And you know what? It is a scary proposition for them. And so we can debate whether or not we can afford to help them, but we shouldn't pretend somehow that they don't need help. I get too many letters saying they need help. And so I want to go to...
Mr. President, having a high deductible plan and a health savings account is an option for members of Congress and federal employees.
That's right, because members of Congress get paid $176,000
employees
a year.
Did take advantage of that.
Because
it's the same
members
plan
of Congress,
that the park rangers get in the Yellowstone National Park.
John, members of Congress are in the top income brackets of the country. And health savings accounts, I think, can be a useful tool, but every study has shown that the people who use them are folks who've got a lot of disposable income. And the people that we're talking about don't. So I'm going to go to Henry. Henry Waxman.
Mr. President, I just wonder if some of our Republican friends would like to have seniors on Medicare have catastrophic coverage only. I'd say to the seniors in this country, and we've heard mention of them being the people who are worried about this Medicare, this health care bill, they ought to worry if we don't do something. Because not only will we hear ideas of putting them on catastrophic coverage only, because that'll save a lot of money, Paul Ryan has a proposal right now to say that Medicare recipients in the future ought to have just a little voucher, and then they can shop for their own insurance. They could be prudent shoppers. Well, yesterday I had a hearing with some people who were supposed to be prudent shoppers. There are people from California who were told by Anthem WellPoint that their insurance was going to go up 39%. And could you imagine, seniors, if you have to go shopping with your voucher and then you're told, oh, by the way, this private policy that you're going to have to buy just went up 39%? And the way to save the federal government money is to shift it on to the seniors. That's where we're going if we don't do anything. Now, what do we do that makes sense? We've got to hold down health care costs. You can't, we had some ideas that we seem to agree about to hold down health care costs. One idea I did find peculiar, and that's to have the medical malpractice issue at the federal level. And the Republican proposal is to adopt the California law. Well, the California law is in effect. It's been in effect since the 1970s. And Californians are faced with a 39% increase, so it isn't holding down their health care costs. We got to really look at holding down health care costs. That's hard to do unless we have insurance reform so we can get more people buying health care. I thought Tom Harkin just summed it up so well. All these issues go together. If you don't bring more people in to be covered, and you segment the groups that are covered in high-risk pools, they pay more money. Everybody else is going to get a break. Well, under the Republican proposal, the people who get a break for insurance are the people who are healthy. The people who have to pay more are the people who are sick. Is that what we want in this country? Now, I hear people all day say, Mr. President, the public doesn't want your plan. Well, if I heard the kind of rhetoric over and over again that I've heard from some of the Republicans, I wouldn't want your plan either. A federal takeover of health care? That's not what's being proposed. Somebody said that people ought to be able to buy a policy that suits their needs. Well, how many people are going to come forward and say, I don't want certain things covered, and then find out that they're sick and they need that coverage? We need to have a market like the federal government employees, like members of Congress. We know what we can choose. If somebody wants to choose a health savings account, that means because they want to put some of their money away because it's tax-free and it's just a really great deal if you got a lot of money. But most people want to know they're going to have necessary medical coverage for the doctors and the hospitals when they need it. And you have something that's basic to everybody. Well, they ought to have that for people who are buying private insurance as well. We had 3 witnesses yesterday. A woman told us that in her family she had a child with a hole in his heart, and that because that became a pre-existing condition. So she has health insurance coverage to this individual market. But she says, I barely use it because I'm afraid to use my health insurance. She's now told she's going to have this 39% increase. She said her health insurance is going to cost her about as much as her mortgage payment each month. She's afraid to drop it because she doesn't know where she could ever get health coverage again. Another woman had asthma, and that was considered a pre-existing condition. She was going to face a 39% increase as well. Now, if they were pooled with everybody else in that small business and individual market, which is what our bill does, then there are more people buying insurance and there's more leverage. It's spreading the costs, not making people have to pay more of these costs. The people who we're talking about are people in small businesses where the small business can't get insurance because, well, they got one employee with a real serious medical problem, so nobody in that group's going to get coverage. The employer can't afford it. Or women cost more for small businesses if they're in that workforce, especially if they're older. They don't want to get coverage. They don't want to give them coverage either. We have single adults, a lot of them not very healthy, dealing with chronic conditions, parents and families living on low incomes. They need help from Medicaid. We have to hold down the cost by bringing everybody into the system. Now, in Medicare, what does our bill do? It protects the solvency of the program for an additional 7 to 9 years. For Medicare, we close the donut hole, which means that when seniors have to pay for those prescription drugs, they don't have to do it all on their own. We keep them with a Medicare policy, and we provide preventive services, and they don't have to pay for them because we know preventive services will keep us from having to pay for more costly care. This bill is good for people on Medicare, and if we don't get this bill passed, they're going to get squeezed like crazy. This bill is good for the American working people. This bill is good for our health care system. And for us to take the Republican proposal, we'd cover, instead of 30 million people, 3 million. We wouldn't hold down the deficit a bit. We would still have all those pre-existing conditions that would keep people from getting their insurance coverage. Maybe if people go and pretend to be patients, we could stop some of those false claims. But I'm sure those false claims happen in the private insurance market, not just the public insurance market. But not only are we covering more people, we're doing innovative ways to deliver the care that will make it less costly. And as we develop innovative ways to deliver care, especially with chronic care, that will hold down the costs of care, and those ideas will be picked up by the private sector. They always follow what Medicare does, and then they adopt it because they want to hold down costs. So you can't solve any problem. Insurance reform, holding down costs, protecting Medicare, dealing with the deficit, unless you deal with it all. And Mr. President, you're not going to be able to do this piecemeal. And I have doubts about whether the Republicans are going to help you, because I haven't heard a lot of willingness to come and work with you now, or did I hear it a year ago? Well, I hope I'm wrong.
I'm going to be equal opportunity here and say, you know, we're not making campaign speeches right now. And I think your points I agree with, but I still think that There's a lot of areas of agreement that we've discussed so far. This is an area, though, that in which we do have some philosophical disagreements. Mr. President. And so what I think it's I want to go to a Republican. The question I would ask to my colleagues, my friends on the Republican side, would be, are there areas of coverage for people who don't have health care that you would embrace and agree with beyond what has been presented in Republican leader Boehner's bill? There may not be. I mean, that may be sort of the threshold at which all of you think we can afford to provide help to people who don't have coverage, but there may be some other ideas that haven't already been presented or aren't embodied in your legislation, John, that I'd be happy to hear about.
I want to yield to Peter Roskin from Illinois.
Thank you, Mr. President. Thanks for your hospitality. You know, for the benefit of the group, I want to take you for a couple of minutes to an experience that I had with then State Senator Obama in the state of Illinois when he took on a very controversial initiative regarding the death penalty situation. And lest you think that death penalty is sort of a junior varsity issue, it's not. It's crimes, it's claims of innocence, it's penalties forever. And then State Senator Obama approached Republicans and said, look, let's fix this. Let's recognize the problem here. Let's fix it. But it was very different than what I sense is happening today. What I sense is happening today is what is it going to take for you Republicans to vote for our bill? That's the subtext that I'm getting. My sense is that this is a problem of message. It's not a problem with the messenger. We've got an incredibly skilled messenger who has been out these past several months in joint session speeches and a whole host of other venues, interviews, talking. You've all seen it, you've all participated, you've all listened. And I think the American people, when the conversation first began about expanding coverage, lowering costs, were actually hopeful. And it wasn't just a bumper sticker. I think they were actually hopeful about what was going to be happening. And they listened, and they listened, and they listened. And my sense, now I can't speak for every one of your districts, but in my district, they've become increasingly disappointed with what they have seen come out of this process. And this is not a prop. This is the Senate bill. And my district says, you know what? That's sure looking like just something that's now being popped in the microwave, taken out, a little salt, a little pepper, some Republican breadcrumbs on the top, and put it back in front of the public to say, well, do you like it now? And my district really doesn't. I don't know. I suppose you represent some districts that do. And I think one of the problems to get to this coverage issue is that the premise of this bill is that coverage is expanded through Medicaid welfare. Speaker Pelosi a couple of minutes ago, or a couple of hours ago, actually said that health care reform is entitlement reform.
No. Yes.
Yeah. I would put a brighter light on that and say it's entitlement expansion. Think about what we're doing. You know, the CBO, when they wrote to Harry Reid, wrote to Senator Reid a couple of months ago, they said, look, there's about 15 million people that are going to be put on Medicaid. And Medicaid is a house of cards. Medicaid is not something that is serving the public very well. Their state controller in Illinois, and we all come from states with real trauma. State controller in Illinois recently wrote that as bond rating agencies continue to downgrade Illinois rankings to the lowest in the nation, the state can't afford further jeopardizing. This bill, Section 2001 of the Senate bill, takes away all the flexibility as it relates to changes in Medicaid. That is making our states, I think, ultimately hidebound in how they approach these things. This is something that, in my view, isn't sustainable. Governor Brian Schweitzer of Montana said, let me give you a quick quote, one of the least effective programs in terms of health care in the history of the country is called Medicaid. About 20% of America is on a Medicaid program, and they'd like to shift, they, meaning Washington, would like to shift it and grow it to somewhere around 25 or 30%. Now, Medicaid is a system that isn't working. Almost everyone agrees. But what Congress intends to do is to increase the number of people on Medicaid so that they can do it on the cheap. It isn't working for anybody. Look, the foundation of the expansion is Medicaid. And in my view, and I think the view of folks in my district, and I think many, many people across America, it is a flawed foundation. And we can do much, much better. A Republican proposal that's out there would reduce the number of uninsured by 3 million people. So, look, you've heard it today in many, many forums. Remember the old, in closing, you remember the old game you used to play as a kid, Etch-a-Sketch? And you'd start out with the Etch-a-Sketch, that little thing where you try and draw something and you dial the dials, and over a period of time, the more you dialed, the more crazy it looked, and then finally you'd say, oh, let's just go like that and do the Etch-a-Sketch. I'll tell you what, a year's worth of work, and this is what has come up with, the American public, as far as the ones that I have heard from, are vehemently opposed to this. And they say, look, take the Etch-a-Sketch, go like this, let's start over, let's do incremental things where there's common ground. I yield back.
I want to make sure that everybody gets an opportunity to speak, but I just want to caution everybody, it's now 4:15. There are a number of folks who haven't had a chance to speak. You know, the question I had was, were there ideas about expansion beyond the 3 million that was in Leader Bonnier's bill, and I didn't get an answer on it. So in addition to, and it may be that the answer is that's all we can do. I should point out this one issue about Medicaid that I think that's important. Most of the people we'd like to be in the exchange and giving them subsidies. And I think over time, what you see as an evolution, if you created a large enough pool where people could purchase it through an exchange, the same way that members of Congress do. The problem we've got right now is that very poor people, they've got coverage through Medicaid. And it's somewhat flawed. There are problems with doctor reimbursements. There are problems long-term in terms of solvency, both for the state and the federal level, so all those things need to be fixed. But the fact of the matter is, if their kid gets sick, they can go to a doctor. The people who are really left in the cold are working families who make too much for Medicaid and don't have anywhere to go. That's the group that right now is getting the worst deal. They're paying taxes, they're working, but they've got nowhere to go. Now, for those 15 million people who've got nothing, I promise you, they would say to themselves, having some coverage through Medicaid is a pretty good deal. I'd prefer to have them in an exchange where over time we've got everybody in a pool, similar to the pool that members of Congress enjoy. But that's not the situation that we have right now. I just want to remind everybody, though, that the group that is being left out, because you threw out the word welfare, which is, you know, one that obviously most American people, they don't want to be part of welfare. The fact of the matter is that very poor people right now have coverage that is superior to what a lot of folks who make a little more money or working very hard, trying to support their families, do not. Now, I know that Max has been trying to get in for a while, but there are some other folks that haven't had a chance to speak, so I want to call on them first. And then if I've got time, Max, I'll allow you to wrap up. But I'm going to go to, I've got Chris and Murray, Chris and Patty Murray on our side, as well as Charlie Rangel, who want to speak. And what we'll do is we'll alternate to make sure that we've got, and I know that Joe Barton is interested in speaking as well, and there may be a couple other Republicans.
Can I follow, Jim?
Okay. Go ahead.
Well, thank you, Mr. President. I'll try and keep this brief and turn it over to Patty, so we'll take the time for one person and divide it between two. Let me first of all thank you as well, and thank all of our colleagues who've done this. It's been tremendously helpful, I think, today. It's been said earlier, maybe it needs to be focused as well. I like many of you, like all of you here, in my state, there are 31 hospitals, and they're terrific people. Whether or not the quality of care is equal for everyone in this country is certainly questionable, but certainly the quality of the people who are our health care providers, the nurses, the doctors, and others, do an incredible job every single day. And in a sense, I was struck when Congressman was talking about the death penalty issue that was debated some time ago in Illinois. I think most of us around this table here would agree today that every person, if they're confronted with a legal problem, has a right to a lawyer. That's something we've accepted as a country. It's somewhat ironic, I suppose, and history may judge us accordingly, that while everyone is entitled to a lawyer, regardless of what you've been charged with, that you don't have a right to a doctor. And yet, at the same time, we acknowledge that we provide care. If you show up in an emergency room, we take care of you. And that's a great testimony about who we are as a people. The problem is, of course, that the cost associated with that. I think there's a false assumption that that's one group of people and they're out there and they have no impact on what happens to those who have insurance today, and somehow they should be taking better care of themselves, they should quit smoking, they should eat better, they should get a job, that somehow the responsibility rests with them. If you even accept that, which I don't, the fact of the matter is that sector of our population affects everyone else. It costs us about $248 billion a year in lost productivity when you have increased numbers of uninsured people in the country. At this very hour, there's a cost with every single insured person in this country of roughly $1,100 a year. To pay for that cost of that person showing up in that emergency room or getting that care, that's a hidden tax that Americans are paying today when people show up for that kind of support. There are, today before this, we wrap up and go back to our offices and go back to our homes this evening here in the District of Columbia. 14,000 of our fellow citizens will have lost their health care today. And every day that we're here debating and discussing this, 14,000 Americans lose their health care. Roughly 6 to 8 people will have lost their lives today as we gather around this table because they're uninsured, based on a Harvard study and National Science Foundation study, that we lose that many people on a daily basis because they lack health insurance. So there are tremendous costs associated with this. Henry said it well, Tom said it well, and Mr. President, you certainly encapsulated it very well. These are not segmented issues. And while incremental approaches are something I generally support and approach after 30 years here in dealing with major issues, but this issue defies incremental approach. You can't get from one point to the next incrementally unless you deal with it holistically. And that's really what we're trying to do. Now, you may disagree about whether or not we're doing too much in mandates or too much here and there, and that's a legitimate debate. But you can't get to affordability, you can't get to quality, you can't deal with the major economic issues if you don't deal with coverage. You just can't. There's no way to do it. You've got to have broadening coverage if you're going to have any effort or any successful effort in reaching those questions. Lastly, I'll just say this to you. A guy in my state, Kevin Galvin. Kevin he employs 7 people, a maintenance operation in Hartford, Connecticut. He wanted to provide health care. And like the stories you've all heard, he lost a fellow of 24 years because the guy had a health care issue. He finally had to take less pay, took another job because there was health care provided. But Kevin did more than just tell me a story about himself, Mr. President, what happened to his 7 employees because he couldn't get health care. He went out in my state of Connecticut and organized 19,000 small businesses, and they changed the law in Connecticut regarding pooling in small businesses. Because here was a small business guy who wanted to take care of his people and watched tragically day after day what happened to individuals because he could not provide it for them any longer. And I think people like Kevin Galvin exist in every district, in every state, who want to provide that health care, understand how valuable it is to them, their productivity, and of course the importance of their employees. But coverage is the critical issue. We know that in the next 10 years, factually, Mr. President, in the next 10 years, every state in this country will have a 10% increase in uninsured people. We know that in 30 states in our country in that same 10-year period, there'll be a 30% increase in the uninsured. And half the population under the age of 65 will at one point or another in the next 10 years be without insurance. So it's not some isolated group out there. This is the critical constituency that is the sort of the linchpin that holds all of this together. So coverage is absolutely critical.
Thank you, Mr. President. I want to commend you for asking us to come here, and I will say that never have so many members of the House and Senate behaved so well for so long before so many television cameras. So if we ever get to a conference committee, we may want you to be the moderator. I do think, though, that There is a fundamental difference in the vision that you and your friends on the majority have put forward and the vision that myself and those of us in the minority have put forward. It's the fundamental role of government. We believe that we should use free markets to empower people and give them choices. And for the best of intentions, yourself and most of your allies in the Democratic Party seem to believe that the government, either through a mandate or through a regulatory requirement, knows better and will do better for health care for most Americans. Now, whether you have a mandate or simply give the Secretary of Health and Human Services the ability by regulation to require something, that's a difference that's a distinction without much of a difference. So the 6 common sense ideas that various Republicans have put out here is not incrementalism in the sense that it doesn't go together, but it does not radically change the basic health care system of America. If you give the ability to sell insurance across state lines and prevent a state from precluding it, if the insurance company can prove that it's solvent and that it will pay the benefit, health care costs will go down in that state and premiums will go down. There's a study just out that in the state of California, health care premiums would go down 50% if Californians could buy insurance from Nevada or Oregon. If you create a catastrophic high-risk pool and put the cap on it that Leader Boehner did on his alternative on the House floor and allow small businesses to create the kind of pools that we've talked about, you're going to be able to give those Americans who can't get insurance because of a pre-existing condition and want it the ability to get into those things, and their premiums will not go up catastrophically. They will not go up astronomically. And one of the things that we seem to have an agreement on, according to yourself and Senator Durbin, is medical malpractice. Now, your proposal and the House bill and the Senate bill pay lip service to medical malpractice, but they don't really do it. Again, if you take the Boehner proposal that was put together and put up on the House floor, and it's based on what's happened in Texas, which put in medical malpractice reform in 2003, premiums for medical malpractice have gone down 27%. Texas has gained 18,000 doctors since this reform was put in. There are 55 rural counties in Texas that now have an obstetrician. If that is extrapolated nationally, you're not going to save the $54 billion that Senator Durbin alluded to and that yourself alluded to if you combine the direct savings with the indirect savings because the price of practicing defensive medicine goes down. You probably save $150 billion a year. Now, that's real money. So what we're saying, Mr. President, we're not talking about incrementalism. We're talking about, as Leader Boehner said, and Senator McConnell said, let's start over in the sense that we change the vision and work together to do the things that we agree upon, but do it in a way that doesn't destroy the fundamental market system that's made the American healthcare system the best in the world. And if we do that, we can make a deal.
Well,
thank you, Mr. President. Thank you, Leader Boehner.
Joe, I'll respond to you right at the end because I think we should wrap it up. You're right. The proposal that John Boehner's put forward doesn't radically change the existing system. And that, I think, is why 3 million out of the 30 million who don't have coverage, or 40 million, don't get coverage. The proposal that's been put forward by the House and the Senate Democrats also doesn't radically change it in the sense that the vast majority of people who currently have health care will still get it. It's just they'll see it a little cheaper. People who do not have coverage will start getting it. So it's not neither of these proposals are radical. The question is which one works best for the American people, and that's what we'll see if we can determine. We're running short on time. I know that some folks are going to, at some point, have to get going. I'm going to reserve the prerogative of making sure that everybody who has not had a chance to speak is allowed to speak. And then I will wrap up. That means that we're probably going to go a little bit later than we had anticipated, but as I said, by the standards of Washington, we're still in the ballpark here. I'm going to call on Charlie Rangel first. We'll go to one of our Republican colleagues. Patty Murray is going to have an opportunity to speak. Again, there may be some comments. There may be some other Republicans who are interested in speaking. We'll go to, we're going to actually go to Ron Wyden first. Then we're going to go to another Republican, and we're going to end with John Dingell, who was there when the idea of everybody having health care was first introduced by his father many decades ago.
Mr. President, why don't you just call on Republicans who haven't talked, because some of them have talked numerous times.
I agree, but I want to make sure that they may want to respond to whatever is said. Go ahead, Ron.
Thank you very much, Mr. President, and I think this has been a very constructive session. For the last 6 hours, we have essentially heard Republicans talk about incremental coverage and Democrats talk about comprehensive or broader kind of coverage. And I want to outline something that I think could bring both sides together for just a couple of minutes. First, on the incremental point, the evidence shows that incremental reform not only does less, it costs more. And the experts that both Democrats and Republicans rely on have found this. The Lewin Group, for example, that Republicans quote from, they say that, and both sides use them. Also, history. We have been doing incremental reform in this country since 1994. Since the blow-up of the Clinton plan, that's exactly what we've been doing. And costs have been gobbling up everything in sight, in the private sector and in the government. So I would submit that instead of this debate about incremental reform, comprehensive reform, we could all be for real reform. And real reform, in effect, changes the incentives that drive the system and particularly empower the consumer. And Mr. President, I've been very pleased that you've constantly been coming back to the system for members of Congress. Folks, all of us can fire our insurance company, every one of us. And as far as I'm concerned, we've got to stay in this battle until everybody in the United States has that right to hold the insurance companies accountable and to fire them. And one of the promising points you made this afternoon, Mr. President, that I appreciate is the point on interstate shopping, because this is another opportunity, in my view, done properly to empower the consumer. Now, colleagues, our system, the one that we enjoy, already allows interstate competition for health insurance. That's the way the federal system works right now. And there are good consumer protections. So, Mr. President, when you made that offer to all of us today to work with us on this, not only am I going to follow up on what I think is a very gracious offer to try to bring both sides together, it allows us to build on the exchanges that we have today, which begin to empower people with more choices and competition. And if we just keep building on that, starting with this effort to bring both sides together on interstate competition, looking, in my view, at the federal employee system to do it, I think we can resolve a lot of our differences. So I appreciate the opportunity to speak, Mr. President. I want colleagues to know that I'm going to be following up with both sides of the aisle this afternoon in your administration to bring this group together.
Mr. President.
Yeah.
All of my members have had a chance to speak at least once, several of them a number of times. John Kyle reminds me that HSAs, for example, are not exactly for rich people, that the medium income of a user of a HSA is $69,000 a year. all of us are representatives of the American people, but I have a feeling we haven't been listening to them very carefully. Congressman Roscom mentioned what the people in his district think, and I expect all of you are experts on what the people in your districts think. But we know from the polling that's been done in this country how the American people feel about this 2,700-page bill. We know how they feel about it. This is not a close call. If you average all of the polls in America, we know that the American people oppose this proposal on an average of 55 to 37%. They have also been asked, and we keep reading in the newspaper that where we're headed next is to the reconciliation approach. Gallup also asked that question. They explained to the American people what it meant, so they understood what this word that we use around Washington actually means. And in the Gallup poll, American people were opposed using that, 52 to 39. So this has been a fabulous discussion, Mr. President. We have a lot of experts around the room, but I think it's really important, since we represent the American people, that we not ignore their view on this. They have paid attention to this issue like no other issue since I have been in the United States Senate. Health care is a uniquely personal issue. Obviously, you get more interested in the subject the older you get, but every American cares deeply about the quality of their health care and access to health care and cost of health care. They have followed this debate like no other, and they have rendered a judgment about what we have attempted to do so far. The solution to that is to put that on the shelf and to start over with a blank piece of paper and go step by step to see what we can agree on to improve the American health care system, which is already, as all of us agree, the finest in the world.
I'm just going to make this remark, and then I'm going to call on Patty Murray. I'm going to save the two lions of the House here for the end. Because there's been a lot of comments from every Republican about the polls and what they're hearing from their constituents. And as I said, I hear from constituents in every one of your districts, in every one of your states. And what's interesting is actually when you poll people about the individual elements in each of these bills, they're all for them. So you ask them, do you want to prohibit pre-existing conditions? Yes, I'm for that. Do you want to make sure that everybody can get basic coverage that's affordable? Yes, I'm for that. Do you want to make sure that insurance companies can't take advantage of you and that you've got the ability, as Ron said, to fire an insurance company that's not doing a good job and hire one that is, but also that you've got some basic consumer protections? Yes, we like that. Polls, I think, are important in taking a temperature of the public. If you polled people and asked them, is the system working right now, and should we move forward with health reform, they'd also say yes to that. And my hope had been, and continues to be, that based on this conversation, there might be enough areas of overlap that we could realistically think about moving forward without a situation in which everybody just goes to their respective corners and this ends up being a political fight, because this is something that really has to be solved. We've got 3 people who have not had an opportunity to speak today. If you don't mind, I would like to, in the interest of time, just go ahead and let each of them speak. If there's an intervention that somebody on the Republican side wants to make, then I will recognize them. And then I will allow anybody of your choice, Mitch, to wrap things up. I think Speaker Pelosi may want to say just a quick summary of what she's thinking, and then I will talk a little bit about next steps. And if everybody could keep their remarks relatively brief, that'd be very helpful. Patty.
Mr. President, thank you. And this has been, I think, a very good discussion. And I think all of us come to this table today having heard a lot of stories and talked to a lot of people and bring their passions with us today. And I certainly am one of those. And Every time we talk about this, every time I think about this, I remember a little boy that I met last spring who was 11 years old, whose name was Marcellus, and he told me that his mom, single mom, taking care of him and his 2 younger sisters, was going to work every day, had a job managing a fast food restaurant, was doing okay, but she got sick. And when she got sick, she had to take time off from work, and because she was missing so much work, she lost her job. When she lost her job, she lost her health care, and because she lost her health care, she couldn't get in to see a doctor, and sadly, Marcella's mom died. I think about him every time we talk about this bill. And what happened to her is happening to so many Americans who, when they get sick today, don't have any choices. They have nowhere to go. Either they don't have insurance, or they've been denied insurance because they have a pre-existing condition, or they're a small business whose premiums have gone up so dramatically that they can no longer afford to provide it for their employees. Too many Americans today are in a box and they don't have a choice. Frankly, it's why so many Americans today are passionate about a public option. It was a choice for them that they felt was important to them. But in the bill that you have presented and that we've been working on that is so important is it finally gets some people out of that box of no choices. By giving them an exchange that they can go to, by taking care of the insurance reform so they're not denied coverage, by opening up community health centers so people have choices, by making sure that we lower the cost for all Americans, because when we provide coverage for 30 million Americans, it lowers the cost of everyone who has insurance today by $1,000 a year a family. This is why this is so important, and what I have listened for today is whether the alternative proposal that has come before us gives people those choices that they need. And that's what I'm listening for, and I go back to Marcellus and I think, will that proposal make sure that nobody loses their mom again because they didn't have a choice? And that's why it's so important that we move forward with what we have and open that door for so many Americans.
Thank you.
Mr. President, Dr. Coburn.
Tom was great.
I just was going to summarize shortly because we were talking about if we don't think about what the key goal is, the key goal is to reconnect purchase and payment so we become good purchasers. Whether we create what system we do, if we don't reconnect the mechanism of payment with purchase, we're not going to get good value out of our healthcare system. And I outlined 1 out of every $3 that doesn't help anybody get well, doesn't prevent them from getting sick. And there's enough potential there in that pool of money that we don't have to have the government run it. What in fact we can do is we can create and allow that money for everybody to have the kind of access that Senator Murray wants that individual to have. The thing that I think draws us apart is the level of involvement in the government in making those choices. And I would just put forward to you that we ought to have another talk like this as we can get closer and closer on some ideas, because we all want the same thing, but how we get there, whether or not we're in charge of it or the individual patient's in charge of it, personally making their own choices with the asset value that is capable based on what we're already spending in healthcare. We don't need to spend a penny more in healthcare in this country. What we need to do is spend it much more wisely and much more effectively.
Okay. I'll pick up on some themes in my close. Charlie Rangel.
Thank you, Mr. President, and I appreciate the fact that you saved the best for last.
Absolutely.
I had really hoped that when we came here that we were really going to push over the top. We are so close to national health insurance. We are so close to allowing people that go to work every day and don't know what could happen to them, whether they lose their job and lose their health insurance. I know that they call the Senate the upper house, but I was amazed how it seems as though they believe the American people only listen to those from Wyoming and Kentucky. But having said that, for my New Yorkers, even though we have more self-confidence that we need, I would want
them to know that they are Americans, and we do listen to them, and that the states that oppose this great plan doesn't speak for all of America. Having said that, some people have called those who oppose us as being the party of no. I don't think so, notwithstanding the fact we got 5 Republicans from the Ways and Means Committee here at your summit. Now, when we spent hundreds of hours in 3 committees and Ways and Means, and there wasn't one bill before us. And I would think that instead of taking the president's time, that this is where the House and the Senate would take care of legislative business, especially if we agree on 70%. For God's sake, then for the 10 or 20%, why do you say scrap what we got unless it ends up with that you have made up your mind that we're not going to have a health bill? And then I would say that most all of America would find it not more difficult to understand why the bill is so big or why we use reconciliation. I think one of the big problems America would have is, why does it take 60 to get a majority? And I have to explain, well, that's the Senate, and they're different than most Americans in understanding it. So what I would hope would happen is that we leave here not thinking that we're going to start all over. We can't get back those times. This is the last year for a whole lot of people in the House of Representatives who we believe we represent the people too. Why can't we take what we've agreed to? I mean, sick people, scared people are not Republican and Democrats, they're Americans. And you've made it abundantly clear that you have the same sensitivity, you recognize the fiscal crisis, you know what can happen to our country if we're not educated, if we're not strong in a healthy way. Have staff or somebody bring together those issues that cannot be contradicted in terms of what you want. And I know you want more than just 3 million people insured. You can explain why it's difficult for you to do it. But I know you would want to achieve having most all Americans or all Americans with the same health benefits, because that's so important. And then, Mr. President, after we start learning to agree with each other, and it's not a question of no, but it's the Congress working its will for the good of people, then we can work out, and God knows Mr. Kemp and I have tried desperately hard, and Jim McCreary before him, to realize people aren't concerned with the debate. They're concerned with what are we going to produce. And I don't care what your color is, I don't care what your party is, that if you're sick, and you don't check out the doctor. And they're not going to check out whether or not you're Republican or Democrat. So I just hope that we can change this to a positive thing where you can say, let's leave here at least talking about what we agree on. Let's stop knocking each other as who's the smartest and who's the most patriotic. And let's really then confine the public argument to where we disagree. And rest assured, I can assure you that they won't be concerned with how big the bill was. I have no clue as to how big the Social Security bill was, how large, how many pages was in the Medicare bill. And I don't really think that someone sick in the emergency room is concerned about the size of the bill that we are trying to help them with. So I appreciate this. And
John Dingell.
Mr. President, thank you. And God bless you for your leadership in this matter. The country desperately needs you and desperately needs this legislation. I saw a cartoon. 2 people are sitting down, and one of them says, terrible news. Our health care rates are going to go up 40%. The other guy says, don't worry. Good news is you're not concerned because you have pre-existing conditions. This solves both problems, the bill. And Mr. President, again, we desperately need your lead. Now, having said that, when my dad started out on this years ago, Harry Truman said, you know the reason people don't have health care in this country? They can't afford it. And he was right. And it's still the case today. I saw this morning a statement that was made with regard to starting over. This comes from a respected Republican leader, Governor Schwarzenegger, California, February 23rd, 2010. I think any Republican that says you should start from scratch, I think that's bogus talk and that's partisan talk. I think we need to buckle down and get to the business of solving the biggest problem that this country has coming down the road at us. In 2025, the cost of a family's health insurance is going to double, $25,000. I don't know anybody can afford that. You can argue about Cadillac plans and other nonsense. That's not going to be important. And in 2080, the cost of all of our health care is going to equal the gross domestic product. That's a recipe for disaster. We have much in common, I want you to know, and I hope and pray you'll take a look. We cover young adults under their parents' insurance. That's a Republican offer. We prohibit dropping insurance coverage when the patient gets sick, but we don't. And the Republicans do too, but they don't cover pre-existing conditions. Both of us prohibit annual and lifetime limits. High-risk pools we have and they have. But high-risk pools carry with them some risk because it constitutes an incentive for a race to the bottom, whereby people will move their insurance companies to a place where they have the least regulation and the least protection for the consumers. And it also includes, and amongst the other 14 items where we're agreed on, is the availability of health savings accounts. There are a lot of other things here that we have and we need. I would say that I've seen some of my friends who I knew before they were virgins. They were pushing, for example, use of the extraordinary budgetary mechanism, and as to get this decided by 51 votes. Seems like a great idea. And I'm curious, why in the name of common sense are we being so fussy about having the decisions in the People's House and the People's Senate decided on a basis of a simple majority, 51 votes? And if there's something wrong with that, I wish somebody would tell me why we ought not give the people that kind of representation. I would note that also mandatory coverage mandates. That was in a bill introduced by my good friend Bill Thomas, Chairman of Ways and Means Committee, and 20 members of the U.S. Senate. They said, and they were not fussy about that. And I think we ought to look to see, here we have a chance to serve the people. I have people coming to my office with tears in their eyes. They can't get coverage. They have pre-existing conditions. A young dental surgeon I knew couldn't get health care. Why? Because she'd had breast cancer years before. She couldn't get care. And I've seen a lot of other cases like that. People who would have drive-through pregnancies or drive-through mastectomies and all manner of high-handed abuse by the insurance companies. I'm always surprised when I can find somebody that's defending the insurance companies after the things that they do to the ordinary people in this country. They could cancel your insurance policy while you're on the gurney headed into the operating room. If somebody would explain that to me, I would be deeply grateful. But the fact of the matter is, we have a chance to do something that Dan Webster one time observed. I thought it was a very useful thing that he said, and I think we ought to say it. He said, "Let us see whether we also, in our day and generation, may not perform something worthy to be remembered." It's on, Madam Speaker, as you well know. It's on the wall of the House of Representatives. It's there for us in the House, and my colleagues in the Senate will know it. Those of you who I see again and have served with us will recognize that as something. We have before us a hideous challenge. The last perfect legislation that was presented to mankind was delivered to the Israelis at the base of Mount Sinai. It was on stone tablets written in the fingers of God. Nothing like that has been presented to mankind since. What we're going to do is not perfect, but it's sure going to make it better, and it's going to ease a huge amount of pain and suffering at a cost which we can afford, which has been costed out by the Office of Management and Budget and the Congressional Budget Office, saying it's budget neutral. It in fact reduces the budget. I beg you, my friends, let us go forward on this great task.
Thank you, John.
Thank you, Mr. President.
Speaker Pelosi wants to say a brief word. John, do you want to say anything in closing? And then I will wrap up. Nancy.
Thank you very much, Mr. President. As one who has abided by the 3.5 minute, I'm going to take a few seconds more now in closing to extend thanks to you, Mr. President, for bringing us together, for your great leadership, and without it, we would not be so very close to affordability, accountability for the insurance companies, and accessibility for so many more Americans to improve their health care, to lower their cost. Mr. President, I hearken back to that meeting a year ago. At that time, Senator Grassley questioned you about the public option, and you said the public option is one way to keep the insurance companies honest and to increase competition. If you have a better way, put it on the table. Well, I bring that up because we have come such a long way. We're talking about how close we are on this, how far apart we are here. But as representative of the House of Representatives, I want you to know that we were there that day in support of a public option which would save $120 billion, keep the insurance companies honest, and increase competition. We've come a long way to agreeing to a Republican idea, the exchanges. Senator Enzi has been a leader in that. Senator Snowe, along with Senator Durbin, had legislation to that effect, a bipartisan, because the insurance companies opposed the public option. They couldn't take the competition. We have in our bill market-oriented, encouraging to the private sector initiatives. I think the insurance industry, left to its own devices, has behaved shamefully, and we must act on behalf of the American people. We have lived on their playing field all this time. It's time for the insurance companies to exist on the playing field of the American people. I believe I have news for some of my colleagues, because we have very much more in common. Senator Coburn, you had so many positive suggestions, which I didn't hear much else of, but from you we did. And I think you'd be pleased to know that after much debate in our House, we came up with value, not volume. Others have called it quality, not quantity, in terms of utilization, overutilization. Senator McCain, when you talk about Florida, we're talking about addressing the regional disparities in terms of compensation and health care. So we have addressed many of these issues in the bill. I think it's really important to note, though, and I want the record to show, because two statements were made here that are not factual in relationship to these bills. My colleague, Mr. Leader Boehner, the law of the land is there is no public funding of abortion, and there is no public funding of abortion in these bills, and I don't want our listeners or viewers to get the wrong impression from what you said. Mr. Camp, you said that the Medicare cuts in this bill cut benefits for seniors. They do not. They do not. So I want the record to show, just in those two cases, where we may have differences of opinion and of approach and evaluation of the value of different things, but certain things are facts about our bills that I cannot let the opposite view stand when they are stated. Yes, it's hard to do this. Misrepresentation campaign that is going on about these bills, it's a wonder anybody would support them, as Mr. Waxman said. But the fact is, as the President said, many of these provisions on their own are largely supported by the American people. So this will take courage to do. Social Security was hard. Medicare was hard. Health care reform for all Americans, insurance reform is hard, but we will get it done. And as we leave this debate, I think that many of the differences that we have are complicated, and they're legitimate. They're differences of opinion about the role of government and the rest. But I think it's really clear on one point that the American people understand very clearly They understand that there should be an end to discrimination on the basis of pre-existing conditions. The proposals that we have put forth end discrimination on the basis of pre-existing conditions. The Republican bill does not. With that, Mr. President, I thank you again for the opportunity to discuss the differences and to try to find some common ground on this.
Well, listen, this has been hard work, and I want to first of all thank everybody for being here and conducting themselves in an extraordinarily civil tone. And as I said, given the number of folks that were around this table, the fact that we're it beats my prediction. Here's what I'd like to do, and I'm going to take about 10 minutes. I want to go through where I think we agree, and I want to summarize where I think we disagree. And then I'll address some of the process issues that have been brought up by a number of the Republicans. We agree that we need some insurance market reforms. We don't agree on all of them, but we agree on some of them. I think that if you look at the ones that we don't agree on, since there's been a lot of reference to what the American people want, it turns out that the ones that are not included in the Republican plans right now, but are included in the Democratic plans, are actually very popular. I know there's been a discussion about whether a government should intrude in the insurance market, but it turns out that on things like capping out-of-pocket expenses or making sure that people are able to purchase insurance even if they've got a pre-existing condition, overwhelmingly people say the insurance market should be regulated. And so one thing that I'd ask from my Republican friends is to look at the list of insurance reforms and make sure that those that you have not included in your plans right now are ones, in fact, that you don't think the American people should get. Because I strongly believe in these insurance reforms. I've talked to too many families who have health insurance and find out that what they have does not provide them with the coverage they needed, and they end up being bankrupt, or they end up going without care, or they get care too late, as was the case in the story that Patty Murray mentioned. The second thing I think we agree on is the idea that allowing small businesses and individuals who are right now trapped in the individual market, and as a consequence have to buy very expensive insurance and effectively oftentimes just go without insurance, could be solved if we allowed them to do what members of Congress do, which is be part of a large group. Again, the idea of an exchange is not a government takeover. It is how the market works, which is if you have a lot of purchasing power, you get a better deal. That's how Walmart drives its prices down, because everybody who wants to supply Walmart, Walmart tells them, you give me the best deal possible. And as a consequence, the supplier gives them a much better deal than they do the mom and pop shop in the corner. Well, we should be able to give small businesses and individuals who are self-employed, who aren't able to get insurance through a large employer, to have that same deal. It sounds like we've got some philosophical difference as to whether there should be some minimum benefits in that exchange, some baseline of coverage. Again, there's a baseline of coverage for members of Congress, and the reason we set that up is because we want to make sure that any federal employee who's part of this big pool is getting good quality coverage. Not perfect coverage, not gold-plated coverage, but adequate coverage. It may be, and I'd ask my Republican colleagues to look and see, is that an area that can be resolved? There's been a lot of discussion, and one of the main tools the Republicans have offered to drive down costs is purchasing insurance across state lines. This is an idea that is embodied in the House and Senate bill, but again, the details differ. The approach that John Boehner and some of the Republicans appear to take is to say, let's just open things up. Anybody can buy anything anywhere, regardless of what state insurance laws are, and that will drive competition and cost. The philosophical concern I have on that is that you potentially get what's been referred to as a race to the bottom. And for people who may not be following the intricacies of the insurance market, let me give an example that people understand, and that's credit cards. In the credit card market, part of what happened was we ended up allowing people to get credit cards from every other, whatever state, and there were a few states that decided, you know what, we're going to have the least restrictions on credit card companies that we could have. And what ended up happening was that every single credit card company suddenly, lo and behold, started locating in that state which had the absolute worst regulations and consumer protections. And all these fees and practices that people don't like, folks weren't happy about. So the question I'm going to have is there a way for us to deal with the interstate purchase of health insurance, but in a way that provides, again, some baseline protections? Because what we don't want is a race to the bottom. We want everybody to have the basic protections that make sense. And that's not a big government takeover. That is a standard thing that we do in almost every area of life. We protect people with respect to the food that they buy, with respect to the drugs that they purchase. We license and regulate the medical profession because we don't think anybody should just be able to cut somebody open. We want somebody like Tom or John to actually know what they're doing before they start practicing medicine. And the same should apply when it comes to how we think about insurance. Medical malpractice has been mentioned. Now, look, let me be honest. This is something historically that Democrats have been more resistant to than Republicans. I will note that when we had a Republican president and Republican controlled the House and the Republican controlled the Senate, somehow it didn't happen, and I'm surprised. But
we needed 60 votes in the Senate, too, Mr. President.
See there? So as a consequence, what I have suggested is that we explore building on what we've already done administratively without law, asking Kathleen to help states come up with new ideas. I've suggested, well, let's take a look at, Tom, the suggestion you had that gives states even more incentive to start thinking about reducing defensive medicine. I have to tell you, Joe Barton, that how you got from $5 billion to $150 billion, I didn't quite follow the math. It sounded, I'm not sure you did either, but it's okay. But here's my commitment, is that if folks were serious about getting this done, I'd be interested in seeing if we could work on something. I actually agree with Dick Durbin with respect to hard caps because of the story that he told about the woman who burned her face. I think there are situations in which there is actually a very severe problem. And I would distinguish that between some of the frivolous lawsuits that are out there that really do create a defensive medical problem. And OB-GYNs are the ones who get hit the hardest because people are so sympathetic when a child is born with severe disabilities, and it can just be crippling on OB-GYNs. The same is true for neurologists and so forth. So there may be some ways that we can work on that. Now, I guess what I'm saying is I've put forward then very substantial ideas that are embraced by Republicans. Peter, they're not, I forget what metaphor you used about before you popped it in the microwave, whether it was bacon bits or sprinkles or breadcrumbs. That was what it was. When it comes to the exchange, that is a market-based approach. It's not a government-run approach. There were criticisms about the public option. That's when supposedly there was going to be a government takeover of health care. And even after the public option wasn't available, we still hear the same rhetoric. And it turns out that what we're now referring to is we have an argument about how much we should regulate the insurance industry. We have a concept of an exchange, which previously has been an idea that was embraced by Republicans before I embraced it, and somehow suddenly it became less of a good idea. With respect to the most contentious issue, I'm not sure we can bridge the gap, and that's what we're going to have to explore, and that's the issue of how do we provide coverage not only for people who don't have health insurance right now, but also for people who have pre-existing conditions and are being priced out of the market, or potentially lose their jobs and will find themselves in a situation where they don't get coverage. An interesting thing happened a couple of weeks ago, and that is a report came out that for the first time, it turns out that more Americans are now getting their health care coverage from government than those that are getting it from the private sector. And you know what? That's without a bill from the Democrats or from President Obama. It has nothing to do with quote-unquote Obamacare. It has to do with the fact that employers are shedding employees from health care plans. And more folks, if they can, are trying to get into the Social Security system and the Medicare system earlier through disability or what have you, so that they can get some help. The point that Tom Harkin made, the point that Chris Dodd made, the point that Henry made, and a number of other people made, I think is very important to understand. I did not propose, and I don't think any of the Democrats proposed, something complicated just for the sake of being complicated. We'd love to have a 5-page bill. It would save an awful lot of work. The reason we didn't do it is because it turns out that baby steps don't get you to the place where people need to go. They need help right now. And so a step-by-step approach sounds good in theory, but the problem is, for example, we can't solve the pre-existing condition problem if we don't do something about coverage. Now, it is absolutely true, and I think this is important to get on the table, because we dance around this sometime. In order to help the 30 million, that's going to cost some money. And the primary way we do it is to say that, for example, people who currently get all their income in capital gains and dividends, they don't pay a Medicare tax, even though the guy who cleans the building for him does on his salary or his wages. And so what we say is if you make more than $250,000 a year, if you're a family, and your income is from those sources, then you should have to do the same thing that everybody else has to do. Somebody mentioned the fact that we say to small businesses, I think John Kyle, you said, we're taxing small businesses. Look, we exempt 95% of small businesses from any obligations whatsoever, because we understand that small businesses generally have a tough time enough. They don't need any more government burden. What we do say is, if you can afford to provide health insurance, you have more than 50 employees, meaning you're in the top 4% of businesses, and you're not providing coverage, and you're forcing other businesses or other individuals to pick up the tab because your employees are either going to the Medicaid system or they're going to the emergency room, we don't think that's fair. So we say you've got to pony up some. It's not an employer mandate. It just says you've got to pay your fair share, because otherwise all of us have to pick up the tab. And that, by the way, contributes to the overall deficit that Medicaid is running. In fact, most small businesses through this program get huge subsidies by becoming members of the exchange. That's where the money's going. The money's not going to some big welfare program. The money is going to give tax credits to small businesses, tax credits to those who are self-employed to buy into this pool. And that's not a radical proposition. It's consistent with the idea of a market-based approach. And finally, with respect to bending the cost curve, we actually have a lot of agreement here. This is an area where if I sat down with Tom Coburn, I suspect we could agree on 95% of the things that have to be done. Because the things you talk about in terms of, and I wrote some of them down, in terms of reducing medical errors, in terms of incentivizing doctors to coordinate better and work in groups better, in terms of price transparency, improving prevention. Those are all things that not only do I embrace, but we've included every single one of those ideas in these bills. Now, the irony is that that's part of where we got attacked for a government takeover. Because what happened was when we set up the idea of a MedPAC, which is basically a panel of doctors and healthcare experts who would recommend ways to make the delivery system better so that we can squeeze out that 1/3 in Medicare and Medicaid that's wasted, a Republican idea, that was part of the ammunition you all used to say that the government's going to take away your health care. So if we're serious about delivery system reform, if we're serious about squeezing out the waste that Tom Coburn referred to, you should embrace those mechanisms that are in this bill. I will end by saying this. I suspect that if the Democrats and the administration were willing to start over and then adopt John Boehner's bill, we'd get a whole bunch of Republican votes. And I don't know how many Democratic votes we'd get, but we'd get a whole bunch of Republican votes. The concern, I think, that a lot of the colleagues, both in the House and the Senate, on the Democratic side have, is that after a year and a half, or more appropriately after 5 decades of dealing with this issue, starting over, they suspect, means not doing much or doing the proposal that John Boehner or other Republicans find acceptable. And that it's not possible for our Republican colleagues to move in the direction of, for example, covering more than 3 million people. It's not possible to move more robustly in the direction of dealing with the pre-existing condition issue in a realistic way. It's not possible to make sure that we get people out of a high-risk pool and get them into a situation where, as Tom Harkin put it, healthy people, young people, rich people, poor people, old people, sick people, everybody is part of a system that works. That, I think, is the concern. Having said that, what I'd like to propose is that I've put on the table now some things that I didn't come in here saying I supported, but that I was willing to work with potential Republican sponsors on. I'd like the Republicans to do a little soul searching and find out, are there some things that you'd be willing to embrace that get to this core problem of 30 million people without health insurance and dealing seriously with the pre-existing condition issue. I don't know, frankly, whether we can close that gap. And if we can't close that gap, then I suspect Mitch McConnell and Harry Reid, Nancy Pelosi, and John Boehner are going to have a lot of arguments about procedures in Congress about moving forward. I will tell you this, that when I talk to the parents of children who don't have health care because they've got diabetes or they've got some chronic heart disease. When I talk to small business people who are laying people off because they just got their insurance premium, they don't want us to wait. They can't afford another 5 decades. And the truth of the matter is that politically speaking, there may not be any reason for Republicans to want to do anything. I mean, we can debate what our various constituencies think. I know that, I don't need a poll to know that most of Republican voters are opposed to this bill and might be opposed to the kind of compromise we could craft. So it'd be very hard for you politically to do this. But I thought it was worthwhile for us to make this effort. We've got a lot of other things to do. I don't think, Tom, that we're going to have another one of these because people don't have 7, 8 hours a day to work some of these things through. What I do know is this: if we saw movement, significant movement, not just gestures, then you wouldn't need to start over because essentially everybody here knows what the issues are. And procedurally, it could get done fairly quickly. We cannot have another year-long debate about this. So the question that I'm going to ask myself, and I ask of all of you, is there enough serious effort that in a month's time or a few weeks' time or 6 weeks' time, we could actually resolve something? And if we can't, then I think we've got to go ahead and make some decisions, and then that's what elections are for. We have honest disagreements about the vision for the country, and we'll go ahead and test those out over the next several months till November. All right? But I very much appreciate everybody being here. Thank you for being so thoughtful, and hopefully we'll all keep our constituents in mind as we move forward. Thank you, everybody.
Thank you.